workshop. Um, Yesterday we had a day one, and looking at so many fantastic talk. Today we'll continue with two more sessions to then close the symposium style of the workshop. And then Wednesday, Thursday, and Friday will be practical activities happening across multiple sites in West Africa, in Nigeria, in Ghana, in Togo, and also in multiple sites within Nigeria. Uh, Today we are going to be focusing on two sessions: knowledge exchange and industry, and we're also going to be looking into crop and livestock improvement and health. Dr. Ubong Peters will be opening the session today as a keynote speaker, and he will be talking about decoding cancer, and of course, looking into molecular pathways and the future of drug development in the genomics era. Dr. Peters is the lead clinical scientist oncology at MGI-Tech and is a member of the Roche Group. Dr. Peters, we are really happy to have you here and to speak to so many African scientists. This is the African BioGenome Project that aims to sequence at least about 100,000 endemic African species, and this is happening locally on the African continent. Over to you, please speak to us about your work and also the future of drug development in this era.
Yeah, thank you very much for that kind introduction, and good morning, everyone. I'm really grateful for the opportunity to join you at the African BioGenome Project, West Africa's regional workshop. Today's keynote will explore how genomic sequencing is transforming our understanding of cancer and revolutionizing how we discover and develop and deliver medicines. And this has ushered in an era of precision medicine where we aim to give the right drug to the right patient at the right time, and you might even add the right dose. So by the end of this session, I hope you'll walk away with a clearer understanding of the genetic and molecular origins of cancer, and you'll gain some insights into how genomic medicine is changing cancer research and treatment. And we'll also look at how drug discovery and development is evolving in this genomic era. And we'll get a sense of the opportunities and challenges for applying genomics in Africa. All right, here are my disclosures. Before we get technical, I'd like to briefly share this slide, just talking about my journey from my early education in Nigeria to my current role at Genentech here in South San Francisco, California. And this is really geared towards the students and the trainees in the room. I hope my path reminds students that success is possible. So with hard work and perseverance and focus, doors will open, and sometimes the world will meet you halfway. So just keep working hard, and I hope this inspires you to continue that journey. All right, so let's look at the pharmacy of the pre-industrial era before we dive deep into the current era, this genomic era that we are in. So let's take a step back into history. And before science-based regulation, the drug market was really a wild frontier. So you had products like the Hamlin's Wizard Oil and Clark Stanley's Snake Oil Liniment. They were advertised as miracle cures, and there was absolutely no scientific backing to justify those claims. And so some of these medicines contain dangerous substances like cocaine, morphine, atropine, even alcohol. And they were marketed for children, as you can see this child here in this advertisement. And so these absurd claims and drug levels were outrageous promises. You know, like, for example, you had here where it said, there is no sore it will not heal. And they're talking about how it is magical in its effects. These were not treatments. These were marketing gimmicks. But that led to a turning point with the birth of the FDA back in 1906, when President Theodore Roosevelt signed the Pure Food and Drugs Act. creating what we now know as the US Food and Drug Administration, the FDA, which would be equivalent in Nigeria to NAFDAC. And that really marked the beginning of science-based drug regulation to ensure that patients who were taking these medicines were safe and the drugs were efficacious and were effective. So today, drug discovery follows a very rigorous process. It begins with target identification. So what molecular mechanisms are we trying to interrupt or modulate? And then we move into hit finding, then to hit to lead, and then lead optimization, where chemists and biologists refine the compound structure and properties. Promising candidates then move into the preclinical testing. This is often done in cell lines and animal models. Um, and so if the data supports safety or potential safety and effectiveness, we move into human clinical trials. And human clinical trials have three phases. There's phase 1, phase 2, and phase 3 clinical trials. And if the trials meet the endpoint that we define, it's a predefined endpoint at the onset of the clinical trial. If those trials meet those endpoints and the experiments and trials were done to FDA standards, then we can submit for regulatory approval. So at each of these stages, we're asking ourselves the questions, is this drug safe? Does it work? And should we move forward? So that's in a nutshell how the drug discovery and development framework looks like today. It really takes a multidisciplinary effort, and modern drug discovery and drug development is highly collaborative. And it takes a team of epidemiologists, molecular biologists, chemists, toxicologists, data scientists, project managers, clinical researchers, and many more coming together to work on a specific drug. And one thing I would like to see is, because I know Africa is rich in talent, we have all of this expertise in the continent. I would one day also want to see us channel this expertise into creating a fully African-owned drug discovery company by Africans, for Africans. And that's something that we can definitely do. So let's transition to cancer and narrow our focus to breast cancer. And I'd like to briefly talk about what cancer is, how it starts at the molecular level, how we classify and treat it, and where gaps still remain. So cancer actually starts when DNA damage in a healthy cell leads to mutations, and those mutations hijack normal cellular processes, causing uncontrolled growth and tumor formation. The key hallmarks of cancer include uncontrolled cell division, angiogenesis, which is the formation of new blood vessels to feed those tumors. You have resistance to cell death or apoptosis, and the evasion of growth suppressors, which are supposed to prevent the cancers from growing. And one of the key characteristics of cancer is the ability to spread to distant organs or metastasis. This process is influenced by both genetic predispositions and environmental or lifestyle factors such as smoking, alcohol, diet, radiation exposure, and certain viruses. In fact, a recent advisory from the US Surgeon General emphasized that alcohol consumption increases cancer risk, including breast cancer. So why should we talk about breast cancer? Why focus on breast cancer? Because it's now the most commonly diagnosed cancer worldwide, surpassing even lung cancer. And while the death rates for breast cancer have been declining, it still remains the leading cause of cancer death in women. Let me share some sobering statistics with you. So 1 in 8 women will be diagnosed with breast cancer during their lifetime. And here in the US, younger African American women face higher risk and mortality compared to white women. And importantly, risk and outcomes do vary by ethnicity, and this is in part due to differences in tumor biology. So understanding how we classify breast cancer is key to improving treatment and survival. So let's look at how breast cancer is classified. The classification starts with three categories, really. There's the classification into the type and subtype, which is based on cell surface receptor expression. And it's also classified based on stage. So the stage indicates how far the cancer has spread in the body. So stage 0, for example, would be precancerous cells, while stage 1 to 3 indicate cancer that is confined to the breast. And stage 4 indicates advanced cancer that has spread to other parts of the body. Cancer is also classified based on the grade, which describes how abnormal the cells look under the microscope. So a low grade, like grade 1 cancers, would look more like normal cells, while the higher grades, like grade 3 or grade 4, look very abnormal, and they also tend to grow fast and are more aggressive. So what truly defines a breast cancer cell is its receptor status. So here we're talking about the estrogen receptor and the progesterone receptor and HER2, which stands for the human epidermal growth factor receptor 2. If these receptors are present on the surface of the cell, it can be targeted by specific treatments. So tumors with the estrogen receptor or progesterone receptor are known as hormone receptor positive or HR positive, while tumors that have high levels of HER2 protein expression are known as HER2 positive tumors. And we'll be talking about this, as we go along in this talk. So these classifications guide treatment decisions and influence prognosis. So, and as I'll show you later, next generation sequencing is transforming how we define these subtypes altogether. So this slide shows what we understand about the genetics of breast cancer. While most breast cancers occur sporadically, spontaneously, without any known cause, there's about 10 to 15% that is due to inherited mutations or what we call germline mutations. You've probably heard of BRCA1 and BRCA2. These are the most well-known mutations that can cause breast cancer. But there are other germline mutations too, like PALB2, BRIP1, PTEN. Discoveries of these genes have led to targeted therapies. For instance, there's a treatment called PAP inhibitors, which are used in patients with mutations in DNA repair genes like BRIP1. So researchers are also comparing the genetics of the primary tumors where the cancer started and comparing that with their metastatic outgrowth to uncover how resistance to treatment evolves over time. And if you're interested, I've included a link in this slide that to an article that summarizes some of those key genes that are involved in metastatic breast cancer. In terms of treatments that are currently available, here they're listed. We have surgery is a treatment modality, and you have radiotherapy, chemotherapy, targeted therapy, and immunotherapy. And if the cancer is hormone receptor positive, as I mentioned earlier, then hormone therapy is essential. But even with all these treatments, there's still some unmet needs that remain. And chief of them is treatment resistance. And this is where the tumors suddenly stop responding to treatment over time. And there's also a need to identify the right order to deliver these treatments, these multiple treatments that we have available. And in terms of biomarkers, we need better tests to predict who will benefit from what treatment. And there's also the unmet needs of the side effects because many of these cancer treatments are hard to tolerate. So this is where genomic medicine has enormous potential to guide therapy, to minimize side effects, and to improve outcomes. All right, here's a quick timeline of how we've advanced personalized therapy in hormone receptor positive breast cancer with the help of genomic sequencing. And so this slide shows our long road to where we are today and how the therapeutic landscape has changed over the past few decades. Indeed, personalized therapy for hormone receptor positive breast cancer has come a long way, beginning back in 1896 when oophorectomy was used to reduce hormone levels. Oophorectomy, by the way, is a surgical removal of the ovaries. And if you fast forward to the 1970s, tamoxifen became the first selective estrogen receptor modulator that was developed to block the estrogen receptors. And at that same time, these chemotherapeutic agents became widely used in the clinic. And by the 1990s, aromatase inhibitors, another class of drugs for treating breast cancer, entered the clinic. And in 2002, fulvestrant became the first selective estrogen receptor degrader that was approved for use. And beginning in 2015, we've seen the approval of three selective CDK4/6 inhibitors, and they're palbociclib, ribociclib, and abemaciclib. These CDK4/6 inhibitors are they've become the established first-line standard of care when they're used in combination with endocrine therapy. And in recent years, we've seen new targeted agents that have been approved to expand treatment options for patients with breast cancer. And so these include targeted agents like inavolisib for patients that are harboring mutations in the PIK3CA gene, and elacestrant for patients who have ESR1 mutations, and capivasertib for patients who have AKT pathway alterations. So each of these steps has brought us closer to treatments that are tailored to the unique genetic makeup of each patient's tumor. Let's talk about the breast cancer signaling pathways, because if we were to fight breast cancer, we have to understand the cell's internal wiring. That is, how do the cells signal to each other and determine when to grow, when to spread, and when to evade cell death. And so the key signaling pathways that have been implicated in breast cancer are listed here. We have estrogen receptor signaling, driving some of the tumors and the excessive cell division. You have HER2 signaling, CDK pathway, PI3K, AKT, mTOR pathway, and the RTK RAS MAP kinase pathway. And in green, you're seeing the approved drugs that have been developed to target these pathways and block these pathways. While the pathways that are listed in red are still under research, we have not yet been able to develop treatments to intervene and disrupt those pathways, at least not for now. So let's focus on the CDK pathway, and I'll briefly describe the CDK signaling pathway using this simplified overview of the cell cycle and relevant upstream signaling components. A lot of you who have taken biochemistry would remember your cell cycle. And here we know that the most tightly regulated transition point in the cell cycle is your G1 to S transition point. Because that is where DNA gets transcribed into RNA. And here you see how extracellular mitogenic signals like estrogen or estradiol result in upregulation of these D-type cyclins. And these cyclins then form complexes with the cyclin-dependent kinases 4 and 6. And these active cyclin CDK complexes then phosphorylate the retinoblastoma protein, RB. And the retinoblastoma protein, RB, is a tumor suppressor. And when it becomes inactive, it releases the E2F transcription factor, which drives the transcription and synthesis of multiple elements that promote the G1 to S transition and further cell cycle progression. And so this is what results in cell proliferation. And in a nutshell, this would be one mechanism that's responsible for cancer. And as I mentioned, resistance to CDK4/6 inhibitors, which is a type of treatment for breast cancer, is a major challenge. But thanks to genomic tools, we're beginning to understand this more clearly. And we can see that resistance arises through cell-related mechanisms like the loss of FAT1, which upregulates CDK6, or the loss of RB, which bypasses the CDK control that we just talked about. We can have an overactive cyclin E and CDK2, and also the elevated aurora kinase A protein. And in terms of oncogenic signaling pathways, we see the RAS MAP kinase pathway and the AKT pathway activation as key contributors to treatment resistance. And on this slide, highlighted in yellow, are opportunities for us to intervene with currently available therapies or therapies that are still under development. All right, so let's now explore how genomics has driven innovation in oncology across drug development and treatment. And I'll walk you through some concrete examples that highlight this transformation. So since Mendel discovered the genes, one of the fundamental questions that we've always been asking is, how do we identify all the genes involved in human disease? And the answer really lies in studying the genome, which is the complete catalog of the human genes. So sequencing the entire genome has moved us from understanding isolated genes to building a full encyclopedia of genetic information. So most diseases, including cancers like we've just discussed, they are caused by disruptions in gene function. For example, here you see a point mutation in the beta globin gene on chromosome 11 disrupts protein function, and that results in beta thalassemia. So this journey from mutation to dysfunction to disease phenotype is what forms the basis of modern molecular medicine. And it's really changing how we practice medicine and how treatments are given to patients. So by way of also introducing sequencing, so sequencing determines the exact order of nucleotides in DNA or RNA. We've talked about at this workshop, some of the earlier methods of conducting sequencing, like the Sanger sequencing, which was very slow and quite a manual process. Today, we have automated technologies like next generation sequencing, which enables fast, accurate sequencing of entire genomes. So, in terms of sequencing the DNA, the whole genome sequencing maps the complete DNA, including both the coding and the non-coding regions. And in terms of sequencing RNA, RNA sequencing, or RNA-seq for short, analyzes the RNA to identify gene expression patterns. And this can include whole transcriptome, targeted RNA-seq, and single-cell RNA-seq. So for those who are still new to these concepts, one way to think about it is that, your next generation sequencing is like your car. And whole genome sequencing is the driver that's sort of driving that car to explore the landscape of DNA that we're looking at and trying to understand. And likewise, for RNA-seq, it's a tool, and its applications like single-cell RNA-seq and are the destinations that this can reach. All right, so this slide shows some of the key milestones in genomics and highlighting a brief timeline here to show us the breakthroughs that have occurred in the past 75 years that has led us to where we are today. And back in the 50s with the discovery by Watson and Crick of the structure of the DNA double helix, fast forward to the 70s when Genentech was founded and recombinant DNA technology was born. And then by the 80s, we were still quite limited in what we could do in terms of sequencing. We could only sequence viruses. And by 1986, the first semi-automated DNA sequencer was developed. And by the 1990s, between the 1990s and 2000s, we saw the launch and completion of the Human Genome Project. And from 2000s to now, we have seen next generation sequencing emerge and the technology mature. So it's still a very new technology in the grand scheme of things, which really gives us in the African continent a huge opportunity to get in now and really own this technology. So these breakthroughs is what has laid the groundwork for today's genomics revolution. I would like to speak briefly about some of the genomic testing strategies, because in cancer care, there are various genomic testing tiers that exist. One way to think about it is that you would have your basic and your intermediate and your advanced tiers of testing. Your basic would be like your SNP genotyping, and intermediate would involve hotspot panels and DNA microarrays, while the advanced level of testing tier would involve the comprehensive genomic and transcriptome profiling. So these are some of the these tests can detect these mutations, which are all listed here. So you have your point mutations, indels, structural variants, composite biomarkers, even like the tumor mutation burden and the microsatellite instability. All right, so what sequencing has really helped us understand is that cancer is a disease of the genome and the epigenome. And there are many levels, several levels that we can look at this. We can look at it from the DNA level, and we can see from looking at the indels, copy number variations, and so on. And we can also see this by looking at the chromosome level, where we see amplifications, we can see rearrangements, and we see gene fusions occurring all through sequencing. If we look at the RNA level, we can also see fusion transcripts, for example, ALK EML4 shown here. And then if you look at the epigenome level, we can see from the methylation patterns and super enhancers, again, all genomic insights, highlighting that there's a lot of heterogeneity and complexity when you're talking about tumors, cancerous tumors. And this really underscores why personalized cancer care is so essential. So in brief, this is just showing us how the various technologies that are used in obtaining the tissue sample and sequencing it, and then using it to detect or to sequence those genes as we discussed. Typically, you start by taking a tissue biopsy, and then you may need to run multiple tests in order to be able to make a diagnosis. But the risk here is that if you have to run through so many tests in order to make that diagnosis, you may actually exhaust the sample and you might run out of the small sample that you were able to collect and preserve, whether it was an FFPE sample or frozen or it was a fresh sample. So we need a more efficient method of being able to obtain these samples and run these analyses. And this is where liquid biopsy comes in, using circulating tumor DNA. And this offers a non-invasive alternative method that enables frequent and real-time monitoring of the evolution of the patient's tumor without necessarily relying on a tumor sample. So let's talk about it a little bit more. And here I'm just highlighting the clinical utility of ctDNA. And the key things to highlight here is that it does allow us to monitor tumor progression and treatment response. And we're able to detect when treatment resistance is beginning to emerge. And that can help guide therapy decisions, especially when those tissue samples are not available. So ctDNA is becoming quite a powerful tool for precision oncology. All right, I just wanted to put this slide here and have us revisit it to remind ourselves of the traditional drug development framework that we talked about at the beginning of this talk, because genomics is really redefining how drug discovery is done. And just to put things in context for you, drug discovery and development is quite a risky business. And it's very expensive. It would cost about $2 to $3 billion on average to develop a single drug, and the failure rates are very high, something in the range of 85%. And part of the reason for this is because of poor target validation and our reliance on indirect biomarkers. And this is where genomics, again, offers new possibilities, because we can target gene regulation in not just the mutated proteins, not just signaling pathway in the cell. And by targeting gene regulation, we can expand the range of druggable targets that are available. And this is where epigenomics comes in, which involves those chemical modifications to the DNA and histones that allows us to modulate the gene expression directly. And one concrete example for you to take away is in acute myeloid leukemia, AML, where about 30% of the tumors have super enhancers around the RARA gene. And that's a vulnerability that we can now target with drugs. So despite these advances, there's still many challenges that remain. One of the key challenges still remains that the tumors will continue to evolve under therapeutic pressure, and you still need to obtain these sequential biopsies, and you need to perform some sort of integrative omics. It's critically important in order to really understand what is going on with the patient. But this is very, very costly. So we need to solve the cost issue and make this scalable in a way that it is affordable and also accessible to everyone. We need a lot of genetic counselors to help make sense of the data that we're acquiring, and we need a lot of bioinformaticians. And we also need to find a way to integrate the data with electronic health records. And this is a very complicated task to do. And it's still a massive undertaking to translate all these mountains of data that we've been getting into clinical decisions. But in order to overcome these barriers, we do need a lot of investments in training and policy changes as well. And Africa has its own unique set of challenges in terms of leveraging genomics. One of the biggest issues is the limited access we have to NGS testing, and a shortage of bioinformatics talent in the continent. And our effort is also greatly undermined by the weak national science policies that we have in many of the African countries. And we also see huge underrepresentation in global clinical trials. So these are some of the challenges we need to solve for, and the opportunities that exist are also quite enormous. And I'm really happy and excited to see initiatives like the African BioGenome Project and H3 Africa building this foundation. Um, but we still need to do a lot more. We need to build population-specific variant databases. Africa is such a huge continent with, huge number of people, and that is an asset in itself. And we need to launch innovation hubs and local biotech startups. And we need to find a way to forge international partnerships, and lead in terms of pharmacogenomics, which I didn't really get the chance to get into in today's talk, but I did include a slide here that talks about pharmacogenomics for those that would want to take a look at that later on. We also need to lead in the areas of rare diseases and cancer biology, especially given Africa's unmatched genetic diversity. So this is my last slide and my call to action. And to really set the context for everyone, Africa will likely be home to 40% of humanity by the end of this century. Think about that for a moment. This continent is going to host 40% of all humanity. So we do need to find a way to invest in sustainable genomics, sustainable development, because if we are able to do that, Africa's future can be transformative and our power will be enormous. Um, and if we're not able to achieve this, it's hard to, it's hard to it's hard to even think about or even talk about the cataclysmic levels of economic and environmental breakdown that we would face. So it's imperative that we find a way to succeed in this endeavor. And bringing it back to healthcare, if we have to truly decode cancer across Africa and across the world, we must integrate genomics into routine clinical care. Again, precision oncology is no longer an experimental approach. It is a global standard, and we need to democratize that access right now. We need to do that by training the next generation of healthcare professionals in the continent. We need to build these genomic data systems that we've been talking about. We need to support African-led research. And if the policymakers and if the leadership and the government is failing, I would hope that private investors, private citizens, some of our billionaires can step in and show a good example, and then hopefully the leaders, our policymakers, will come around. Africa has a lot of talent, diversity, and the drive to lead, but we really must act now. And so to the students and the scientists in the room, I hope that you continue to pursue genomics, collaborate, publish, and lead. And to the policymakers and the funders who are listening to this, I hope you continue to invest and invest even more in Africa's genomic future. The future of cancer treatment, as I've tried to show in this talk, is written in the DNA. Let's ensure that Africa is part of that future so that together we can decode cancer and ensure that no one is left behind. Thank you very much. And this deck does contain a link to some useful resources. And I also thank some of the organizations that have supported my journey to this point. And I hope we can connect. Thank you.
Thank you so much, Dr. Obong Peters. I'm glad you didn't forget where you came from University of Calabar, NDCC, and then all the way. So it's really interesting to see the progression. And so we're going to kind of take some questions and then open up the floor for other comment contribution. So if anyone does have any comments, please do use the icon, the Zoom icon, to kind of indicate you want to ask a question or put the question in the chat box. So I'm going to go through. Does anyone, first of all, have any question orally to ask orally? Please do raise your hands. Any question oral? Otherwise, I'm going to go through the chat box to see if you do have any question. So someone is saying, Kemlavi, are you on the call? So I can ask you to Kemlavi. Is Kemlavi? No, it's not. Komlavi actually. Komlavi. Yeah. So I'm gonna ask you to unmute. That's Zenyo. Could you please unmute? Komlavi. I hope I'm pronouncing it right. All right. Please ask your question.
Okay. Good morning.
Good morning. Go ahead, please.
I'm not really good in English, but I will try.
Okay. I don't know if we have what do you speak French?
French, yes.
Yes. So do we have any French speaker that can translate for us? Otherwise, we can. Any French speaker, please indicate via the message. Otherwise, please do ask your question in English, and then we'll try to understand it.
Okay. According to the lecturer of Doctor, breast cancer comes from a modification of the structure of the cells. In this case, is the treatment specific to each case, or what is the principle of the choices of the medicine in front of each case, in each case of breast cancer?
Okay, so let me try to read it here. Dr. Obong, he said the breast cancer comes from modification of breast cells, which can be different for any woman. Is the treatment specific to each case? Or
Yes,
epidemiologically, every breast cancer must have certain types of modified cells, which are targeted by certain class of medicines. Briefly,
yes,
what is the principles of the choice of the medicine in the front of in each case? Dr.
yes.
Obong, I hope
Yes.
you, yeah.
Yes, I have a good sense of where you're coming from. So I would take it a step further and say it's actually the DNA in the cells that is different from one patient to the next. And so back in the day, we would use a one-size-fits-all treatment approach and deliver, for example, chemotherapy. And these chemotherapies would attack the cells, really, and they would have a lot of terrible side effects. Some patients would do poorly on them. Some patients, might fare better than others. But that was really the way we were treating it. Fast forward to today, and hopefully you can appreciate from the presentation that we had today that by applying genomic sequencing, we're able to detect the specific mutations that each of these patients carry. And there's some that are more common, like, for example, the PIK3CA mutation. It's present in about 30% of patients with breast cancer, with the HR positive, HER2 negative breast cancer. And so we are now able to provide them with targeted treatments. For example, we can prescribe inavolisib, which is quite selective for that type of mutation. And you combine that with the CDK4/6 inhibitor plus an endocrine therapy, and that provides better outcome for those patients. And it's a lot better than how we were treating breast cancer back in the 70s, for example, where everyone would get a selective estrogen receptor modulator, or everyone would get chemotherapy. In the future, what I'm hoping to see is that we would be using more and more these genomic sequences to, through modalities like ctDNA or even next generation sequencing to determine through pharmacogenomics what types of treatments we should offer to the patients so that we would have a more personalized treatment for each patient.
Okay, thank you, Dr. Ubong. We have one participant who would like to ask a question. Eric Wenge, could you please ask a question? You can put on your video as well, unmute as well. Can you unmute? You have, yes.
Yes, thank you so much for the insightful presentation. My question is, from my understanding, the breast cancer, there are different types of breast cancer. And from those different types of breast cancer, when you're doing treatment for those for breast cancer, you have to do diagnosis. And when you're doing diagnosis, do you look the biomarkers that you are targeting? Is it the same across those different cancers, or it's you look at different biomarkers for those types of breast cancers? Thank you.
Yeah, so the question is asking whether we would, use the same type of approaches to diagnose breast cancer. So I think if once you get these slides, you'd be able to see, I think at the very beginning of the talk, I sort of showed out how cancer would be classified. So that is, one of the ways that you would start by essentially just looking under the microscope and seeing how abnormal the cells looks like compared to a normal healthy cell. And you can also look at the receptor expression. And so there are modalities like FISH. And some of them are not that as sensitive as then using something like next generation sequencing, where at that point you're looking at the genetic makeup of that patient's tumor. And so you're looking at the sequences of nucleotides and determining whether the patient has a specific type of mutation that would then put them in a different molecular category where they would respond to better to a different type of treatment than, say, someone who did not have that specific type of mutation. So yeah, so to answer your question, it's a more complicated process now, I would say. If you wanted to really phenotype the genetic and molecular diversity of a tumor, there's a lot more involved in that than just looking under the microscope and determining whether a cancer cell bears the cell surface bears certain receptor expressions or not.
Thank you, Dr. Ubong. It looks like you have a lot of interaction. So I hope you have the time for us today. Josephine Don Bosco has a question. Josephine, could you please speak? You can unmute, and you can also turn on your video if you want. Josephine Don Bosco, could you please unmute? Yes.
Yeah. Could you hear me?
Yes, please carry on.
Yeah, good morning, sir.
Yes.
Good morning.
Okay, good. My name is Jospin Awoliati. I'm from Benin. And my question is directly to you. I would like to know what is the role, or when you talk about next generation sequencing, what does it mean? And apart from that, how can we use that directly based on, use it on plants in order to find at least a medicine or develop a kind of medicine using plants in order to treat cancer or, any type of cancer?
Yeah, so when we talk about next generation sequencing, we are talking about a way of looking at the precise order of the DNA. So the DNA actually has both 4 different types of nucleotides. So you could have adenine, thymine, cytosine, and guanine. And we know that adenine binds to thymine, cytosine binds to guanine. So when you are looking at the DNA molecule, you're basically trying to figure out what order those sequences are. And so that's what next generation sequencing is doing for you. Let me see if I can find a slide where that shows this in a much better way. And so when you have changes in the where those sequences are supposed to be arranged, that is what could lead to a disease. So for example, you see here that in this particular chromosome 11, there is a point mutation where instead of having a T, this has changed to a C here. And this is what has caused a patient to have a specific disease. So that is what the sequencing is doing for you. It's helping us to understand the exact order in which these nucleotides are expressed.
Thank you, Dr. Obonquitas. Jasmine, I hope that clarifies your question. So we're going to move to the next speaker, the next participant who wants to ask a question. Jolie Thomas, could you please ask your question? You can unmute as well. You can unmute Jolie Thomas. Yes, carry on.
Okay, thank you very much, sir. My name is Jolie Thomas. I'm from the College of Medicine, the University of Ibadan. So my question, sir, is see, for the fact that Africa is genetically diverse, like we are the most diverse race, but still, when it comes to research and access to funds, Africa is still way behind. So my question now is, how can cancer research be translated into affordable and accessible diagnostic or treatment strategy in low resource setting, especially in Africa, where the burden of this stage diagnosis is very high?
Yeah, so what I think the best solution in a situation like that would be to apply the economies of scale. When you have such a huge number of people residing in one continent, such as what you have in Africa, or even this projection that 40% of all humanity will be residing in Africa by the end of this century. That in itself, those numbers, that's our asset right there. Because a lot of the technologies that are being developed elsewhere, those technologies would need data. And it's really that data that we're using AI to try to use that data to predict, to apply AI on that data to predict a lot of the things that are helping drive the revolution and the innovation in this type of work. So if we have the data, then it's up to us to figure out a way to negotiate a deal with the people who actually have the equipment and it doesn't mean that we are trying to just freeload on a lot of this, but there are ways that we can structure it in a way that also involves the country having some sort of payment that they make to the companies as well. And some of the healthcare budget would be set aside to pay for a lot of these tests. And we could also be building huge data repositories and registries that again would be a gold mine for people who actually want to mine that data and get insights from that data. And so that gives us additional leverage in our negotiation. So there are so many ways that we could try to position ourselves such that we still have some sort of bargaining chip that helps us lower the cost of this. But regardless of whatever way we use, it still has to involve at the national level some sound health policy that would involve setting aside a huge chunk of the budget, maybe the healthcare budget, towards buying a lot of these new medicines that are coming out, buying a lot of these technologies that are coming out, and training the next generation of healthcare professionals to be able to utilize those tests, and building the databases and figuring out a way to curate those databases in a way that it would be very attractive to people who want that data.
Thank you, Dr. Obong. So I'm going to collect every single question for you today. I hope you have the time. We have a question from Ifeoluwa. Ifeoluwa Oyeyemi, could you please unmute yourself? You can unmute yourself now. All right, carry on.
Okay, thank you so much for this insightful presentation. Thank you. I just want to ask, coming on now as a preclinical scientist, like most of the facilities, we are not as advanced in this area as in other parts of the world, and there aren't so much skills in terms of using organoids. But then I want to say, using in vitro cell line to study potential drugs, I mean drug molecules now, for that can target this therapeutic pathways that have been identified for cancer. Do you think it's a worthwhile exercise? Then I want to ask, most of the cell lines we use, we know that they don't encapsulate African unique genetics because they were not isolated from Africans. Do you think that working towards developing cell lines that are unique, isolated, and unique to Africans that can probably reflect African genetics, do you think it's a worthwhile exercise? Thank you.
Yeah, thank you very much for that question. Yeah, I think it is definitely the two questions you asked were really around whether it is worthwhile for Africa to be involved in this type of scientific research, preclinical, given that the setting there's very low resources available in this setting. My answer to that would be that we can't afford not to be involved in this type of research, and it doesn't mean that we have to do it at the level that the West is doing, because they may also have a lot of the resources and they can dedicate those resources to a lot more of those resources to preclinical scientific research. At the same time, there are things that we should be doing that we frankly can't just wait for the West to do for us. And the question around being able to perform research on diverse preclinical samples, cell lines that have been obtained from, or samples that have been obtained from people within the continent. This is where we're missing out if we're not able to perform that research in our country, in the African continent. So what I would like to see is a future where all of humanity is involved in scientific research, in medical research especially. It shouldn't just be research shouldn't just be done in the US and in Europe and China and elsewhere. It should be done everywhere. We all have to put our hands on deck to try to fight cancer. We have to all put our hands on deck and do whatever we can to try to find a solution to this scourge. And the way science also works, there's a lot of serendipity in science, where you might just discover something out of good fortune, out of luck. And so that one discovery may be enough to change the fortunes of the continent. So I would encourage everyone not to be discouraged by the fact that we are doing research in a low resource setting, but to continue to persevere, to do whatever we can, and to write and publish the knowledge. Whether it's a negative study, a positive study, you do your best to try to have that published. And one day that knowledge could help someone. It could help us unravel a mystery. It could help us solve a puzzle that has been plaguing us for a long time.
Thank you, Dr. Ubong. So while you're still here, Ifeoluwa, Oyeyemi, and Uduak, you guys will be presenting this morning. So please hang around still be on the Zoom, so that we have, after Dr. Ubong, we're going to go to one speaker, and then Ifeoluwa, followed by Uduak. So Dr. Ubong, we have one more question before we go to the participants on site in Port Harcourt. Anita, do you want to yes, Anita. Oh, now, Anita, could you please raise your hand again? For some reason, I lowered it while trying to unmute you. Anita? Or did you lower it intentionally? Anita, okay. Can you unmute now? Anita? Yes. Can you unmute?
Okay, can you hear me? Good morning,
yes, please,
everyone.
go ahead.
Good morning, sir. Okay, so Dr. Fonsa, in the case of the point mutation that you showed us in the slide, has any research been carried out to reverse such mutations? Yeah, has any research been carried out? Okay, just generally, has any research been carried out to reverse point mutations in a human genome?
So I can't say confidently whether it's been specifically done for point mutations, but there's a new class of therapies that are coming out. In fact, a few of them have already been approved by the FDA. They're called gene therapies. And that's been, using some sort of a vector to go into into the gene to try to correct some of those mutations. And so, yes, there are a number of gene therapies that are already approved out there. And we know that with CRISPR and so many other tools that are coming out, that may even be coming out in the future, more and more of such therapies would even be more available in the future.
Thank you very much.
Yeah.
Thank you, Dr. Ubong. To the participants on site at the University of Port Harcourt, Control, do we have any question for Dr. Ubong Peters? Please.
Oh,
yes, please.
Yes, so please, before we give the mic to people who want to ask questions.
Dr. Ubong, can you please stop sharing so that we can see them? Please stop sharing the screen. Yes, thank you. Yes, please.
Here.
We can't hear you. So control. Yeah, we can hear you now.
Dr. Komi Kokora is in Lome. He's our translator. He does all the language translations between English and French. So in case any person wants to ask a question in French, the person should ask freely because Komi is online to do the interpretation.
Okay.
Then I also want to announce that the project coordinator of HiPrep could not be here, but he has sent a representative, Dr. Obari, who has come to represent him. In due time, he will give his speech. But for now, please, I want to give room for the people to ask questions. Please, you are the first. I'm going to ask you a question, please.
Good morning, Dr. Obong. Thank you for your presentation. Can you hear me?
Yes, please,
Yes,
carry on.
Okay, my question is this. To a layman who is not so knowledgeable about the use of molecular markers or testing for specific drugs to administer to your patients, and the person walks into your clinic and wants to get treated for cancer, and you want to go through all this long process to be able to decide precisely which drug to administer to the patients. And knowing that cancer is very aggressive and can spread very widely and kills fast, how long does it take for you to go through all these processes for you to be able to decide which drug is specific or would work effectively for that particular patient? And also knowing that some drugs can be resistant. And so if a drug is resistant, do you also go through a second cycle again to be able to get through the DNA to know which drug will now work very well for that patient? That's my question. Thank you.
Yeah, that's a really good question. Thank you very much for asking that question. The first question you asked was, how do we find answers for the patient very quickly so that they can start their treatment? And, because oftentimes if we catch the disease early, like for example, if it's early breast cancer, the intent of treatment would be curative, and in fact, most of those patients can be cured if the cancer is caught early. So it is very important to catch it early. However, when you talk about trying to figure out what is going on, depending on the types of tests that's available to you, whether you're doing a single panel or microarray testing, you may have to rely on a small sample. You might take a slice of your sample and run it, and you may be able to get some answers from that sample. But if you don't, you might have to do it a couple of times before you can actually arrive at your answer. This is where next generation sequencing or doing a comprehensive genomic profiling is a lot better, because you would be able to get at that answer very quickly. So you do the whole genome sequencing all at once, and you can actually get those answers, and it would save you the time of having to run multiple panels to try to get at the particular issue that's wrong with the patient and what sort of treatment would work. So the only downside here is that it is expensive. It's a lot more expensive running this whole genome sequencing than just doing a few panels. And so that is where we need to try to strike that balance. And I think it's a huge problem for patients in Africa, because a lot of the patients who are dying needlessly there, some of them, if they were in places like here in the US, a lot of those patients would be saved, because they would have access to these types of tests. And so doctors would be able to detect it very quickly, and they would be able to provide the treatment for them. So this is a topic that really bothers me a lot because there's just so much more that we need to be doing, and it's not just the government that is to blame. I think even private individuals here are to be blamed as well, because if the government is failing us in, trying to make it provide the resources for us to be able to access some of these tests or these treatments, then private individuals should be able to step in. There are a lot of wealthy Africans, billionaires in the continent, who could actually be leading the way and showing that it's possible to have, in a country like Nigeria, maybe you have 6 centers that have, very good laboratories that can run whole genome sequencing, the RNA-seq, everything, whatever test you need, that they have the capability to be able to run that. And then the treatments as well. When the pharmaceuticals develop these treatments, they're not going to sell it for free to us. It takes about $2 to $3 billion to generate each of these, or to develop each of these treatments. So our national health insurance scheme has to figure out a way to pay for this, so that the common man can afford this treatment. So it's a long-winded way of trying to answer this question, but I think there's a lot that we can do. It all comes down to cost and access, and this is where we need resources, but it's not coming from the government. And if it's not coming from the government, I think private individuals need to step in.
Thank you, Dr. Ubong. I will let you go, but 2 more questions. Well, I'm going to merge the questions into one. So you actually just answered one of the questions. Peter Holland Maman is asking if Africa can afford personalized treatment, but I think you answered that in your last comment. So I'm just going to go to Favor. So this is now the online chat going on here. I'm going to go to Favor Edie. She's asking, considering the challenges in Africa, what's your advice on accessing resources? Again, this is like career. She says she's also looking forward to a postdoc, and what are the opportunities? So I think beyond this question, I would like you to kind of finalize, because this is my last question to you. How do you, you need to slide your responses into career, and given that we have lots of early careers, mid careers, even professors on this meeting, and lots of them are on our site and on the Zoom call. So you can respond to her question and then see how you can slide it. And of course, you've done. I've seen you introduce yourself and where you started, the days of little beginnings. So just let us spend the next 5-10 minutes, please.
Yeah. So there's a lot to unpack in that question, because here we're talking about next generation sequencing, and I highlighted some of the key challenges that we're facing in trying to make this technology a reality, or even harness the full potential and ensure that Africa is leading when it comes to next generation sequencing. To be able to do that, we need a very strong workforce. And that strong workforce is in our youth. We need a lot of genetic counselors. We need a lot of bioinformaticians. We need a lot of scientists. We need we need people who understand computer science and can crunch the data and help make all of this a reality. And so to be able to get that knowledge, it's great that there's a lot of interest and there's a lot of engagement based on the number of people attending this program and even the kinds of questions that are coming in. So yes, whatever you can do to get into a program in biotechnology, in genomics, genetics, and just learn, because at the end of the day, we do need to educate the public. We do need to educate our policymakers, because it could be that they don't really understand why this is so important. And if they do understand why it is important, they would be able to create the resources necessary for the youth to take advantage of. So my own story, for example, I think is very poignant here, because it was the Akwa Ibom state government that provided a scholarship through former Governor Victor Otta that allowed me to go to Canada to study for my master's and my PhD. But even then, there were a lot of struggles within the government, because as soon as Governor Otta left and Governor PacBio came in, he had a different direction he wanted to take the state. Not to criticize any of his policies, but he did not continue that program that Governor Otta started. And so there is no scientific leaders. There are no other young people who have joined me out here or done this type of research, just like I did. And so it's just me doing this now. Whereas we had a government sending out, even if it's 10 students, even if it's 20 students, to go overseas and study, and they can one day turn around and inspire others. This is very important. I know at the NDDC is doing providing these types of scholarships. I don't know if they're still providing these scholarships at very vast numbers that would really make a difference. But you do need this type of training to be made available to the students that are in Africa. And we shouldn't necessarily worry about the fact that these students, some of them could go get training and then not return. That's not the case. Even for the program that I was part of with the Akwa Ibom State government, I would say that close to 40% of us went back and contributed. And they're working at the Akwa Ibom State University as we speak. And so what we really need to do is provide these opportunities for young people to go out, get the training, and some of them might find their own career paths, and most times those paths could lead them back home again, could make them inspire others. And even though I'm out here, I still have very deep affection and connection to my home, and I would want to give back at some point. And so the fact that I'm out here doesn't mean that I don't have plans to one day come back and give back to my community for what they've done. So I hope that answers your question, but in my closing remarks, it would be that regardless of how the situation is, the students should continue to be motivated, take advantage of whatever opportunities you find, work extremely hard. You do need to work 2 or 3 times or even 5 times harder than everyone else, because that's just what it takes to be able to set yourself apart when you come from the kind of environment that we come from.
Thank you, Dr. Ubong Peters. I have just been told that there is one more question on site, and I wanted to let you go so that we can move to the next speaker, and I can see people raising their hands. So we're going to do 2 things. We're going to ask the one question on site, and then please, Dr. Ubong, just stay behind and respond to any other questions on the chat box. Okay. And some participants also want your slide. Could you please share it with me, and then we'll share it with all the participants, if you are happy to, because I understand sometimes, you just let me know. If you want to share it, just send it to me, then I will pass it on to them. Otherwise, you are not obliged to share it.
Oh, absolutely. This is all for public release. So yes. I'm happy to share those slides.
Okay, please do share it with me, and then we'll pass it on to them through the mailing list. We have about, for this conference, 1,500 registered, and some people join at particular sessions, and sometimes because of the bandwidth and stuff like that. All right, control the local participants on site. One question, please, so we can free up Dr. Ubong Peters. We can't hear you, please. Okay, go ahead.
Thank you very much for sharing wonderful knowledge on the scientific methods.
Could you please speak up? We can't hear you.
My question is on DNA sequencing. And DNA sequencing is about knowing the precise nucleotides order in DNA molecule. But in a situation whereby we have a mutation, for example, in sickle cell anemia, where we understand that the base pairing adenine pairs with thymine, but the so that's adenine pairs with thymine. Sometimes during mutation, the order changes. So if you want to do a DNA repair, how do we know the precise, the normal, so that we will now use the abnormal, we will collect the abnormal from the normal DNA sequence of that patient. You understand?
Yes.
So the question is, we have to know the normal DNA sequence of the patient. When there's some mutation, when we do the DNA amplification, we see the abnormal. How do we now get the abnormal? So we have a wide range of DNA sequences. So how do we differentiate them? So this one is normal and this one is abnormal.
Yeah. So it's a very typical science question. And I think once you get my slides, you're going to see that there is on towards the end of the slide deck where I've included some useful resources there. There's some databases like CleanVar that contain all those databases that show what the what would be normal and what would be abnormal. But in a nutshell, there is what they call a reference library against which the sequences are being compared. So these reference libraries would be generated from huge sampling of the population to know, for example, what the vast majority of people would have at that, say that particular point, whether it should be ATC. So if you've measured 100,000 people and 99% of people have ATC, then it's easy to make a call when you see the 1% that have a different sequence, that like TCA or something like that. So it's a scientific problem that you can solve very easily with math.
Thank you, Dr. Ubong. We'll please, as I mentioned, do hang around and answer any question on the chat box. And sorry, Malaki, we have to really move ahead. Please do put your question in the chat box, and Dr. Peter Obong will attend to it. All right, thank you so much, Dr. Obong. We'll move to the next presenter.
Just 1 minute to just take one brief question from here.
Okay.
Yeah. Okay. Okay, thank you very much. My question goes this way. We have been talking about drug development, and there's some common things we observe in Africa, especially in Nigeria. You have a situation where people talk about some foods, herbs that are anti-cancer. And you see the whole flying in the social media. People missing this and missing that. Actually, I did some work in coconut water to actually find out some of the anti-cancer effects. So the question I want to ask, this drug development which you have presented, does it follow the same pattern if you want to use some of those natural foods to find out whether they have anti-cancer from there to develop a kind of drugs for cancer? Do they follow the same pattern, or it's a different route when we are doing the economic sequence? Thank you, sir.
Yeah, thank you very much. That's also a very good question. And the short answer would be no. In some cases, yeah, maybe you could rely on some plants to be able to figure out what the active chemical properties of that specific plant might be that might confer the properties that it has. So for example, if there's a specific plant that has antimicrobial effects, you might do some sort of phytochemical analysis to see and to isolate the specific chemical or to know what chemical structure for that molecule looks like. But it's usually not the natural product that the pharmaceutical would end up packaging as a drug in the end. We would have, chemists, we have biochemists, we have, all of these folks who can go into the lab and they can take that natural, plant that let's say, for example, there's a specific leaf that we know has antimicrobial properties. It's not the leaf itself. There is a specific molecule in that leaf. And so once you do the phytochemical analysis and you really drill down, they would finally isolate that one specific chemical, that one specific molecule driving those effects. And then someone can actually synthesize it in the lab using the basic structure of any chemical. It could be nitrogen, it could contain some carbon rings and some hydrogen. They'd have some really fancy models that they can use in synthesizing that molecule. And then they can keep tweaking it as well. They might decide, oh, what happens if we add a methyl group here? What happens if we add a hydroxyl group here? Does it make it more potent? Does it make it more selective? Does it make it more efficacious? So there's so many different things a chemist could do around, play around with the molecule in order to actually know what the effects would be. And then once they have zeroed in on a lead candidate, that is what gets that is what moves in the pipeline to the next stage of development, where you start testing on animals and cells. And if that molecule still proves to be effective in killing the cells in the specific way that we want it, and also effective in animals, and it's not affecting the organs of the animals, then we might decide to try that molecule in clinical trials. So it's a completely different process, and I would caution against relying on, some of those what I would say anecdotal evidence of people saying, oh yeah, if you consume grapefruit, it will cure cancer. It would do. We've seen that happen back, as I started in my talk, back in the pre-industrial era, how people were marketing all these products like Wizard's oil and saying that it cures everything. It's just not true. It's just not true. You have to actually do the science to see whether it works. And human beings are also very complicated, that even when you're doing the trials and you sometimes you have to design these trials in a way that you are dividing the groups of people into two. On one half of the people, you give them the actual drug that you've developed, and the other half, you give them a sugar pill. And yet, sometimes we see in the people that receive the sugar pill, they still receive some sort of clinical benefit. It's like the sugar pill did something for them. It's called the placebo effect. So human beings are very complicated in that nature, that even when they believe that something they've taken is effective, sometimes it works for them. It's a placebo effect, but it doesn't necessarily mean that this is a scientific effect, or this is an effect that is reproducible in the vast majority of people. So I would really caution against unproven claims like that do not have any scientific backing.
Thank you, Dr. Ubong-Peters. We would like to really move to the next speaker. So please hang around and then comment on the chat box. Thank you so much. Could you please put a hand up, applause for Dr. Ubong-Peters, and those on Zoom, you can use the Zoom, icon for clapping. All right, the next speaker would be Olariwaju. I'm gone. I'm just gonna. Yeah, Olarewaju Alofowobi from Unkaba Biotech. Larry, you can now share your screen, please.
Hi, thank God.
Hi.
Good
So,
morning. Yes.
yeah, for the next, I think we have just
You're
20
almost
minutes.
more than my name.
All right.
But it's fine. Okay.
Please,
Let
yeah,
me
yeah.
let me try and share my screen from here. Okay. Okay. Could you please confirm if you can see my screen?
Yes, please go ahead. We can see your screen.
All right, perfect. Thank you. So let me just slide it into presentation mode. Okay. Good day, everyone. I know we have lots of participants from different parts of the continent. So it's morning over here, so good morning. And my name is Olarewaju Olufowobi from Inkaba Biotech. I work as the country manager for Inkaba Biotech West Africa with the office here in Nigeria. So just be giving a brief presentation about the company Inkaba Biotech as Africa's genomics company and how we've been enabling access to innovative technologies that have improved research outputs on the continent. Briefly, so for the sake of people that are just hearing the name Inkaba Biotech, just a brief rundown of how we evolved as a company over the past 20 years. We have a head office in South Africa, which was established in 2002. And over the years, we've spread across sub-Saharan Africa with the East African subsidiary located in Nairobi, Kenya, which was established in 2010. And in 2015, we have the West African subsidiary with our office just directly opposite the International Institute of Tropical Agriculture, IITA in Ibadan. And we've also spread beyond Nigeria in other West African countries like Ghana, Senegal, Central Africa, Cameroon. We have presence in Mali, in Benin Republic, just to mention a few. So our mission as a company is to, catalyze Africa's advancements through genomics because we simply understand the huge potential genomics has in, in improving or providing sustainable solutions to some of the challenges we face on the continent. And how do we do this? We do it by, creating value in the form of innovative solutions, form of quality laboratory products and services. We build capacity for African scientists on the continent by organizing trainings and workshops in the area of molecular techniques and diagnostics. We also form partnership with stakeholders because we understand that we can't do this all by ourselves. So we collaborate with stakeholders from academia, research institutions, those in the industry as well, diagnostic labs, so speaking of partnership with stakeholders, in 2024, last year, we came into collaboration with the University of South Africa, UNISA, to, acquire state-of-the-art platform called Review from one of our partner, PacBio. PacBio, as some of us might know, we a leading provider of long-read sequencing technology. And being the first of its kind on the continent, we were able to, acquire and bring this technology down to Africa with this kind of collaboration and partnership with the University of South Africa. So, but why is this partnership very important? I would use plant genome as an example, plant species as an example. For plant scientists that are in this meeting, you will agree with me that plant genomes are notoriously difficult to assemble. And this is because they have a very large and complex with high heterozygosity and very ploidy number. And why many plant genome assemblies are for species that are native or economically important in Africa, unfortunately, there is high possibility that these genomes are probably sequenced and assembled by researchers elsewhere. I have a data here which was extracted from a Nature publication in 2021. And it sort of looked at the representation and participation of plant genome sequence data over the past 20 years. So the first chart you see looks at the sequencing of native species and the collaboration that has been done. You would, so on the chart, you would see that the black box there simply depicts genomes of native, plant species that have been sequenced off the continent. While the green one is the one, that are sequenced in collaboration with, researchers in other continents. And then the gray one is the native species sequenced in the continent. So looking at Africa, you would see that, more than close to like 90% of our plant genomes were sequenced off the continent. So this is a gap that partnership like this is, we are looking at, closing. On the other part, you could see the other charts, you see sequencing of non-native species, and then the collaboration that were being done. But unfortunately, you didn't see anything that has been done in Africa when it comes to sequencing in Africa, but species of other continents. But this is for obvious reasons. We've not even finished, sequencing our home plant species. Why do we then need to bother about species from other continents? But interestingly, other developed countries like the Asia countries, European countries, they're quite very much interested in plant species especially from Africa. But unfortunately, they might be interested, but then again, why are they interested? Well, 56% of all the domestic crops that have had their genome sequenced outside of their continent of origin, apparently only 13% of these included in continent collaborators. But the implication of this is that less input from local stakeholders means increased likelihood that genome assemblies may not actually represent, one, the germplasm grown there, and secondly, the conservation priorities in those regions. The fact that they are sequencing our genome doesn't mean they are probably, have a priority as part of their own priority as well. And then secondly, you would all agree with me that it also have very negative impacts on our local capacity, which is some of the things that African BP has actually been, talking about over the past years. We need to start looking at how we can sequence our own genomes locally to build our local capacity. And plant extinction has already increased by 60%, according to that same article. And over the past 100 years, and this is projected to continue to increase. So there's urgent need for us to learn what we can from our wild plant species before they all disappear. So this is why some of this partnership like this is very, very important to our local and native species. Now, you would ask me why PacBio Review, why this platform? So an ideal tool to quickly assemble phased reference quality genomes for even the most complex plant and animal genomes. This is a very ideal tool, and I'll tell you why. Data you generate from this platform can easily be associated with desirable traits to SNPs and structural variants and complex genotypes. It helps, capture genomic variants on a genome-wide scale for outbred, inbred, and even hybrid population. And with data generated from the platform, you can, build reference quality, haplotype results, pan genomes to drive marker development, discovery, and germplasm characterization. And by accurately capturing complex gene variants, researchers can, better streamline breeding programs and genome editing strategies, reduce trial and error experiment, improve the predictability of genotype to phenotype outcomes, reduce the cost associated with field breeding attempts, and allow cross-species trait selection. All of these are very, very germane when it comes to, food security on the continent. Now, looking at the technology itself, let's just delve a little bit into it. So PacBio, it's more like an Hi-Fi long-read sequencing technology, which it's very applicable in different omics research, such as whole genome sequencing. You can use it to sequence and assemble complete reference quality genomes and phase haplotypes. You can use it to even detect variants, different type of variant, but structural variants like copy number variations, like even single nucleotide variations. You can use data from this platform and help you, review all of these different types of variants. It's also applicable for RNA sequencing. So for those who are into transcriptomics studies, This is a data that can help you to characterize different isoforms of RNA that you can, get from RNA sequencing data with direct sequencing of full-length transcripts and no assembly required. Targeted sequencing, so if you're focusing on specific gene region, this platform enables you to, gives you much more accurate view of that region of interest. For metagenomics applications, so for those who are into maybe who work on environmental samples, different type of environmental samples, and you want to, look at the microbial profile of the different organisms that are present in your environmental sample, this technology is very much applicable to that as well, and as well as epigenetic studies. So it's a very wide range of application that this technology is very useful. So beyond this partnership by acquiring the PacBio, we also have other services that we render to researchers across the continents. As a matter of fact, we are actually one of the, I would say, the first company that started synthesizing primers on the continent, and these primers are being used by researchers from different parts of the continent. We synthesize over 1,000 custom primers on a daily basis. Primers can be in form of standard oligos, modified oligos such as probe, or even gene synthesis as well. We also do Sanger DNA sequencing in our lab here in Nigeria. We offer Sanger DNA sequencing services for researchers who are looking at specific gene regions, amplicons, and we receive different type of sample types: raw sample, genomic DNA, PCR product, but purified or unpurified, or even if you are able to prepare your sequence reaction in your lab, you can send it down to us and we just load it on the instrument for you and generate the data. We also offer mass array services for SNP genotyping, methylation analysis. For qPCR services for researchers who are interested in gene expression studies, you want to maybe look at relative or absolute quantification of gene materials in your sample, we can do that for you as well. And we also understand that not everyone have the bioinformatics skills to handle this sequence data. We also have the bioinformaticians on ground that can help you, draw meaningful inferences from your sequence data. And beyond that, we do workshops on training. It is a very key aspect of our objective. So we run on a regular basis workshops on training in the area of molecular biology techniques, molecular diagnostics, bioinformatics, and phylogenetics. So these are just snippet from some of the past workshops that we've organized. So on the product range, so we are more like a one-stop genomics company where you can get anything related to life science products, from sample collection that helps you preserve the integrity of your nucleic acid from the field, down to nucleic acid purification in the lab, extraction kits for DNA and RNA, your PCR amplification products, so that's your master mix, both for conventional and real-time PCR, reverse transcripted, any amplification reagent that you could think of, thinking of library prep, or even up to the library preparation reagent for NGS applications, and as well as software that can you can use to analyze your sequence data. So we cover every aspect of or any product in the whole workflow in your lab. And these are some of the brands that we represent in the life science industry. So these are brands that are well known, renowned brands in the life science industry globally, such as PacBio, like I mentioned earlier on, Seagen for molecular diagnostics, Ependor for laboratory instruments and the like, Tre for plastics, biochemicals, Protein-Tex for your antibodies, ELISA reagents. So anything you could think of when it comes to laboratory products, you can always reach out to us. So just to end my presentation, I would like to leave us all with this, that tomorrow's genomics discovery starts today. And with the power of high fidelity long read, researcher who study large or complex genome need no longer be limited by traditional short read technology. Now you can take advantage of read length and accuracy that allow you to see the full picture of the species you study. And this technology is right on the continent, available to you. We brought it to you by AfricaBP Biotech. So you can always reach out to us, and then we see how we can apply this in your research to achieve your research objective. Thank you very much for your time. And I'll be available to, answer any question that you might have. All right, thank you very much. Thank God.
Thank you, Larry. Yeah, I think I called it for now, the short form. All right. Thank you so much, Larry. Do we have any question for Larry? I must say we're working with Nkaba on several projects. We're sequencing genomes that haven't been sequenced before on the African continent. And for some of us that were here yesterday, we saw an example of one of those genomes. Today, we're also going to be seeing like practical, actual example of additional genomes later this afternoon. Does anyone have any question for Larry, please? Malaki, is this hand for the previous one or for this current? Malaki, you want to unmute? Okay. Unmute, please.
Good morning.
Good morning.
Okay, yeah. My question is this. For some PhD students who have a research work on antimicrobial resistance, like using whole genomic sequencing to find out antimicrobial resistant genes or drug resistant genes, is there any way that Nkaba laboratory can assist such young scientists? That's my question, sir.
Right. Thank you very much for the question. Yeah, absolutely. We have such service in our lab. So for the identification of maybe microbial species using 16S RNA method, so we can help you to identify the species. And then if you're looking at drug-resistant genes as well, of course, we can speak further on that. And basically what we would need is for you to, be specific on the genes that you're probably interested in, because there are so many antimicrobial resistant genes. And then once you're able to provide us the information on those genes of interest, then the next thing would be the primers that would need to target those genes to be sure they are present in your samples. So these are things we can definitely do in our lab.
Thank you, Larry. Do we have any question on site, please? Control? Is there any question on site, please? Larry, do you want to stop sharing, please?
Okay. This identify yourself as my name is my question goes like this. First and foremost, I would like to thank the presenter for this wonderful and precise presentation. My question is, you made mention in your presentation of the phrase haplotype result and genomics. So that genomics, I'm particularly interested in putting my question towards it. Is it different from genome genomics we do? And if there is a difference, what is the advantages attached to genomics? What are the likely advantages? Or what can we understand from genomics? Thank you very much.
Okay, thank God. I'm not sure if I really did not get the question clearly, but if you did, please.
Yeah, so I think
can
it wasn't
rephrase
it wasn't quite clear. So do you want to speak clearly, please?
In the slide I saw in place, you wrote it haplotype resolved by genomics.
Okay.
Genomics, ANGENOMICS. Genomics. So my question is it different from genomics, human genomics? And what is the advantages attached to that genomics?
Is it plant genomics or pan genomics? Plant genomics?
Pan genomics, I guess.
Okay, yeah. You want to answer that, Larry? So
okay, yeah. So
yeah,
yeah, go ahead, please.
No, you go ahead. Answer it, and then we can support it.
Okay, so what we mean by pan genome is simply a full coverage of the genome, having representation from multiple individuals within a species or specific, let's say, population. So when we say reference-based haplotype pan genome, so for you to develop a reference-based genome, you need a good representation of individuals within the species or population you're interested in. And the PacBio technology allows you or gives you better information in terms of the wide coverage in even difficult to sequence regions when you compare it with the traditional short read technology. So when we say pangenomics, you're able to like pull samples from, different representation of the population you're interested in, and then get a full coverage of the genome so that you can use that to, develop a reference genome that will be the representative of that population of interest.
Thank you, Larry. So do we have any more?
I hope I'm able to answer your question.
Are you there?
Yes, please carry on.
I'm working with Intel for a while now in biology, so majorly on standard sequencing for my research. But if they have a particular research I'm going to be working on metagenomic characterization of dendritic microbiome plants. So I wrote a petition request just last month. I was told that the institute doesn't offer Illumina sequencing for PacBio. So I was surprised I was charged 2 million naira for 60 samples. As any career researcher or a young lecturer in India, how do you expect me to research an amount to get the analysis done? It is really something I'm really glad that you are here. Probably there is something you tell us how to do that. Thank you. So,
all right, thank you very much.
Okay.
Yeah, of course.
Yeah, sorry,
yes.
before you answer, I think I've been wanting to ask a question that goes in that direction. Now, I need to add it up so that you can draw, take all of them. I'm Professor Tobias Etedio for Federal University of Technology. You see, as a faculty member, one of our concerns when you're designing a project to be run or to be calculated for a student to embark upon costs. And most times, we said I've encountered in cover in this program last year. And I get my contacts, and I try to use that contact to contact you people in relation with my students. And I find out that one of the things that scares them, and they grant you a difficult lecturer or somebody who makes life difficult for them, is when after coming to you, they see huge cost. Then they come back to you and say, this project is not feasible. Even when in the true sense of the outside cost, it is actually feasible. Now, the question is, except the faculty member has a grant, ultimately the student will bear the cost of his or her research. So, I want to ask you, sir, is there no program on ground whereby in Kaba can have an understanding that makes that easy for students in the continent, since you are now the reference point where most of the world, you have the technology, at least for now. And the lecturers through designing their work will now know that they have a partner that understands the system, the situation where in a country, Nigeria, with a very difficult economic circumstance. So please, alongside with that young man's question, these are the concerns I want to put forward. Unfortunately, he asked coming directly from the student himself and a young faculty member. Please find a way of addressing this question on a long-term basis that will affect researchers in our universities within the continent. Thank you very much.
Larry, you want to comment about this? Because this question came up last year, similar question. So I'm sure you can pass this on to the leadership. All right, Professor Julian?
Yes, I just want to say that we can respond to this question that three other persons want to ask questions. So by the time you finish it, then we'll take the other ones.
Yeah, and just so we need to be very, we are looking at time so that we can go for lunch break at that particular time. So maybe one question from the on-site participation, and then maybe one or two from the Zoom participation. And then Larry, you just hang around online a bit to respond to any chats that comes via the Zoom. Please, Professor Julian, go ahead.
Yes, I think there are almost 4 people here. It has to be brief. Yeah, just take the ones that are already asked.
Okay, online. All right. So we have 3 questions online. So Josephine, could you please unmute and ask your question very, very briefly because of time?
Yeah.
Very briefly, yeah.
Is it okay? Can you hear me?
Yeah, we can hear you. Please, very briefly in 10 seconds.
Okay. Okay, good. I have two questions. The first is, as they are not present in Benin, Benin Republic, did they offer internship to interested Benin students? And the second question is, did they work on phytopathologies in order to understand how a pathogen can affect a plant and, its metabolism?
Okay, Larry, very quickly, please respond to that.
Okay, so we do not have a physical office in Benin Republic, although we have a representative there. And in terms of internship, yes. So for internship, oftentimes we advertise if there's opening for internship. But for high T, let's take for example, industrial training, we do receive or accept, IT students on a regular basis, depending on the space in our lab. So I think if you're a student and you would need some, take advantage of the opportunity to learn some of these techniques, you could enroll through the IT routes.
Yeah, and just to mention that the Africa BioGenome Project has partnered with INCABA to organize a genome challenge in the past, and currently we are also partnering with them to organize a fellowship which will be taking place at the IITA. So the INCABA supported that genome sequences. AfricaBP provided the technical analytical expertise. IITA provided the sample collection and processing expertise. And one of the presenters spoke about
the second question.
Yeah, sorry, So I was thinking you finished. I wanted to support Larry's point that so many things we are doing with them, and at the moment
No, he didn't answer the second question.
Okay, all right. So Larry, could you please answer the second question?
Sorry, I lost you for a minute. Is it the same question around internship?
No. It's the second about phytopathologies. I don't know if you work on phytopathologies and how to understand how a pathogen can affect the plant metabolism.
So basically what we can do is maybe probably that will be more of diagnostics. Do currently is to use molecular tools to identify how those the pathogens that are present in maybe your plant species that is affecting them. We could use molecular tools to detect such pathogens. We do not do biochemical tests, but we use molecular tools such as qPCR analysis to detect pathogens that are present in your plant species or any species you're interested in.
All right, thank you, Larry. We just need to move ahead. Okay. All right.
Revolves around the concern of the students and faculty regarding high costs of achieving their analysis, sample analysis that are molecular in nature. And so we are asking, what is the INCABA company doing as a partner with academia in resolving this challenge of students being able to run their samples? And then the lecturers of the faculty designing research that will actually be all embracing, knowing that indeed there is a partner that will help in bearing the costs. Thank you. In fact, I'm sure that's really the mind of our people there.
Yeah, so maybe I can. So I don't work for INCABA, but Larry, I think there is a point because we've partnered with AfricaBP. INCABA is one of our one of the corporate partners. Larry, I think this is also where you do want to comment a bit on the partnership between INCABA and University of South Africa, because I know because I know the origin of that helped to bring down the cost, and so can you just unpack that a bit, because I think that is one way I see an entry route to this. So imagine you could have that kind of partnership in Nigeria. What would it look like, and how can that help bring down the cost for the organization? Just unpack that. It may not just be in genome sequencing, but in other aspect of your dealings, really.
Yeah.
So you want to
Thank you very
unpack
much.
that?
Thank God you actually spoke my mind. So we've been in the market for over 20 years, and we've seen that one way we can make impact in terms of not just building capacity but also driving down cost is to bring those technology down to the continent, closer to researchers. And that's what we've been doing. So in 2015, when we came to Nigeria, we didn't have a lab. what we usually do is send those samples to South Africa. Even if it's just Sanger sequencing you want to do, if it's PCR you want to do, we send your samples to, to South Africa. And that's, involves a lot of things like logistic costs. I mean, the cost of, clearing your sample, all those things, those sort of add on to the cost, which then, has a ripple effect on the cost of doing the research for the student. So, but now that we now have a lab in Nigeria here, it makes it, turnaround time is even faster. Researchers are able to get their results quickly. The cost has also tremendously, reduced. So that's on the, let's say, the basic techniques like the DNA and RNA extraction, PCR, qPCR, Sanger DNA sequencing. We've been able to make impacts in that and also driving down costs a little bit to be more affordable for researchers in Nigeria and even in West Africa. Just like Tengod mentioned, the UNISA and Inkaba Biotech collaboration, we're able to acquire the PacBio sequencing platform, bringing it here on the continent. That also, gives the opportunity for researchers to send their samples down to us rather than looking at shipping those samples out of the continent. And you all know that what the hurdle is involved in that. So those are ways we are, creating impact in the scientific community. And we are very much open to doing that also in Nigeria, because we believe once this platform is also in Nigeria, that would also have significant impact on cost as well. So we all know doing research is not cheap, especially when it comes to molecular biology research or genomics research. They are not cheap at all. And one thing we usually advise researchers or even supervise, you be the one to, take a burden of all the costs. You could group your students together and then they work on, significant number of sample size, and then they share the cost amongst themselves. That way, that sort of, reduce the cost on individual students. So those are ways, on the researchers' side, they can also help to, alleviate the cost of doing this research by students. And for us as well, depending on your sample volume, we are very much open to giving you discounts to support students, researchers as well. We give discounts where possible. These reagents are not, made locally in Africa. They are being imported from, developed country, and we need to buy them in, foreign currencies. All of these things also translate to the cost of, doing this, running this project on the continent. So we are very much open to support students in areas where probably we can give discounts depending on your sample volume. And then also on a larger scale, we are very much open to also collaborating with institutions to bring these technologies closer to you. In that way, that was a drive down cost of carrying out this research.
Yeah, thank you, Larry. I would just, so again, I don't work for Inkaba, but we've been working together, collaborating with AfricaBP. I'm going to post in the chat box a link on the press release, so that to kind of paint a picture on what Larry is talking about. And that is what I think is very good, especially on the African continent, to have that partnership, and between the institutions, the corporations. And this is an exemplar. It may not be the best, but it's a starting point that you could look at and say, okay, your institution cannot do this big thing. What can we do in reagents and things like that, right? So yeah, that link contains the press release on that as an example. We really thank you so much, Larry, and to the participant on site. We need to move ahead because the speakers are lined up and they have other things that they need to do. So if you have any further question, could you please put it in the chat box? Then Larry will be on standby to respond to your questions. Emmanuel and Chukuma, thank you so much. The next speaker is Acclaim Moila. Thank you, Larry. Acclaim Mola. Acclaim, I'm going to make you a co-host, please, so that you can share your screen and unmute. Acclaim is, again, we're going to be listening to Inkaba. Acclaim Mola is a scientist at Inkaba, and he's going to be talking to us. Now, he's not going to be talking about Inkaba as a business. He's going to be talking about the science Inkaba and AfricaBP and IIT are doing in genome sequencing, because we've recently sequenced the genome of Gambia species. And this was a joint partnership between the African BioGenome Project, Inkaba Biotech, and the International Institute for Tropical Agriculture in Ibadan. And of course, Gambia species, which is the white star apple, many of us know it, is called agwalumo or udara in Igbo language. Acclaim will talk about the wet lab that went into this work. And later this afternoon, IITA will talk about the sample collection of field. Yesterday, one of the scientists from Kenya talked about the genome assembly work. Over to you, Acclaim, please.
Great. Thank you, God, and good morning, everyone. Thanks for having me. I'm just going to go ahead and share my screen. Great. Can you see that thing, God? Yeah.
Yes, please go ahead.
Okay, cool. Yeah. Again, my name is Acclaim Wheeler. I'm the application specialist for genomic services as well as PacBio portfolio, and I'm based in South Africa, the Thermo BioTech headquarters located in Pretoria. So as God mentioned, I'm going to take you through the two procedures that we did on the Gambia species, which is first generating the Hi-Fi data on a PacBio platform, and secondly, doing the OmniC sequencing on a short read platform. Basically, OmniC it's a technique where we look at a high-C for chromosome scaffolding. Now, first of all, obviously, the first part is to generate the Hi-Fi whole genome data. And this is specific to the PacBio platform, whether it's the SQL2E or the new Revio and the Vega systems. They all generate the same type of data set. Now, what are Hi-Fi reads? So basically, the Hi-Fi reads are produced using the secular consensus sequencing mode on PacBio platforms. As mentioned, the SQL2E Revio and then now the Vega, and provide base level resolution of 99.9 accuracy. This is basically your 30 or 90% of your bases will be in Q30 quality. Now, how do we generate this Hi-Fi data set? Basically, what we do is just a pointer. So we basically start with a very high molecular weight, which is a very critical step in Hi-Fi sequencing. You have to get a very good high molecular weight DNA. And then we take that genomic molecular DNA and shear it to roughly 15 to 20 kb long fragments. And the next step would be to ligate these adapters. If you're doing more than one sample, these adapters will be barcoded and they will have the same barcode on both ends. And then the next step, once you've generated your library, you will then do what we call the sequencing primer annealing, which is you see here in orange. So as you bind your sequencing polymerase, which you can see here in gray. And then this is what goes into the sequencing machine, which uses the smart cell, which we'll see later in this. Basically, during sequencing, what happens is you have this molecule, your double-stranded looped structure. The polymerase will go around that molecules at the end of the day, making it a circular structure. Therefore, the polymerase will go around that molecule, generating both forward and reverse sequences. And of course, that will also include the adapter sequences. And then this goes on. If it's a 30-hour runtime, it will go on for 30 hours. If it's a 24-hour runtime or 12-hour runtime, depending on what is being sequenced, this will go on and on. And so basically what you end up with these forward reverse molecules, and of course the adapters at the ends. But the adapters at the end of the day are chopped off. But like I said, we're using a natural polymerase. And as you know, polymerase is not a perfect molecule. It's not perfect when it does this replication. And therefore, it will introduce errors. However, and what is most important to note here is that these errors that are introduced by polymerase in each and every step of sequencing is that are random. So by random, I mean that you look at these red dots here that you see in this strand, they are randomly distributed, meaning that if you generate enough molecules of the same, enough reads of the same molecules, and you take all those subreads and you generate a consensus sequence, you basically flush out all those errors. And what you end up here is a very, very high quality consensus sequence we call the Hi-Fi reads. And this is what gets sent to you, and not this. And this does not need any type of polishing. You can literally just go in directly into your bioinformatics pipeline. And another big point here is that these files are very, very small in sizes. So the machine does most of the job for you. Generating the sub-read sequence data takes a lot of the space on the system. But processing this sub-reads into this happens within the instrument. So you don't need to invest so much into the computing. This is all done within the system. And what you get is this compressed or CCS read that is so small in file size. And then this is what you get exported or sent to you. Now, let's look at what really differentiate our system from other technologies is that obviously we have long read. We can sequence anything 1 kb to 25 kb. We do shorter amplicons as well, less than kb amplicons. You get this really high level of accuracy, as I've mentioned in the previous slide. We sent you the Hi-Fi data, which is really of high quality. You get a uniform coverage across the molecules. We don't have issues with the repetitive region or any genome complex areas. So we sequence uniformly across that molecule. And of course, this is all done on a native strand. We are able to pick up methylations in real time. And then all of this takes place sequencing in the smart cell. This is a smart cell chip. It has about 25 million nanowells. We call them the zero mode waveguides nanowells. And as you can see here, each well will have typically a single library construct. And that library will be covalently immobilized at the bottom of the smart cell. And the polymerase will do its thing as nucleotides are introduced into the wells. And then we'll get base calls across the chip. Now, PacBio workflow spans from sample prep through to analysis. This is a complete system from sample prep to bioinformatics pipeline. For sample prep, as I've mentioned, we really need high molecular weight, genomic DNA. So here you avoid kits that use like beads to bash beads basing techniques. So you need to have we need to have the genomic DNA in its intact state. So how do you see this is when you run the QC after extraction, you should see most of the fragments in Q4 in 40 kb, 50 kb on your this binary tape station or fragment analysis. Most of your fragments should be over 40 kb. And we have a nanobind solution. The pen DNA basically covers about every species. Well, not every species, but every sample type from plants, bacteria, cells, blood, saliva, mostly recently, and all those kind of things. And then you have one that is specific to cell, bacteria, and blood. But most of the time, you'll just buy the pen DNA, which covers most sources. And this is what we use to extract high molecular weight. And then the library prep, you have library prep samples, some kits ranging from 24 reaction to 96 reactions for different sample types, and as well as RNA sequencing. So in terms of the RNA, because it's a long-read technology, we also sequence the full length of the RNA transcripts, and this gives you a view into a splice variants, because you're sequencing the entire transcript as it is without breaking it down into smaller pieces. So you are able to look at isoform variants, and we can do that for single cells as well. We have kits for library prep for that, and the sequencing. We have now the Vega, the smaller platform, which is a benchtop. And of course, as you would have seen from Landry's picture, it's him standing next to the review. This is more like a production scale system. And of course, each platform has its own sequencing kit and smart cell trays and polymerase kit. So the Vega trays or sequencing plate or sequencing polymerase will not be acceptable in a review and vice versa. And then the analysis software, the nicest thing about the PacBio system is that it comes with the bioinformatics tool. It's called the SmartLink, which is a browser-based system. When you get the system, you get the software, and there's no license for it. You can use it forever without worrying about licenses. But also you can use it if you don't have the PacBio platforms. It's just that if you don't have the PacBio platforms, then you need to invest on computational requirements. Now, molecular weight, as I've mentioned, we did use the nanobind pen DNA kit to extract plant nuclei. Basically, what happens is here, if you can see, we don't use the beads, so you actually use the magnetic glass beads, which allows after the lysis step, the genomic DNA will kind of wrap around that disc. Nicely around that disc without breaking, and then after a couple of steps, wash steps, you then elute from the disc. So actually, this is what you can see. You literally see this this DNA with your naked eyes when you do this extraction. That's when you can realize how much DNA you have. Now we did this extraction. As you can see here, this is some of the extraction QC. From genomic DNA, you can see how much we got, 916 nanograms per microliter in 150 volume, which gave us a total of 144 microgram. And then we did some dilution. We took about 82 nanograms per microliter in 50 microliters into the mechanical shearing, the Megaraptor shearing. And after shearing, this is basically where the shearing we control to say we want between the sizes. And then after the shearing, you do a concentration and cleanup step, and this is what we recovered. And we did the smart bed library prep from that, and this is how much we recovered at the end of the day, which was more than enough to load smart cells. And of course, we don't just use the qubits as a QC method. The most critical one is you have to run the tape station or the fragment analyzer. And as you can see here, as I've mentioned earlier on, with your genomic DNA, this is what you want to see as high molecular weight. You can see here that most of the genome DNA are over 60 kb. This is what you want as, for long-read sequencing. And then after the Megaraptor, you can see it came down to 24 kb fragments. And then we take that into the library prep. This is basically the library prep would have followed using the Smart Bell Prep Kit 3.0. Of course, this get updated regularly with the new chemistries, new kits being released. Basically, what you do is you can skip the first step, which is if you have in most of the short reads, like less than 10 kb fragments, you can use the short reads eliminator tube to eliminate anything less than 10 kb. Otherwise, if you have a good library, good shearing input, like we did, you just go straight into the end repair and DA tailing. And then like get adapters and cleanup, nucleus treatment, which you would get rid of anything that is not used at this step. You do the ampere beads, and then you annealing, binding, and cleanup of your complex. This is now a step where you will have your library with loop adapters, sequencing primer annealed, and the polymerase bound. And this was the QC of our library. You can see again, we still have retained very good sizes in terms of the distribution of our library there. And that is how much we recovered. The next step then, once you've completed your library, and then we go into the system itself, the SmartLink software, which allows us to make titration dilution in terms of amount of sequencing primer and the polymerase you should add to your library based on the concentration as well as your insert size. And then you log into your browser-based SmartLink, you go to sample prep, which will allow you, this is how much based on your library QC, which is the size and the concentration, this is the amount of the sequencing primer you should add and the amount of the polymerase you should add. And then once you've done that, you go into the run design. The run design is basically telling the system, look, this is how much I've recovered of my library, and this is where you pick up the library on a sample plate, and sequencing on how many number of cells. Basically, this is the instruction to the instruments as where is the location of the sample, how much smart cells to load, and what is the application. In this case, Hi-Fi application. And then we did the sequencing, and this was done before we got the Revio. We did it on the SQL 2E system, and we did it across 2 smart cells. And the SQL 2E smart cell would get you anything. If it's a good library, you should get 25 to 30 gigabytes of Hi-Fi data. Remember this as I've mentioned earlier and during Hi-Fi generation slide, this comes from almost a terabyte of subreads. So that almost a terabyte of subread is compressed down to generate the CCS Hi-Fi reads, and this is how much you end up with, which is easily stored, it's easy to store. So if you look at the run output matrix, so we generated 1.9 million Hi-Fi reads, and we were able to get over 30 gigabytes of Hi-Fi, so 31.15 gigabytes of Hi-Fi data. And our average insert size was 16.64 kilobases long. This is really, really good. And the mean quality score, Q33. So that means we have sequenced the library a minimum on average 12 times. So basically the polymerase sequenced that insert size 12 times on average. And then the next cell, when we produced 2 million Hi-Fi reads, and that gave us almost 35 gigabytes of Hi-Fi data. You can see in both cases, this was a really good run. We surpassed what was recommended by PacBio. And in this case, you can see the sizes, this is much longer. And therefore, the quality score came a little bit lower compared to this one, but this is still what is recommended. And because the insert size is much longer, the molecule went past sequence that fragments this time around a mean average of 10 times. Then the next step was to do the OmniC. So, like I said, the OmniC is the application that we use to sequence to look at chromosome scaffolding. So when you combine the Hi-C as well as the OmniC data, you really can get in most cases probably T2T assemblies. And this is come from a Dovetail company, and also they are our partner. If you want to do Hi-C libraries and sequencing, you can contact Landry or our East Africa office to get the price on the kits to do your own libraries. So basically, these are the steps that we did. So the difference here is that we don't do any genomic DNA isolation. We work from the actual tissue itself. So we go into the cell. So you do lysis, and once you open the cells, you have to do the cross-linking within the cell. So there's no genomic DNA that is isolated in this case. So during the cross-linking, obviously this plant, you need to crush it with liquid nitrogen because the plant cells are quite difficult to break. And then the second, which this one, just crushing with nitrogen and trying to link to cross-link from that failed. But the second time we did nuclei isolation, which was successful for cross-linking. Cross-link is basically just to the process that kind of does proximity ligation of where the distances to chromosomes. And after that, you do a QC step, and which is also this here is a critical point because it will tell you if your cross-linking and digestion was successful or not before you can continue into the library prep and sequencing without knowing if your library was good or not, only to find out at the end of the sequencing, which would have been a very expensive process. So we do a QC here to run the fragment analyzer or type station, and ideally you would want your fragments to be in this range. I think it's about 100, between 100 and 500 to be the sizes to be in that range. And this is, as you can see, this is what we got in our QC, lysis QC. We can see it's pretty much in the recommended size, and which allows us to continue. And then the library, after that, we did the library from that. And then, as you can see, size selection, adapter ligation after following all those steps. This was our library, which was very much good as well. And then, of course, if you see the small peaks here, you just need to do another wash to get rid of this, because this will be your adapter dimers. You need to get that because they would bind to the flow cell and therefore complicate the signal. Before sequencing, of course, also there's a small step which is now we no longer have to do, but before we would do what we call the shallow sequencing or the QC sequencing. Because we don't use Illumina platforms, we use PacBio platforms. Also for short read sequencing, it's called the ONSO. So basically, the kit that we used is compatible with Illumina. So that means for us to sequence it on the PacBio ONSO, we had to do the conversion for it to be compatible with the ONSO system, which is like 4 PCR cycle steps. So you can see read 1 here. We generated this amount of data in millions, which equaled to roughly 108 million Hi-Fi reads for read 1. And that equals to 13 gigs of read 1 data. And you can see the quality here, really, really impressive. 90% of your data are over Q52. Read 2, you generated more or less the same, 106 millions of reads, roughly 15 gigabytes of read 2 data. And again, as you can see here, over 90% of your bases are over Q48, which is really, really, really impressive. So when you combine read 1 and read 2, you really get you get total amount of data and reads produced. And then we load this into our system just to elaborate more on how the ONSO versus Illumina technology works. So as you know, Illumina uses sequencing by synthesis technology. In this case, we use sequencing by binding. Okay, sequencing by binding technology. So basically what happens is you will have the sequencing is initiated by a polymerase on the DNA strand with a reversible blocker on the prime end. So you'll have an actual base here with a reversible blocker here on the 3' end, which prevents the incorporation of the new base. Then during the interrogation is basically the polymerase will assess as to which base is correct. Okay, during the integration, fluorescently labeled bases flood into the flow cell. You can see here the fluorescently labeled bases will flood into the flow cell. And unlike traditional SBS sequencing, these tagged bases do not include a blocker. So in this case, there's no reversible terminator here on the fluorescently labeled tags. Once the appropriate base, tagged base binds to the DNA strand, a fluorescent signal is emitted. Like for instance, here in this case, you can see the T, the fluorescently labeled T came in. That is a good match. Therefore, the signal will be emitted and captured. However, we don't cleave off the fluorescent in this case. This whole molecule goes off. Okay, this molecule is released because we know what signal, what base needs to be introduced. In this case, the T, it goes off, and the next step is that the blocker here, which was initially here, is released so that the natural nucleotide, which is a T, can incorporate. And this is what brings the quality of ONSO sequencing into perspective here. The sequencing takes a little bit longer, but because this step is separated, but the ability to sequence the actual polymerases, the natural polymerases ensure that you get the high quality of base calls. So that is the major difference between the SBS as well as the SBB from PacBio ONSO system. There's a new protocol for doing Hi-C with the long reads. It's called PacBio Hi-Fi. It's a very new protocol. We are still looking at implementing it, and we will see if it can replace the Omni-C in the long run. So it will be from the preliminary data, it looks really, really good, and we something that we want to introduce on our side. Thank you so much for your time, and I'll take any questions from here.
Thank you. Acclaim for the presentation. So maybe if you stop sharing your screen and then we can take the questions. So there are two speakers, Udwak, and you'll be speaking next. Udwak and if you just 1 moment, let me find your names. Udwak and Ifoluwa, yeah, I'm right. So please hang on. Ifoluwa will speak next, followed by Udwak. Okay. Does anyone have any question for Acclaim? Shall we start from the participants on site, please?
Yeah, we have one.
Online participants, please raise your hands or put the questions in the chat box.
Thank you very much for the wonderful presentations. Basically, it's more or less like a collaboration. I have this particular project I'm currently working on using this PacBio, and I don't know, it's actually revolves around characterizing the physical and atmospheric microbiome in emitting sorghum plants. I want to make use of the PacBio technology. I don't know if I can, what are the chances of collaborating with you since the micronutrient on PacBio, on like you actually characterize the plant and sequence the plants using the same technology? Thank you.
Okay. If I go, okay. Yeah, if I get the question, is it possible for you to collaborate with us on using the PacBio technologies? Is that right? Did I hear the right thing? Thank God.
Yeah, I couldn't also hear the question clearly. So I couldn't. Could you please repeat your question, but clearly this time?
Yeah.
I have a study on quality of the like genomic characterization of microbiome in a meeting sorghum plants using the same Hi-Fi.
Can you hear? Yeah, I
So
can't.
microbiome analysis on PacBio.
Okay.
Now, as an researcher in Nigeria, are there plans like, is there any way I can actually collaborate with you just to ease me of the financial burden? Thank you.
Oh.
Previous question, cost.
Okay.
PacBio to do his work. Can you help yourself? And to what extent can you ease up his financial problem? Hope that's what you said, sir.
Okay. I think I got. Okay. Can we collaborate you because we have collaborate with you for microbiome sequencing on the system? I hear you have some challenges with funding for the project, right? So for me, as a lab based in South Africa, you will need to talk to Lanry and see how best they can assist you. And if they are able to assist you or talk to us in a way that we can agree, we'll be happy to sequence for your samples. But you need to speak to Lanry for in our West Africa office, and I'm sure we are open to collaborating with researchers. Of course, we'll have to weigh what the impact the project would have in what you're trying to do.
Thank you so much. Do we have any presenter online? Raise your hand, please, or speak. All right, the on-site presenter, please go ahead. One more question, please, so that we can move to the next two speakers.
Thank you very much for your presentation. My name is Dr. Edith from University of Delta Abo. My question for you, sir, on Hi-Fi read. How efficient is the Hi-Fi read sequencing protocol in epigenetic profiling when compared to de novo assembly and structural variants in whole genome studies of species with no reference genome?
Okay, that's a very good question. Thank you so much. Actually, the Hi-Fi, like I said, as I've mentioned, the Hi-Fi data, which is a very provides you long reads, is very ideal for structural variation. You get access to regions of the genomes that you probably wouldn't be able to access with short-reads data. And in terms of the epigenomes, this is an automated process and the free data that comes with the Hi-Fi data. So because we are sequencing a native DNA, an unmodified DNA, we pick up methylation across the genome. And when we send you this Hi-Fi data, we also send you with the epigenome BEM files. You can use that to do a hybrid mapping with the Hi-Fi data. But if anything, the long reads will always give you the best de novo assemblies compared to short reads data. And also, we've seen now that the cost of sequencing on long read is pretty much on par with the short reads data, with the short reads sequencing cost. So if you want a near complete genomes, assemblies, good de novo assemblies, that will give you access to all types of analysis, structural variation, indels, whatever you may be looking at. Long reads will provide you with good data, good access to that. And also to add to that is that we have pipelines solution that already have these pipelines set up for you. So in SmartLink, when you go to analysis, you have all this pipeline set up, the structural variation, duplications, all set up in SmartLink. So anybody who's not a bioinformatician can actually do analysis on SmartLink because the pipelines are there fully set up. But also the data, it's FASTQ files. That means it's compatible with any other third-party bioinformatics pipeline. So you can export the data and use your already existing pipelines. So to answer your question in short, the Hi-Fi read is very, very efficient because it gives you a much broader view of the genome, epigenome, and transcriptome, basically. And therefore, you will be able to analyze all types of analysis with SmartLink. So like I said, when I started, this is a complete system. From sample to analysis, it's all in SmartLink.
Thank you so much, Acclaim. Please, there are some questions in the chat. We have to move ahead now because we have 2 more presentations before we break out for lunch. Lunch is at 12, which is in the next 30 minutes. So the 2 presentations will be oral presenters, 2 oral presenters. So on-site participant, do you have any question? Just 1 more maximum, please.
Any other question? Okay. For now, none, sir.
Okay. All right. So thank you so much, Acclaim. The next
I saw a hand for Ebuka Prince. Is it?
Okay, Ebuka. All right. Okay. All right. Ebuka, could you please ask 1 more question? Unmute yourself. Unmute, please.
Unmute yourself, yeah.
Okay. Good afternoon, sir. Thank you so much for the class. Okay, I just wanted to have a kind of overview on this PacBio, because when you were speaking on it, my network was having a restriction. Just a kind of summary of everything in it.
Okay, I'm gonna try as quickly as possible. So basically, with
Acclaim, if you can just be very brief so that you answer, please.
Yeah, so I'm not going to even share the slide here. So basically, with how Hi-Fi works is that we take a long stretch of DNA. Okay, if it's genome sequencing, we take a high molecular weight genomic DNA and we shear it down to roughly 15 to 20 kb fragments, and then we ligate a looped adapters. After we have ligated those, and we then anneal a sequencing primer and bind the polymerase. This happens on the desk, okay? And once you have your bound complex, that's your library with adapters and a sequencing primer that is annealed as well as the polymerase, we load that into the smart cell. And then during sequencing, basically what happens is that the polymerase will go around that molecules, eventually becomes a circle. So Hi-Fi, that's how Hi-Fi reads are generated. The polymerase will go around that molecules multiple times until it dies off or the runtime is over. And what you get is that because it sequences the same molecules over and over again, you're generating many reads of both forward, reverse, forward, reverse, forward, reverse. But what the system does after the sequencing is that it takes all those sub-reads and create one single consensus from that fragment. And this is where basically the question of high error rate from PacBio kind of goes out the window, because from creating a consensus from sub-reads, you basically flush out all those errors, because the errors that the polymerase introduces when it's sequence, they are random. And when you can generate many fragments of the same thing and create consensus there, you basically flush out all the errors. And what gets sequenced to you is that consensus sequence and not the bunch of sub-reads. And that is what we call the Hi-Fi reads. And that is applicable to Amplicon's whole genome sequencing transcriptome data. It's all the same technology. I hope I was able to do that.
Yeah, thank you, Acclaim. So we're going to move to the next presenter, and thank you, Acclaim, for coming. Can you share your slide? No, I know you can. Can you share the slide with me?
Okay, sure.
Yeah, just share it with me, and you let me know whether you're happy for me to share with the participants. So, but yeah, it would be helpful for us for you to share it with me, and then just let me know via email if you're happy for it to be shared with participants or not.
Okay,
right?
Cool.
Okay.
Cheers, bye.
Thank you. The next presenter would be Ifeoluwa. Ifeoluwa is from the University of Medical Sciences, Ondo, the Department of Biosciences. She will talk about exploring African anti-diabetic plans for potential anti-diabetic cardiomyopathy compounds. Ifeoluwa, are you on the call now, please? Ifeoluwa, I'm going to give you... Okay, now she's not on the call. She's not on the call. Yeah, do we have Udwak on the call? Udwak? Udwak, are you on the call? Okay, I'm going to make you a co-host so you can make your presentation. Please go ahead and present your work. Udwak is at the Department of Genetics, University of Calabar. He's going to talk about his genetic diversity analysis of African yam bean accession using MAT-K gene markers. Over to you, Udwak. Could you please share your screen?
Can you see the screen now?
We can't see your screen, please. Let me see. Let me spotlight you. We just hang on. Let me see what's happening. Yeah, you need to put on your video for me to spotlight you.
Okay. All right.
Yes. That's okay. Yeah. All right. Is it on now? It's not on yet.
I'm almost there. Just hold
right.
on. Okay. The video is on.
All right. I will add you to the spotlight. Then you might need to share the screen, and then we can see your presentation, please.
Share screen options.
If you go to the bottom, if you go to the, sorry?
Can you see it now?
No, we can't see it. So are you using a Google slide?
No, I'm not. I'm using my
PowerPoint.
Yes, PowerPoint.
Yeah, so can you first of all share your screen first? You just share your screen so that we see your screen. That's the first thing. At the bottom, go to the bottom. At the bottom, you will see share screen. That will be the sixth icon. The sixth icon from the left.
No, I've seen. I got here, and okay, yeah, that's cool.
Yes. So now we can see your slide. Then you now have to so you now have to find your presentation. So we can't find your presentation because we can see your slide. You can see your desktop, but we need to see your slide, please. Yeah, so maybe you might want to close the WhatsApp or something.
Oh.
Yeah. So.
Can you see?
No, we can't see because it looks like you've closed your the. So reshare your screen again.
Okay, so I think I'll quickly do that now.
Yeah.
I think he should.
Is it visible now?
No, it's not. Wait, sorry, what did you say, Victor?
Yeah, I think he's selecting the wrong thing to share when he wants to share. He should share the
Yes.
live.
Okay. I think what you did is, why don't you say have your slide open?
Yeah.
Can you click on your slide? All right. Okay. I think you're starting up. All right. Yeah. Here we go. Then just go to slideshow and then share it. You need to click slideshow.
Yeah, I'm there.
Okay. This works.
Okay.
All right. Finally, we got it. Over to you, please. Please, you have 10 minutes, 15 minutes, then we can just, because we need to wrap up for the break. Thank you.
All right, thank you so much. So it's a pleasure being here. It's, I would say, good evening from where I am. I'm somewhere far away in Asia, but I've always looked forward to BioGenome Project, this workshop, to be part of it. And quickly, I'm going to be talking briefly on a preliminary result we have had in the ongoing research we're currently working on, which is genetic diversity analysis of African yam bean accessions using MATK gene markers. Now, before I go into the background of this study, I just want to emphasize that, again, these results are just preliminary results, and it's born from the first experiment that we did, and it was a keen advice from Professor Julian Osuji there, who before now we worked on RBCL gene, and we characterized about 50 African yam bean samples from different countries in Africa. And what we discovered was that we had a high level of similarity. We couldn't find that genetic diversity that we were looking forward to. So he also advised that we should move further and then do this work with other chloroplast gene markers, which is the reason why we decided to go. And we've started, though, with IITA collections yet. And then we're also presently collecting samples from different regions in Africa. So these samples we're collecting right now are land raisins, not accessions, so that we can see if we can achieve the diversity that we're looking at. So before we go into the diversity discussion, we need to understand that African yam bean is a tuberous legume of tropical origin from the family Fabaceae, and it is very, very important, most economically important among the 7 species of Phenocillis. It is neglected and underutilized species. Yeah, we could just say that the reason why it is totally neglected is because for some local farmers who cultivate this crop, it has a difficult cooking time. That's a long cooking time. The maturation is low, is too long to get matured. And then because it doesn't get soft easily, people just neglect it. They don't like eating it. So African yam bean has immense potential for nutrition as a nutritional security crop in sub-Saharan Africa. So the uses of this very special yam bean, for those who are not in the area of plant studies, just to let you know that this particular crop has tubers in its root and also bears bean in its shoot. So it's a very unique crop. So first, it is consumed as food and also given as feed to farm animals. It is used in some communities for socio-cultural uses, as in some places they use it for as a special meal served during traditional marriages, and also it is also used for as anema to keep. It is believed to provide solution to some illnesses. So it is used locally as anema. The leaves can be used as anema. So the leaves of this plant has shown very high affinity to biological control of some sort of insecticide. It can be used as insecticide to run away some pests, around the farmland. And also the dead leaves are used as fertilizers because it also aids in the fixation of nitrogen. Now, the major constraint to why these crops are not well cultivated or why is that it has a continuous loss of genetic diversity. Like I said, lack of interest. People now believe in cultivating just the few sessions or land races that they have around them, because every farmer that is into this business would want to cultivate crops that is sustainable for his household. In short, suffice to tell you that most of these crops are consumed by the local and rural people, because people in town, of course, I would ask, what did you eat today? A lot of you would say you ate rice, and which is the common staple food around. But unfortunately, this food that we have at our disposal do not have the nutrients that the body desires. We've been talking about nutrition security, and then it's high time we look at these special crops like African yam bean that shows has a high nutrient. Unfortunately, the long maturation period is also a limiting factor compared to its contemporaries like the bambara granite, the soybean, and the other legumes. This has a longer period to get mature. In short, in the field experiment that we did, we could not even find the tuber after 6 months. Even above 6 months, at 8 months, we could not find a visible tuber. And then we wonder, if we were all to cultivate this crop for tuber consumption, how do we sell it out to the marketer, to the consumers? And it has very hard seed coat. I have mentioned that difficult to cook. And then need for stake and streaming of vines. You need to constantly stream and stake the crop so that it can give you good yield. And then some human perception that it is not really that good because of the long period and all that. So people just neglect it. Now, before we go into diversity studies, we just need to understand that for you to do a proper breeding, maybe selective breeding, you must understand the genetic diversity that exists in the plant of interest of which you intend to work with. So in this case, we know that in plant, most times what we use for identification and other kinds of molecular experimentation are mostly chloroplast gene, because they play a key role in the photosynthetic process and the growth, development, and metabolism of plant itself. So, of all these major genes that have been used, we know that unlike in the animal specialty, what they have some very designed macro satellites that are used for barcoding. And then, but in plants, most of the barcoding work or most of the molecular work are done using chloroplast gene. And amongst the chloroplast gene, MATK gene, just like we have the RBCL gene, we have other genes like the ITS and the rest. MATK gene proves to have very key uses, like in DNA barcoding and phylogeneticists. It is primarily used as plant DNA barcoding, and also in phylogenetic studies, it is used helps in identification of unknown plant samples. It also helps to compare plastic genomes and trace plant evolution. It also applied to assess genetic variation in plant populations and also assist in the splicing of group 2 introns. But what we're looking at here is the key use, which is used to assess genetic variation in plant populations. But one very intriguing factor of this particular gene is rapid substitution. It has a more rapid and fast substitution as compared to the contemporary, the RBCL gene, and also the splicing factor is very effective in distinguishing between plants. So what was the rationale behind the research? Like I said before, this plant, because it is neglected, is already going into extinction. So the understanding of the genetic diversity of this crop will help in selective breeding or will help in plant breeding for conservation purposes. If we understand that this and this is different, so if we cross this very distant variant species, we'll have the desirable trait that can withstand drought or withstand environmental factors, it will go a long way to aid those success. And one of the tools that can be used in predicting genetic diversity in this plant is the MADK gene, which is a chloroplast gene. And we believe so well that this will be used to, distinguish among the groups. The aim of the study was to assess the genetic diversity across 18 accessions of African yam bean using MADK. Now, you may wonder why we choose to work with very limited samples. This is a preliminary result. And then we also needed to look at just samples obtained from the IITA gene bank. And then after this, like I said, we have collected other samples from different countries, but rather from the locals, from the farmers, to see if we can get any form of diversity in this crop from the local land races. So the objective here, we just quickly needed to get the result out so that we see if the marker was viable enough to distinguish between the plants that we sampled. So to characterize 18 African yam bean accessions using MADK gene sequences and to detect single nucleotide polymorphisms, SMP, in MADK genes of African yam beans. Now, this slide shows the screen house of IITA Ibadan. That's the Genetic Resource Center where this work was done. And at this point, we had prepared the leaves of, we had planted the African yam bean seeds, and then we're already we're harvesting for DNA extraction. So this one explained the procedure that was carried out in the lab. The samples were obtained at 2 weeks or 3 weeks after germination. Fresh leaf samples of this African yam bean was used for DNA extraction. And we used the CTAP method of DNA extraction. And PCR was done with specific CBOL primers, marker primers, universal primers, and then sequencing was done using the ABI sequencer 3500. And then we purified the product. And of course, the data analysis was performed. And we looked at 2 ways, We look at the DNA sequence polymorphism that exists, and also we looked at the SMP mutation. And then we also look at the pattern analysis to see if there was any distinguishing, there was a differences between the relationship in terms of the phylogenetic relationship, and also to predict the linear genetic distance that exists in this crop. From the result, this shows the phylogenetic relationship that exists. Please pardon, the figure we have here has special codes. These were coded at the Biocenter of IITA. These were the codes that they gave. The cow here represents Calabar, meaning that samples were originated from Calabar. So they gave it this unique coding, and we understand that the phylogenetic tree provides an estimation of of relationship among taxa or sequences, shielding light in their potential common ancestry. So in the current study, we use phylogenetic analysis to explore the relationship among 18 accessions of African yam bean, as inferred by the MADK gene markers. Moreover, the grouping of the accessions in this study did not correlate with the geographical origin, because among this sample, from the passport data that we obtained from IITA, some of them were from Togo, some of them were from Nigeria, some of them were from Zaria. So you could see that irrespective of the country of origin, some of the accessions could cluster together. But the phylogenetic tree here shows 2 major clusters, which is the cluster down one here, and also the second cluster up that has about 13 accessions of African yam bean. The other cluster here shows only three accessions. So this phyllo simply shows us that there exists a close relationship amongst the 13 out of 18 of these these assertions. Now, if we look at the bootstrap values, we'll see that in cluster 1, it also shows that there was a very strong relationship among the 3 other African yam bean assertions that were obtained. Now, the linear genetic distance here, as revealed, showed us that the linear genetic distance between the sequences range from 0.08 to 2.03. Of course, that is a relatively linear genetic distance that can be considered, which also points to a minimal genetic diversity among this group. But interestingly, assertions from TS36366 and showed a high linear genetic relationship with relation to other assertions as seen in the linear genetic distance diagram. And it also showed here that Cal16, which gave us a negative relationship. Cal16 is TS285, gave us a negative relationship with, that is not negative, but the lowest relationship as compared to the rest. Now, it is important to note that the linear genetic distance, which qualifies the number of base substitutions per site between sequences, was used to measure the genetic distance among this group. Now, the linear genetic distance range between what we mentioned before, 0.08 to the value that we obtained. Most interestingly was that this result from the LGD also supports the earlier findings of the phylogenetic tree, because the assertions that had very short linear genetic distances were found to have closely clustered together in the case of 366 and the rest in cluster 1 that had the highest bootstrap value. Now, the DNA polymorphism here gave us a very interesting result. The genetic variation observed in the MATK gene of AYB assertions highlight a genetic basis of the diversity that we're looking for, rather than environmental influences. Now, first, we would put our concentration on the haplotype, number of haplotype. But what is haplotype represents group of genes inherited together, and a total number of 18 distinct haplotypes from here were identified in the study. Now, these findings suggest that the African yam bean, of course, from having up to 18, African yam bean assertions share a significant number of conserved genes, just like we found out in the earlier studies using the RBCL gene. And then this also points to that, indicating a close relationship rather than a diversity that we're all looking up to. Now, another thing we looked at was the nucleotide and haplotype diversity. Nucleotide and haplotype diversity. The haplotype diversity here the nucleotide haplotype diversity are key. Let me state this, that they are key parameters in assessing genetic variation within a population. Now, both are expressed as coefficients. Of course, with the haplotype diversity of 1.00, it thus shows and confirms that the genes are highly conserved. The haplotype diversity of MATK gene in AYB assertion was found to be 1.00, suggesting high conservation, which I have mentioned earlier. Now, the nucleotide diversity in this case is another important measure of genetic variation. It's synonymous to the expected heterozygosity. And also this gave us a minimal value, which also shows that there was little diversity.
Sorry, Dr. Udwak Edem, could you please maybe 2-3 minutes, because we can be able to go to the...
Yeah, I'm at the last slide.
Okay, all right, thank you.
Okay. So the SMP variation, the analysis of single nucleotide polymorphism in the MATK gene among 18 assertions revealed a higher frequency of non-synonymous mutation as compared to synonymous mutation. You can see from the slide presented before you, we had 87 non-synonymous mutation and 20 synonymous mutation. And also we had 80 transversions compared to 27 transitions mutation. Non-synonymous mutation involve nucleotide substitution that result in the production of different amino acids, thereby potentially altering the function of protein. Now, transversion mutation in which purine is substituted for a pyrimidine or vice versa were found to be more prevalent than the transition mutations, in which purines substitute for purines and pyrimidines for pyrimidines. Now, this suggests that majority of the genetic variation in the MADK gene across AYB accessions arises from non-synonymous mutation rather than transversion mutation, contributing to the population level variation. Now, the major findings was that the 18 AYB accessions exhibited a narrow phylogenetic relationship and substantial genetic distance. Now, results indicate a low level of genetic variation. Now, we are about to submit the results of the morphology with the field experiment, which also supports the molecular result that we had here. And this also shows that MADK gene proved to be a robust marker for assessing genetic relationship among African yam bean accessions. In conclusion, we can say that limited genetic and SMP variation suggests minimal breeding efforts and lack of significant genetic enhancement to date. And the recommendations we would say is that let us expand genetic collection efforts. It is important. I want to call on all scientists who are in plant genetics to look at this special area. IITA is doing a lot of work when it has to do with underutilized legumes and African yam bean very specifically. So we can do more by going back to the rural communities and getting the real land race, which we think we will find a diversity in it. And then implement targeted breeding programs, and also employ ASMP genotyping and whole genome approaches. Maybe we can use GWAS and do a lot of genotyping, which will give us a perfect result. This is just a picture showing my work here with some of my students from Malaysia, and it's been a wonderful experience talking to you, and thank you for your time.
Thank you, Dr. Uduak Edem. We have 5 minutes before we can actually break out for lunch and return back at 12 p.m. So we're just going to entertain one or two questions rather. Do we have any question on Zoom? So please feel free to use the Zoom icon to indicate raise your hand, or you put your question on the chat box. On site, is there any question for Dr. Uduak Edem, please? Dr. Uduak, do you want to stop sharing, please?
Okay.
Control, do you have any question, please? Okay, we lost the control. Let's wait for them for like an hour, or one minute or two.
Hello, can you hear us?
Yes, we can hear you. Please go ahead. Control, could you please go ahead?
Hello, Dr. Tangold.
Yeah, go ahead. We can hear you. Go ahead, please.
Prof, can you hear us?
We can hear you. Go ahead, please. Go ahead.
Professor Dwack.
Yeah.
Hello, can you hear us?
Yes, we can hear you. Go ahead, please. Can you hear me?
Very well, I'm with you.
Yeah, so I think the on-site participants are having issues with you.
Okay.
Yeah, just a moment. We can hear you. Please go ahead, Control.
Hello?
Yeah, we can hear you. Please go
Yes,
ahead.
I ask a question. Thank you very much for that presentation. My question is, since you're like, what's the common name for these particular beans in the country? What's the common name for these beans in Nigeria? Is it, sorry? Look, I've never heard that before.
Dr. Udwat.
What's the local name for what's the common name for this base in Nigeria?
Is it a local dialect name, or like, for instance?
Listen, let me just make it simple. The African yam have different local names in different places. Some people call it proposed in Igbo language. Some people call it so opposed. It has seeds, it has tuber. It's one of the orphan crops that have not really been researched much on. You find it especially in villages. It's not a crop that you find in most of these township markets. It is very rich. It's not edible. It's edible. It's not edible, right? It is very edible. The seed is edible, the tuber is edible. It's not common. Okay, let me the seeds. There are some bean seeds you see in the local markets. The seed coat is a kind of very tough. We cook it for a long time. Some seed coats are speckled. Some are brown. Some are milk. Yes. Each type produces its own seed coat color. And then the flower, the same thing. I am sure most of us know what I'm talking about.
Takes time to go.
It
takes time on cooking.
It takes time, yes. What do you call it in your place? Good. So many people have what they call it in different dialectical communities or groups. Yes, but if you go to the scientific name, you know what is Philistines? Okay, that's the scientific name. And the Igbo local is the opposite.
Okay, Prof.
Any other question, please? Okay. That's okay. Please, ladies, show yourself.
Thank you, sir. I wanted to ask, is there anything that can be done genetically to reduce the long duration of the the growth of the plants? Yes. Since he said one of the reasons why people don't plant it is because it takes a long time to mature. So is there anything that can be done to modify it?
Yes. A simple normal breeding to reduce the length of time before it flowers and fruits. That's simple breeding. And in the way of biotechnology, you can use gene editing. We were here yesterday when Professor Tui made a presentation. You can use gene editing to edit out, to remove whichever gene that is responsible for the long maturity, or to
includes a gene that can fast forward the microRNA. There are so many scientific ways you can use to address that part of the work. Also, as a work I've done to reduce the time. Yes, it's exactly the same thing. What you can do to reduce the length of period, the duration of period for maturity is the same science. The only thing is your target is different. You can target genes that are responsible for toughness of the seeds to make it, once you reduce that, because sometimes the seed becomes easier to use. And the same thing you can do to either elongate or reduce the maturity time. That's science. It depends on the target, the objective. How about ideas?
Okay, Prof. Yes, Prof.
Yeah, so I think we have one more question here. So I think it would work. From what I hear people are saying is that maybe in future presentations, please, you put the scientific name, the common name, the Calabar name, the Akwa name, something like that, / then that would help people. Because I see that when I listen to presentations, maybe in China, in Japanese or something, so they kind of just put / so that people can better understand. So I see people mentioning what the Calabar local name, the name in Agoipo local name is called Tetum. Tetum.
Can I respond to that,
yes,
please?
Yes, please.
Okay, so I it's an oversight. Like they've pointed out, I accept and I take responsibility. But I think I had the scientific name, and the common name is African yam bean. Now, in EFIC and Ibibio, since we share a very close relation, they call it Okpodudu. Okpodudu. And then in Igbo, they call it Nzama. It's a popular Nzama this thing that we and then Yoruba call it Sese or Ese. Sometimes in Hausa, some parts of Hausa call it Goriya or Gwangwo. It has several names. If, like Professor Suji said, if we want to list out the local names, but the thing here is, like Prof has said, the interest is like I wish we had the gene editor editing experts like Professor Valentine Tui spoke yesterday. What we should be looking at is look at how to reduce the hardness of the seed coat. So that people will now start cooking it like our regular beans, because the protein content of these beans is far higher. I think about 3 times more than what is obtainable from the common beans and any of its relative. That is why people are more interested in it. So if we can look at that area and then see how we can reduce the hardness of the seed coat, and also look at the long maturation period of this crop. And then I think Africa will move away from the consumption of rice and other available food, and then start cultivating this. Because another interesting thing about this plant is that it can survive in severe climatic conditions, even in drought. It survives even in flooded environment. It has this ability to survive in rare conditions, even in some soils that do not support plant growth, like sandy soil. The plant, it's something that we all need to go back and check our neighborhood. In our villages, we all grow this, especially those of us at the tropics, at the southwest Nigeria. It's mostly cultivated.
All right. Thank you, Dr. Udem. So we are 8 minutes past the hour, and we really need to be back at 1 p.m. because the other keynote speaker will be here at 1 p.m. So we need to break out for the lunch break, but we have to do 2 things. First, I see Ayopo Blessing Adekanya has her hand raised up. That's the only question we're going to take. And then I'll hand over to Professor Suji to introduce. I think I understand there's a short talk that needs to be made. So, Blessing, could you please quickly ask your question, and hopefully Udwa could quickly respond very quickly so that we can move to the next item. Blessing, please. Unmute. You have to unmute, please.
Yeah.
All right. Yes, go ahead, please.
Yeah, what's your choice for MAT-KB marker rather than SNP? That's my question.
Yeah, he's asking what's the choice for the MAT-KB marker rather than SNP. If I understand your question correctly,
Yes,
all right.
yes.
Okay, like I said earlier, we looked at looking at markers that can be easily used for identification of plant species. And from literature, MAT-K has been before now it was called the ORFK markers, has been very applicable in identification of plant species and also in DNA barcoding. So that informed our choice of that marker. Of course, we also look at what was available, the availability and affiliation with IITA. So they had universal marker like RBCL, MAT-K gene, and ITS. So far we have done with RBCL. Currently, this result is from MAT-K, and then we're looking at sampling other possible markers like you call SNPs. We can also look at it to see if we can have a more viable result.
All right, thank you, Dr. Udwag. So, Professor Suji, do we have one? I understand there is one more comment or one more presentation, rather, or not just presentation, but a remark from the University of Port Harcourt, a member of the University of Port Harcourt leadership.
Yeah, before the council, before the speaker goes away, we have a short time cooking time for rice. We have a very long time cooking for this particular species discussed today. Can we, those of us who work in this area, take out a possibility of a blend between the advantage of short time rice cooking, which there's no food here, and the nutritional quality, high nutritional quality of the beans or this seed, so that we have a rice that has the nutritional enrichment of this particular seed. Let's take care about this direction so that we're going to have something that is stable and easy to yet enrich with good nutrients from these beans.
Yeah, thank you, Prof. I'll introduce the speaker, Dr. Bobari. He is the head public health unit of hydrocarbon pollution remediation project. He's here as instance of the project coordinator, Professor Nemi Zaki. Yeah, he has a speech to make to us on behalf of the project coordinator. Thank you. Yes,
Good afternoon, everyone. My name is Dr. Bobari, head of public health Hi-Fi. I'm here to read the Google message from my boss, Professor Nemi. With distinguished guests, esteemed colleagues, and dedicated partners, on behalf of the Project Coordination Office for the Carbon Pollution Reduction Projects, I present all participants of this conference, united by a shared vision to explore how biodiversity approach can sustain and enrich livelihood across North Africa. This gathering comes at a crucial time. Our region is blessed with rich biological and cultural diversity, yet it also faces mounting challenges for environmental degradation, the public health threats. These challenges are complex, interconnected, and demand policy solutions. The promise of biodiversity genomics lies not just in its scientific power, but in potential to serve people, to protect food system, conserve ecosystem, reduce health risks, and ultimately support resilient traveling communities. When paired with the One Health framework, is offer a path forward like both innovative and inclusive. Their participation in this conference indicates a commitment to collaborative research, engender evidence-based policymaking and dedication to building capacity across West Africa for lasting, locally grounded solutions. Let this forum be a space for inspiration, knowledge, exchange, and for initiating sustainability research partnership. May the inside dialogue and connection formed here contribute meaningfully to the sustainability future we envision for our people, our ecosystem, and generation to come. And just to add, we at HiPrep are involved in genomic research study that has to do with environmental pollution. We have been having a lot of connection discussion with the International Agency for Research on Cancer. We just signed an agreement with them. It comes as a surprise to me that we have a research hub here in West Africa that also involved in genomic research, and also want to make it known that we very much want to partner with the genomic research group here in the University of Port Harcourt and other groups in West Africa, so that we can also build up our own capacity to have a research-based institute here, that we don't have to worry outside the country for research work of this nature. We having our own capacity, our own research hub here, where anytime that we have to do research that have to do with genomics, we can have our own people, our own equipment to get it done. So it's going to be involve a lot of discussion. I know after now, Professor CJ would love to meet with you and with your partners and see how this collaboration and partnership can be seen up. Thank you so much for the privilege. Thank you.
Thank you so much.
That's great. It's a beautiful development. Thank the project coordinator of HiPrep, Professor Baron Rick Zabin. We are looking forward to beautiful and very healthy, progressive partnership. Thank you. Dr. Campbell,
yeah, thank you so much, Professor Julian. So we also are very pleased with the remarks, and we'll be looking forward to the partnerships through the West Africa regional node of the AfricaBP. We have now come to the end of the morning session, and we'll be breaking out for lunch, and we'll be back at 1 p.m. in the next 44 minutes, because the next speaker will be here at 1 p.m. prompt. So please, let's be back at 1 p.m. When I say 1 p.m., I mean 1 p.m. West African time, or 1 p.m. Nigerian time, or 1 p.m. GMT +1. So let's be back at that time, and then we'll continue with the rest. We'll have several other presentations lined up downstream. Thank you so much. All right. Thank you all for returning back after the short lunch break. So we would have to begin the second session today. And I hope others will join us when they're back. And the on-site participants, I hope they are back now. Let me see. Oh, okay. I think they're going to join us when they're back. This session, we are going to be hearing from Dr. Ndodo Nnameka. Dr. Ndodo, I've just made your co-host. Please unmute and share your screen. Dr. Ndodo will be talking to us about, let me just bring up actually, he was supposed to speak yesterday, but he has to move it to today due to unforeseen challenges or circumstances. Dr. Ndodo Nnameka is a chief molecular bioengineer at the National Reference Laboratory, NCDC, in Nigeria. He will speak to us about building ecosystems for Nigerian genomes and projects. Over to you, Dr. Ndodo. You have the co-host right. Please share your screen and feel free to also put on your video if you may.
Hello.
Hello, we can hear you.
It's my name's Dr. Ndodo Nnameka. I'm currently the senior genomic consultant to the Global Fund to support NCDC genomics and bioinformatics core facility. So can you hear me?
I can hear you, but we can't see your slide.
You can't see it?
Yeah, we can't see your slide.
Okay.
Yeah.
Can you see it now?
Yeah, no, we can't see it. So we are just seeing your file browser or your Microsoft, your file browser, that's what it is, or the OneDrive. We're only seeing OneDrive, we're not seeing the slide. So what you want to do, maybe perhaps you want to download the slide onto your laptop and then beam it from your laptop.
Okay, let me stop sharing.
All right, that's fine. Yeah.
Sorry, I'll be trying to fix it.
All right, that's fine. Take your time.
So let me put this on. Okay, let me try to share again.
All right. So I suspect when you did share it, you should have picked the whole screen. I think you picked one section of the file browser. So you know when you go to.
Okay, let me try here again and see.
Yeah, just pick the whole screen.
Okay.
Now you can see your file browser, but not the file. Yeah, you can click that and then open it.
Can you see it now?
No, it's just on the right. It's just by the side. So what you want to do?
Okay, I need to drag it, right?
Yeah, drag it. You can drag it to the left or something because it's just on the side, on the right, and very small, and it looks like your cursor is cycling. Maybe what you want to do is to download that file. It's on OneDrive, so maybe you want to put it on your desktop.
Okay.
So why don't you copy it, put it on your desktop, and then
Okay,
and then open it from your desktop.
Let me save it on the desktop. Sorry. Oh. Let me put it on the screen. Can you see the screen now?
Yes, we can see. Okay, that's good. So now you can go to slideshow. Just go to slideshow at the top. It's close to record animations.
So can you see it now?
We can't see it. Yeah, it's up now. All right. Carry on, please.
Yeah. So can you see it now?
Yeah, we can see it. Please go ahead.
Yeah. So, like I said before, it's an opportunity to. I'm grateful for the opportunity to speak at this great opportunity gathering. A lot of exciting presentation and a lot of excitement. A lot of people from Africa is excited about what is going on. So I am going to be talking about building the ecosystem for the Nigerian Genome Project and biodiversity. So this is my outline. We'll be looking at what it takes, how important is genomics and scaling up genomics in Nigeria. We'll also be looking at the milestones, some things, pillars we find in genomic consortium, and then overview of the genome project and genomics and bioinformatics core facility. So the genomics, we cannot underestimate the importance of genomics in recent times. Recently, we know what it was during the pandemic. We saw that the importance of genomics came to bear during the 2019 coronavirus, the COVID. If you look at the paper behind there, the Beijing Genome Institute, how it was from standing start to becoming a sequencing superpowerhouse. So superpower, because of the power, when they notice the kind of a new order of infection, respiratory disorder, they quickly went to their investment they've made, the Beijing Genome Institute, where sequences were made and they found out that this is different from what was in existence. And that was very helpful in developing early primers targeting SARS-CoV-2, because of those sequences that came. And that was really how people were able to detect. It's really led to monitoring of variants and doing quite a lot of things, So, but when you look at the picture behind on the side, you will see the level of investment, So it requires high capital outlay, high infrastructure outlay, to be able to build that kind of superpower. So this is really our vision in Nigeria. Knowing what happened during COVID, one of the key lessons being myself, I was actually leading the genomics effort, particularly detection of COVID and all those type of things, doing those type of monitoring variants and all those, coordinating those genomic activities from all the powerful sequencing centers we had in Nigeria to be able to provide actionable data to the government for response. So we've noticed that we have to be prepared. If you don't get prepared, anything can come, pandemic can come anytime and then can pose a problem. But when you are ready, the investment you made can be used to leverage and then provide support, and that can help you defeat anything that comes from any day. So this is what we learn. So what do we do to scale up the genomics in Nigeria? So we must follow what other people have done. People have made a massive investment. We will have to make it. So recently, also Nigerians, one of the important things we saw during that COVID was there was no genomic consortium, there was no genomic strategy. So this was really what we felt was very necessary, that we were able to have a meeting, set up the genomic consortium to really sit down and profile the direction for Nigeria in terms of genomics and the other omic sciences, how we are going to work with it, how Nigeria can develop it. And the formation with leadership, visionary leader, very proactive leadership of the NCDC Director General, he came in, Dr. Jide, he came in and then quickly fast-tracked this activity and brought genomic consortium in place, and then we launched the genomic strategy, which has now laid the foundation to some of the critical things that will happen. So one of the two important milestones we have seen in recent days were the setting up the genomic consortium and then the genomic sequencing strategy that was launched in October by the Minister, Honorable Coordinating Minister of Health in Nigeria. So, and the dream is to make sure that we try to capture genetic blueprint of all Nigeria, do the genetic blueprint of all Nigeria to bring about change the way the healthcare is done in Nigeria, to also enable precision, personalized and predictive medicine, thereby reducing medical tourism. You know, every little thing Nigerians will have to run us outside to do basic diagnostics or some things, some advanced ones. You know, even care of cancer and other diagnoses, like the doctor that just spoke, Ubong, was an amazing, exciting things that which we wish had to be done in Nigeria. So with this, Nigeria is set to begin to embrace this type of thing. We are setting up this project that will use state-of-the-art genomic technology and other omic technology to understand genetic disorder and bring effectively reduce the occurrence of genetic disorder. And we also aim to drive advancement in healthcare by enhancing diagnosis, therapy, and prevention of diseases. So you may not see this very clearly, but these are some of the things we've got from the Nigerian genomic strategies. These are like a dashboard having precision solution, development pipelines, multi-omics, genotyping, sequencing, whole genome sequencing, long read, and a lot of things we plan to do in a short while. So one of the critical things, one of the key pillars of the Nigerian Genome Project, the key pillars of the genomic strategy is establishment of a national multi-omics biobank and genome project. So we want to do a very ambitious project that will be implementing Nigerian Genome Project, One Health approach, and then setting up a Nigerian genome, a Nigerian biobank that will be involved with longitudinal population cohort studies that can monitor just like what is obtainable in other countries, like all of US, all of UK Biobank, Qatar Biobank, FinBank, and many other countries that where we have seen this thing. This is a very tall order. So how do we prepare? How do we build those type of infrastructure? Sometimes we make this type of statement, we have this kind of policy, we have this type of things, but they are just white elephant project, the white highfalutin, without substantial preparation to back it up. So today, I want to really let us know what is going on the ground, how we plan to bring about this particular project. Well, before that, let's look at what other people have been doing. Around the world, the Global Genome Project, many countries have been involved in this genome project. And if you look at the map on the left, you will see active national genomic projects green. And if you look at Africa, you will see that how less green we are. Other parts of the world are green, and we are just still inactive in limited scope. And thanks for H3 Africa. At least H3 Africa is putting Nigeria, the whole Africa in the global map. But our desire is to really turn Africa green in this type of genome project, understanding our society. Nigeria, as a country, has the largest Black race, one of the largest diversity, over 250 different tribes and different, a massive diversity that will be of interest for the world to learn and also to understand many diseases. So that's why it's very, very important for us to really have us in the map of the world. And that's really what we are set to do. And when you look on the right, you will see numbers, it's not very clear, the number of whole exome per countries who are doing this type of things. If you look at in the China, over 100 million, USA, you have over 1 million, and many, Estonia, Finland, and many other countries that are developing their own genome. And if you look up in Africa, you will see Egypt. You know, Egypt is doing well. South Africa and many other countries have been able to, build this type of, start these things like Morocco and other parts of Africa, Algeria. They are all begin to do their own genome project. Some of them are also linking them to their biobank, as we can see on this other slide. Sorry. So in the next slide, you see what people are targeting, what they want to achieve, by their genome projects. Some are going to look at pathological genomic variation. Some look at normal genomic variation. Some infrastructure, they have their different plans. And when you look at it, you will see where Africa stands, different from other parts of the world. You can see personalized and precision medicine. Other countries are driving into that kind of predictive precision medicine. Somebody was asking question, can this be possible? Why not? Why can't it be? You have to make the infrastructural investment. You can see how other countries are blue. We have to make these countries, our continent and Africa, blue with the right infrastructure so that we can also achieve the green, which is the personalized and precision medicine aspect. And if you look on the left side, you see the list of biobanks associated with national genomic projects. Countries they have their biobanks with full genomic data, having information, controlling. In some countries like Saudi Arabia right now, it's become important that every marriage has to go through genetic screening, and then people have a good understanding of what is happening, improving their health. Places like Qatar, places like Estonia, they have been developing this biobank. And that's why we want to use the instrumentality of the Genome Project, the Nigerian Genomic Consortium, as well as the genomic strategy to launch this Genome Project. And on which background are we going to do that? We are going to be running on a background of a new project that is being funded by the Global Fund to support Nigeria to build the genomic core facility. And our aim is to, under that, when we set up those infrastructure, which I'll be showing you shortly, we'll be looking at the Nigerian own genome project. And that project will be, first of all, targeting 10,000 genome. There'll be a 10,000 genome project, which will involve 10,000 human genome drawn from the 6 geopolitical Nigerian regions. And then with samples from both patient cohorts as well as healthy cohorts, free of any major disease. And then the biodiversity, we are not calling the Nigerian Human Genome Project. We are using one whole health approach. We are also going to be involving the human 10,000 and then other biogenomes, the plant, Nigerian plant materials, plant resources, animal resources, environmental resources. We hope to sequence about 20,000 of these biogenomes. We have to put them looking at some of our special animals like the Sokoto Gudali, the red goat, all those type of things, our plants, our maize, various biodiversity, like even the ones we are even hearing today. working with the African BioGenome Group, will be able to make these things a reality. So when you talk about knowing that doing this type of thing is very expensive, it requires a lot of infrastructural outlay. So if you look at how we start in Nigeria, we already have some investments around genomics preparation, because this thing cannot be done in isolation. We have to work as a partner through the Genomic Consortium. We are blessed to have centers like the Redeemers University, SGIT, which has all the platforms you can think about. The PacBio is already in place. They have the NovaSeq XP, the NovaSeq 6000, all of them, and all the high throughput instruments are there. And then the Nigerian Center for Disease Control, NRL, also has a lot of all this instrumentation, also Nanopore, the MGI-Tech, and even NESTIC is already been stored in that place now. And then the Bado, Nigerian Institute of Medical Research, NIMA, and a lot of other new centers that are coming up right now. So this is what we have at the moment. But the existing infrastructure, you can see from behind, this is how the center is, what's available at NRL. We also have an Illumina MySec there. We also have an iScan, which to do. How does it look in as huge budgetary outlay? On the left side, you will be looking at the Welcome Genome Campus, the Sanga Center, with the powerhouse for sequencing, with all kinds of high throughput instruments. And you look at the right side, you will see the Chinese Beijing Genome Institute I mentioned earlier. You can see the farm of instruments they have there. And you look at the US Broad Institute. These are powerhouse for genomics, and then the Singapore Genome Institute. So if we desire these things, we will have to, I say, we want it enough, then we have to make investment in sequencing infrastructure and capacity building, strategic planning, coordination and leadership, developing standard and policy for data sharing, building strong, well-structured laboratory network and quality assurance systems, creating systems for timely reporting of genomic data and outbreak of surveillance, monitoring and evaluation. These are things that have to be in place to really, I am trying to let us know that this project is set to commence, and it's going to be shouldered by the NCDC Genomics, Nigerian Genomics and Bioinformatics Core Facility, which is a multi-omics center that is now, you can see how it's looking. It is set to commence. Some of these instruments we are talking about today, and I can see all the talk. Everybody will say infrastructure. We have to sequence outside Africa. We want to sequence, we don't have capacity to sequence much in Africa. But we intend to change that narrative by this project we want to do. This center is a multi-omics center that will have the best of its kind. All the instruments we are talking about here is already acquired, and by next month, it will commence installation. This is the main genomics center, genomic room, where we'll be having quite a lot of instrumentation, which I'll be running down. And one of the things we know on the right side is power. Power has been a problem. People will always comment that power is an issue in Nigeria, is a nemesis. So we have also in that center taken care to take very good care of power support, making sure we have this farm of lithium batteries, inverters, and the UPS system with solar backup that will provide enough power backup to this center that any of those instruments we have there, we were not thinking about having any outage. So let's go down and see some of the things we intend to do. That center is going to be one-stop state-of-the-art research center for high-end genomics, sequencing, stem cell technology, genome engineering, forensics, and other omics sciences will be there. It will support disease surveillance, advanced research, and diagnostics in Nigeria. The center will have the following capabilities: both molecular and genomics diagnostics, proteomics and metabolomics. We have acquired almost every proteomics platforms, high-end instruments that can also help us in that area. So capability to support drug metabolite detection, water and other environmental challenges, vaccines and biologics. We are also not going to continue to be fed. We also have opportunity to study, be able to develop our own things by acquiring things like making our own oligos, using oligosynthesizers, having our own protein purification system, so that we can also be getting involved into recombinant protein for local vaccine development and other biologics. Forensics, we already acquired a MySeq FGS, which has capacity right now to not only acquire, we have installed it at NRL, where we can also do both forensics, genotyping, and human identification, post-implantational diagnostics, non-invasive prenatal testing, stem cell technology, regenerative biology, biomanufacturing, bioinformatics, predictive and precision medicine. That is really where we are going. And these are the list of the instruments. They are not very, very clear, but a whole lot of instruments have been acquired, and I'll be going to highlight each of them one by one. This one, in terms of we know that for us to achieve what we want to achieve, automation is key. And we have also invested in those automated solutions. We already acquired very soon. By next month, all of these instruments will be installed in this place. The AP Motion 5075, as well as the Agilent Bravo Option A, which are also liquid handling stations. No, very little human handling in that lab. So, and in terms of also single cell sequencing, single cell genomics, we also have 10x Chromium Connect, which is a library preparation solution for the 10x system. So these are already there. And then in terms of genomics and transcriptomics, because I told you it's a multi-omics center, we have the genomics, we have the transcriptomics side, and we have this 10x single cell spatial transcriptomics, and all that will be done with this. And today we are privileged to be talking about the PacBio Sequel 2E. The review has come, but before review came, we already ordered this one, and we also have on our view to also acquire the review. But with what we have this instrument from next month, 16th of June, we hope to install this PacBio Sequel 2E, which will unlock long-read sequencing in Nigeria locally for us. So this will help us do a lot of these biodiversities, HIV envelope sequencing. A lot of things will be done. Our long-read whole genome. When we are talking about our Human Genome Project, we intend to do about 10% of that using the long read because of the completion, because of the repetitive regions that are not very easily sequenced with the short read side. So the PacBio will help us do that. And not only that, we also acquired a NovaSeq 6000, which we have it before the NovaSeq XP came in. We also have all of them in our radar. We also have them. All of them will be installed next month. That will begin to unravel help us in the 10,000 human genome sequence and other biodiversity. So the center is such that every sequencing platform, the best in class, have all been ordered in that place. We also have the Ion Gene Studio X5 Prime is also ordered. This can change in terms of oncology, prenatal diagnostics, and all of those things are going to be like what our brother was just sharing with us already. We'll be able to help our hospital, work closely with our hospital, and early diagnostics, understanding various biomarkers that can help in curing, helping to reduce the incidence of cancer and all those type of things, be able to help manage in management decisions. We also have the Ion Torrent GeneXus, which is one of the instruments that is being used in these areas of oncology using their optimized systems. We can detect multi-panel, not single panel. You can use multiple panels to look at various markers that can help in management of diseases. So we also have the NESIC. We have this both single cell and normal sequencing things. We already acquired them. So these are some of them. So this is the PacBio. We have been extensively been told about what this PacBio can do. Is the powerhouse of the long read sequencing. And before the review came, this was there. We also have the review in our view. And it gives us Hi-Fi reads at 99.9% accuracy. And they're ideal for de novo genome assembly, transcriptome investigation, and detection of variants from single nucleotide variation to structural variants. So we are in. So Nigeria is set. So we are calling all of us to know that there is something like this coming, and we are going to unleash science in Africa. It's good to bring technology where the problems are. Nigeria, like Africa, has one of the highest burdens of diseases and all these challenges. and people benefit from our sharing our data, using our data. Right now, we want to bring these technologies to where these problems are, that if you want to do those things, you can come down and do the science with us. So you can see this Ion Chef, the Ion G Studio. All of these ones are not that we are going to buy. We have already acquired them. We are just waiting to install them from next month. We also talked about pharmacogenomics and the pharmacogenetics using the Agena mass array. We have 2 units of Agena mass array acquired. This will help a lot in the pharmacogenetic side, mutation profiling, sample integrity testing, like helping manage samples in the biorepository, hereditary genetics, specimen validity, liquid biopsy, and a lot of things will be done with Agena mass array. We have the 96 module. We also have the 384-way module, all acquired that can change the way we understand these things. So these are examples of the mass array we acquire for the pharmacogenetics and the oncology. So here is another important side quickly, the sequencers and the microarray scanner. This is another interesting thing, the Gene Titan. We have also acquired the Gene Titan, and it's going to be being installed very soon. This will help us so much in the genome project and our diversity, understanding our diversity. We have already acquired some precision medicine diversity arrays, which we tend to screen our population, look at our various SNPs we can use to capture during our sequencing. So we have this for a lot of other things for our microbiome. We also want to interrogate. We have not really done so much on the COVID that we have a lot of store in our biorepository. We intend to use this system to really interrogate and look at host pathogens response and what's really made us not to be affected by so much of the COVID-19. We will have to understand them using some of these instrumentation for SNP genotyping, GWAS, and so many other things. So it's going to be a great time for quite a lot of us. So these are what we have available, both reproductive health, oncology, pharmacogenomics, biobank, and everything, even in improving of our agric, using sometimes genotyping by sequencing. Sometimes people only talk about GMO, but with this type of thing, you can use marker-assisted plant selection, plant breeding, animal breeding, using this type of system to screen. So you can do improvement, you can do quite a lot of things using this thing. So these are, in terms of the proteomics, these are the platforms we have, the Shimazu LCMS triple quadrupole, LCMS system with universal HPL system, GCMS system with AOC 30i autosamplers, Shimazu GCMS triple quadrupole, and then the ID Plus performance MADI-TOF. So this is going to be, this is already available. All of them are already in country. We will start by next month to start installing them to begin to take care of proteomics and the metabolomics side of things. So we also have a protein purification system, ActaPure, which has also been acquired that will help us in the area of protein purification and on the protein engineering and things like the recombinant protein. And in areas, if you're interested in local vaccine production, you really need to have a way of purifying your protein and understanding them. So that is also available. And here, where we are calling the vaccine and biologics, we also have Cytek Aurora, a very powerful laser cytometer, flow cytometer that will also aid in our cell imaging. There are so many other things, the ACTA oligosynthesizers, our so many other instruments have been ordered, both for single cell proteomics. We also have mission biotapestry, some things that are not available in some other countries. These are for the first time we are seeing some of them in this part of the world, which is helping understanding oncology like never before, understanding the microenvironment of cancer like never before, interrogating, doing spatial transcriptomics, all available right now to us. So we have made investments in this ecosystem that will support our genome project as well as our biodiversity. This center will work closely with the SGID, the very powerful, the powerhouse in this part of the world, in doing all this our sequencing work. Thank you for listening.
Yeah, thank you. Thank you, Dr. Ndodo. So I'm going to Yeah, quite a lot of things to unpack there, right? So that's a very wonderful presentation. So I'm just trying to find the on-site participants. So I'm gonna make them a co-host. Yeah. So I'm gonna ask the on-site participants and virtual participants to kind of indicate they have questions, but I do have some questions that I would like to ask before I forget, because I forget when I start asking others. So I mean, it's interesting to see all of this work, you know, to also see, you know, just as you rightly pointed out, that these things are there, right? It looks like they're also evolving. So how can the Africa BioGenome Project better work with you guys through the regional node, and also we're hoping that the national node will also be something that will be in motion soon, because each country, according to our governance, each country should have their own or would have their own national node, and then within the national node there will be institutions working. So how can we better work with you guys? And because this would be, as you mentioned, a national project. So how could this work to be able to bring in perspective from the biodiversity space, particularly, and given that you guys also will be looking into around 20,000 biodiversity genomes. So it'd be nice to also understand how that could the partnership.
Thank you so much, Dr. Tangod. So you are an inspiration, and the activity, what you are doing in Africa is so commendable. And we don't want to continue to sit down and watch, you know, and we want to have that opportunity to have a place where these things can be done. We are going to work closely with you, the African BioGenome Project, to really do some of the things we need to do. I think I've had a kind of informal discussion with you a little bit how we need to, even if it means we need to sign a formal MOU. We'll sit down and look at various plants and animals that are of interest. We can work closely together with the Biotech, which are the ones supporting this. We acquired it from them. So we are all going to work together on this area to make sure we will just work out, do a formal way, sit down together, because we plan that immediately after installation of this facility, hopefully by September, everything will be fully installed. We need to have what I call a scoping meeting, where we bring Nigerian, both international and Nigerian scientists to sit together and brainstorm the way forward. How do we achieve this? Already we are having meetings through the Genomic Consortium, how we are fleshing out these activities, what we want to do, because we have done the strategy, but if we don't have something like this, we know we are talking, we wishful thinking, but we have something practical. And most times the reagents we are talking about, we are making sure that we have all the available, what we need to do, what we say we want to do. So that's the difference between this. So we can easily work together. We'll sit down and work out how, because we're not going to do it alone. We'll work closely with you guys already in the space of the biogenome. We'll see how we're going to work to make sure that all the various biodiversities of interest within our region is taken care of. And this is not only going to be only for Nigeria. It will also be a hub for other African countries to leverage. Thank you.
Thank you so much, Dr. Ndodo. Myself and the leadership of the Africa BioGenome Project and the community will be looking forward to, you know, this sort of collaboration or partnership. And yeah, we'll be on standby whenever you call us. Then we'll be able to, be involved. Okay.
Absolutely, we're happy. We're happy to collaborate.
Yeah, perfect. So we have some questions coming through. I have Hewan. Hewan, do you want to unmute and ask your question, please, and also put on your video?
Okay, sorry, like I'm here in the laboratory, in our bioinformatics laboratory. It's really inspiring. Thank you very much for the BioGenome project for bringing this, the East and the South and the North to come together and learn. It's really a lot of lessons that we are really getting. And I'm really excited because what I have seen in the Western world, it is already here in Africa. and the platforms that you allow, saying that we are going to collaborate. And I think that is really interesting because myself, I am in the plant genome part. So I wanted to ask you for that, and because this is a huge investment. And I would like to inquire about, like, how do you get it? It's really amazing. How do you really, like, what is the source of the funding? Is it like, the oil from Nigeria, or what did you do? That's because it's really amazing. Yeah. And then my other question is, like, since you have really pioneered in this aspect, like, would you give us, like, some kind of training or brainstorm, like, for us who are living in the Eastern Africa specifically? As you know, we are in Ethiopia, where the genome project is a little bit small. So I will really love to know, it's like, how much you are open for collaboration and bringing us up. Thank you.
Yeah.
Dr. Ndodo, over to you.
Yeah, thank you so much. It's so heartwarming to hear. So this is the essence of this kind of meeting. So it's a lesson learning, experience sharing, and it's just to also wake every one of us up. We cannot continue to be recipients. During the COVID, we made up our mind that we're not going to be on the area of download. We are going to be part of upload. It's a decision, a voluntary decision we made. We're not going to be on the download side. We're going to be on the upload side. And we tried on our own best to be able to put some sequences and then provide not only for COVID, monkeypox, cholera. A lot of genomes are coming out from what we are doing right now, because we have made up our mind we're not going to keep sitting down. Now we are getting into another level that nobody has ever seen in our mind. We have been getting money, getting funds. Funds are not the problem. It's just the political will, the strength, the willingness to put the fund where it's the best way to use the fund. We have a lot of funds in Africa, but sometimes we misuse them. This one was, if I tell you the volume of the fund involved, this was a subset of what is involved, that you can see what is going on because of the goodwill of the Global Fund, which they give to many countries. So they were able to give this genomic support to help scale up sequencing in Africa. This was post-COVID investment, but it dragged up until now. But now we are putting it to greater use to drive ultimately precision health in Nigeria. So it's not going to be only. In fact, we plan to actually, during the launch of this project, that we working with some team from ONT, we intend to host sub-regional, some African region in training on using the ONT technology for detection of TB, drug resistance. So that's the way we want to bring people. It will be a time of training, not for Nigeria, but for other regions. Thank you.
Thank you so much, Dr. Ndodo. Looks like you have lots of questions with Julian Osuji. Do you want to unmute?
Yeah, I wanted to say something. Thank you, Dr. Ndodo, for your presentation. That was really nice. And I remember that during the COVID, the NCDC was really active in coordinating the different labs to make sure that the testing and diagnosis were done within the internationally accepted standards. And that was really excellent. But what I want to ask is the efforts that NCDC is also making in sustaining that network of laboratories of research. Because, for example, Regional Center for Biotechnology and Bioresearch was part of the NCDC network of laboratories, but it's like after COVID, some of those relationships were, cut off. So I feel that there will be need, and I want to know if there's anything that is being done regarding that. That's one. Then the next thing I want to ask also, which I think will interest most career researchers and graduate students that may be carrying out research, is if there is a way NCDC is kind of funding research in areas in medical health and genomics that people can, how they can assess these opportunities.
Okay, thank you so much. Yeah, it's a very good question. So what I told you during COVID, we have to prepare. There's one lesson we call it lesson learned. I shared that kind of presentation at Johns Hopkins University's students. They invited me to give a talk on that. Lessons learned. The lesson is that you get prepared, be prepared always, build local capacity. So, and it was a little capacity we built that we're able to make that response we saw during COVID. But right now we are moving into another gear. And that gear is to drive Nigeria into precision, predictive, and personalized medicine using what we have here. So it's not an easy thing, but we want to bring everybody on board. Now, I want to inform you, I started talking about the Genome Consortium. It was one of the greatest things that happened to us when the Minister of Health in October launched the Nigerian Genome Consortium, Genomic Consortium. So if you can reach out, we'll be able to put you, we have already formed it, we're already meeting quarterly, where we are discussing. Some of these things I'm talking is not isolated. These are the vision from the Genomic Consortium, all Nigerian scientists, every institution where you have capacity to do genomics and we are mentoring to raise them. So we are all working together, forming different nodes, we have the infrastructure, we have the research, we have everything within the genomic value chain is all there. So people are invited to join this group. If you're interested, if your institute is not there, you can reach out to us so that we can just add it to the Genomic Consortium so that you will be carried along with what we are doing. So it's not one person, one agency thing. It's all Nigerian initiative right now, bringing all Nigerian institutions to do this wonderful thing. Thank you.
That would be great. Then the second one I asked about the early career researchers, if there are opportunities for them to get funding, to get collaborations and all that.
Now, the funding is an issue. Direct funding is an issue. It's something we are also trying to work, maybe through the Genomic Consortium, that will be addressed one day, right? But in terms of training, this facility is going to be a foremost training center. We're even thinking that at some point, all the life science graduates who are doing master's PhD should have some time to spend in this center, to learn all these techniques. This is really what we are thinking that will happen, so it will also be an opportunity for people to train. And that these facilities don't use itself. It requires a lot of training, capacity building. A lot of people will be trained within right now. We're identifying skill set. If you have expertise in bioinformatics, I put my email there. You can reach out to me, right? So we are looking for quality people that can work, people with good CV who are trained in these genomics and all these spaces. You can just reach out to us so that we can opportunity to train. We'll also invite people, but through the center will be a training center too for people to learn new techniques. Thank you.
That would be great. We have one more question. Can we just go ahead and ask?
Yes, please. Yes, please.
So go ahead.
Okay. I know that most of this research can you hear me?
We can't hear you. Speak up, please.
Okay, well done.
Can you hear?
Yeah, speak up, please. We can't hear you.
Are you hearing me?
Yes.
Okay. I'm Dr. Emmanuel.
Okay.
I'm Dr. Emmanuel from Federal University of Turkey, Bayelsa State.
Mm-hmm.
You know that most of those research, most of them are carried out in high institutions. I want to ask, one, is there any way NCDC, is there any opportunity of collaborating with the higher institutions with this new center that's about to come? If there is such kind of collaboration, how can somebody go about it if they want to collaborate, at least for us to benefit from the new system that is coming up? Thank you, sir.
Okay, thank you so much. So it's the opportunity, the center is a national core facility. A core facility is a place that have instruments, equipment that you don't have in other places, right? we don't have, these are very, very expensive, have any need to use this facility. It's a national core facility. You can reach out formally to the leadership, maybe through the director of NCDC for now, or the head of the center leadership, right? Or through the Genomic Consortium. This will also be accessible to you. It will be freely available to every Nigerian institute to collaborate. Thank you.
Thanks so much, Dr. Ndodo. So I think this would aim to address a lot of, oh, we don't have this machine, oh, we don't have this, oh, we don't have that, right?
And this is just phase one. We are looking at this.
So we hope that it's gonna. So I think Professor Julian and others on the call, then I can see people are asking for your email address. So please feel free.
Yes, I'll put my email address there, right?
Yeah, and please do share your slide with me, and then let me know if you wish for me to share it with others, or otherwise just for the AfricaBP record.
Yet. I will talk to you later.
Right, all right. Okay, that's fine.
Yeah.
Okay, I understand. So we have one participant who wants to ask question. Tobias Innocent is a GO4. Could you please ask your question?
Hello, can you hear me?
Tobias,
sorry?
Could you please ask your question?
Yes, I raised hands, and a short while after raising hands, I realized that some of the issues that
can you hear me, sorry?
Are you hearing me?
Yeah, we can hear you. Go ahead, please.
Yes,
Tobias.
I'm saying that I'm Professor Tobias.
Hello?
For Federal University of Technology.
Okay, go ahead.
Yes, some of the issues that entered my mind when I raised hands, I think you've addressed them, because I had you answer Dr. Victor that this is going to be a neo-Nigeria, all-Nigerian participatory affair, which is where my concern was coming from. Notwithstanding, you said you're going to have some program of where new scientists or people in master's PhDs may have opportunities of an internship in the system. Yes. Remember that the core academics who are the trainers themselves, some of them are analog, in quote, so to speak. And one would have expected a situation where there is also opportunities of training. Some of us are the old brigades that are now trying to make inroads in the new era so that everybody will be on the same page. If the master has nothing to offer, his servants or his followers may be bereaved, maybe shortchanged, or not given enough. So I have made efforts several, even including to the Abuja Center of NCDC, to have some, what I might call even opportunity of a sabbatical, because I'm interested to learn some of those things. It was blocked, and I didn't know why. Every effort to reach that organization failed, including even to send and to make see the director. It wasn't possible. Why is it on the air? We talk robust and beautiful things, but in practice, it's difficult to get through. I will want this matter be addressed so that some of us who are trying to write from the old to the new era to become genomic compliant have access to facilities like this too, and be able to acquire one and then give birth to our students. I think this is my concern. Thank you, sir.
Yeah, can you hear me?
Yeah, over to you,
yes,
Dr.
I'm hearing you loud and clear.
Yeah, thank you so much. I'm also not holding brief for the NCDC management, but I am just telling you that I actually was the lead at the genomics lab at NRL. So, and we know that we host some students, even researchers, and we are hosting some university professors come to spend some time in our lab. Students come and spend some time in our lab. I know I supervise about 4 or 5 PhD students in that place to do their PhD. We have been doing those type of things, but sometimes the space is limited and you will not able to host everybody that applied. So that's why we are looking for, even with what we are doing, it's still very small. We have a very big vision to really have a very big place. Like I've told you, our intention is that every life science student doing MSc PhD should spend at least 1 month in that center, so that you won't be given excuses, I don't know this, I don't know that. So that even you, if you are a professor, a faculty, you want to have a refresher. This is a new move that is taking place, right? And this is even way beyond NCDC. It's a national project that is coming. So we're praying for it to succeed, right? If it succeeds, it will address some of these challenges you have. Thank you.
Thank you so much, Dr. Reshare the email address or your contacts, so I will be able to reach you. I appreciate your efforts. Thank you so very much.
All right, thank you, Dr. Ndodo and Tobias. We have one final question from Juventine Boaz. Juventine, do you want to unmute?
Yeah, thank you very much. Dr. Juventine Boaz Odoi from Uganda. And I would like to appreciate so much Dr. Dodo for this nice presentation. I loved so much the equipment, the new technologies, and the enthusiasm. You indicated that you were inviting any institutions or individuals who are doing genomics from Nigeria. Specifically, you mentioned Nigeria. I would like to know whether specifically the US facility is only for Nigerians or institutions of genomics who are doing this from Nigeria only, or like even us who are outside Nigeria, and we have really been impressed by your presentation. Oh, we can benefit from this. Thank you very much. I think most of my other concerns have been mentioned by others, but specifically that one, I see my colleagues from Ethiopia, my colleagues from Kenya, my colleagues from other African countries. So your presentation was very specific for Nigerians. What about us from other parts of the country, continent? Thank you.
Thank you so much. That's a very good question. And he's not invited, you understand? So that's why we have a very tall vision. We have a very tall vision. What we are building, we are not only building it as just a local Nigerian center. It's going to be an international, something that will service the West African sub-region. It's a national something that will not even only West Africa. Africa is not going to be limited, to where we can. But right now, because of the space availability right now, even what we have now is still a makeshift. It's not really fully what we are looking for. We are looking for a bigger facility to house the kind of thing we are talking about. But right now, within the constraint of space, I think we will look at it by case merit, right? It's not only to Nigerians, it's open to researchers around Africa, right? Who can use this, but beginning from Nigeria at the moment because of space, but it's not that it's only open to Nigerians. Okay, thank you.
Thank you, Dr. Ndodo. So I think we need to move to the next presenter, and we would like to thank Dr. Ndodo for his wonderful presentation. I guess all of this now makes it clear that there are things that we can do, and hopefully all of this can be right up. We would like to thank you, Dr. Ndodo.
Hello, can you hear me, Doctor?
Could you please give him...
Dr. Tango?
Yes, we can hear you. Can you hear me? Okay, I think we lost Dr. Ndodo there. So could you please give a round of applause to Dr. Ndodo, those on site and also those on Zoom. Please use the chat box to do that. Appreciate him for his presentation. We're going to move to the next presenter, and this would be Dr. Justin Idiozo.
Yeah, thanks.
Justin, please?
Yeah, thank you. Can you hear me?
Dr. Justin is the... Yeah, I can hear you. Dr. Justin is the... I'm just trying to find the... just one moment. So Justin is with My Afro DNA Nigeria. He's the CEO. And then he's going to talk about an overview of My Afro DNA perspective and supporting the African BioGenome Project. Over to you, Justin.
Yeah. Thanks, Tango. Let me make sure, first of all, that you can all see my screen, and then I'm going to shoot from there. Can you see my screen?
Yes, please go ahead.
Okay, cool. Greetings all, and AfricaBP community. Thanks for inviting me to give a presentation about MyAfroDNA. My name is Justin Eze Idiozu, and I'm the founder and principal investigator of MyAfroDNA. Really not the CEO, because we're not structured in that format. I'm actually the principal investigator and founder. Today, the title of my talk is an overview of MyAfroDNA and its pivotal role in supporting the objectives of the African BioGenome Project. But before I talk too much about MyAfroDNA, I did like to kind of like recap or echo some of Africa's challenges and what MyAfroDNA is trying to address. So as we all know, Africa really is rich in biodiversity, cultural heritage, and of course we have diverse human genomes. But yet the issue is that this richness remains underrepresented in the most and several scientific discoveries. Now I'm just going to be a little bit biased and then move towards human aspect instead of biodiversity. African genomes, human genomes really are more diverse than those of other ethnicities, but yet they are underrepresented in genomics research. Basically, this gap hampers efforts to identify novel targets for drug development that could lead to improved health outcomes for people, both at individual and at population level. When we are talking about underrepresentation, and then we're talking about how our genomes are diverse, what we are referring to here is that about 80,000 years ago, right, Africans are basically the earliest humans. About 80,000 years ago, some Africans migrated and populated the rest of the world. So what that means is that when you tap into African genomes, right, you're going to see that, you know, almost everything that you can find in people of other ancestries, you can find in people from African descent. And that would mean that if you're basically looking for a target to, or like a genetic modifier or marker for disease, basically, if you research African populations, you're going to get to that particular target faster. As you can see on the right, what you're seeing there is a pie chart. At the time when I pulled up this pie chart, you could see that only 2% of African genomes are represented in global human genomic research. I don't know if this is even decreased now. I don't think it's actually improving, or even if it has improved, it hasn't really improved that much. And what that means again, basically, is that this would mean that there are we are basically limited to identifying novel therapies that could eventually help Africans, and then of course impact as well people from other ancestries. So that is actually a major problem. And MyAfroDNA really was established in 2020, registered in the USA, and then as well as in Nigeria to enable equity in clinical genomics and translational research. So basically, we were born to kind of be part of the solution to the problem. Now, as I mentioned earlier, MyAfroDNA is actually a vision driven company. So it has a vision to ensure that people of African ancestry benefit from advances in both clinical genomics and translational research. So we are really an indigenous company. And actually, we're trying to address this problem or reach our mission by providing 3 core services. One of our core services is research support and contract organization services. With that, we support researchers interested in integrating cutting-edge genomic workflows or approaches to pursue their research. So basically, we partner with health institutions like hospitals, clinics, physicians, and researchers to bring the benefits of genetics and personalized medicines to Africans. So we provide also professional training and consultation services. Right now, we partnered with over 300 hospitals. And since we've been building our infrastructure for over 5 years, we are basically starting to see some results as well. So what I wanted to show here is one of the issues, like I mentioned earlier, one of the things people have been asking is, so why are Africans not really participating in genomics research? So you can see here, this is a publication where basically I was a member of the American Society of Human Genetics Population and PPSI, where basically we tapped into or reviewed the problem, and then we gave a recommendation to address the lack of African representation in genomics research. And we basically encouraged a strategy which we called community engagement as a strategy to address the or increase participation in genomics research. And what that entails basically in a nutshell is that the encouragement there, or the advice really is that before, during, and after research that you want to really engage Africans. So that means like, even if when you're going to approach Africans for research, most times it's also good that, you know, people also going to approach Africans are people that are also familiar with, you know, the African community. And then, of course, during all arms of the research, before, during, and after, you know, the community is being engaged. And of course, there should be some form of returns or some sort of benefit that goes back to participants as well as to the communities. So my AfroDNA really is modeled to benefit everybody, right? So we are modeled to benefit the patients, modeled to benefit the providers, researchers, health authorities, and African communities. So basically, our idea wasn't born out of anything. This was born out of the critical need for Africans really to start leveraging the impact of genomics. And that is one of the reasons why my AfroDNA was formed. So basically what we do is that we engage patients, sometimes, or participants, we collect samples, we have providers that help us sometimes to sequence the samples. We generate this data, we provide this data. This data is usually free for Africans. It's free for the patients, it's free for the participants. And then of course, our nonprofits are also able to tap from these data sets to maybe, for example, use it to design public health intervention programs. And for the patients, of course, the benefits to this, them having access back to their genetic data is actually numerous. Basically, it can help to inform their genetic risk for different kind of disease, help to inform personalized medicines. For providers, you know, the benefits are also very several, because it could also help to kind of like streamline diagnosis, you know, as well as they also get things like scholarly recognition from whatever publications that come out of our lab. And my AfroDNA really, we provide kind of like an end-to-end solution for genomic researchers. Basically, and this is because we have over 15 years of experience, both at the bench and then at the desktop. So we support researchers in terms of like helping them to design different genomic studies, both from patient or participant recruitment up onto biospecimen storage and downstream analysis, execution of project, and then dissemination of results. So basically, we've got you covered, project design to dissemination of results. And our workflows are standardized. And of course, we also have quality control standards to ensure that whatever we're generating from our lab really is of global standard. And one other thing, again, I just wanted to mention is that we also are kind of like disease agnostic. And that is because we know that Africans across all therapeutic areas suffer from different kind of diseases. So we have collaborators from different therapeutic areas and supporting different indications. And currently there are different areas where we are already collaborating and pursuing different research, including cardiology and respiratory diseases, neuroscience, ophthalmology, as well as genetic disorders as well. And one of the core services that we also offer is molecular and blood testing services. And again, with this service, we support researchers and clinicians interested in still leveraging genomics to pursue different kind of like research or clinical endeavors. So here we partner with hospitals, institutions, academic institutions, like for example, we're in partnership with the University of Port Harcourt and the Regional Bioresource Center under Professor Julian Osuji. And then we also partner with initiatives, including initiatives like the Africa BioGenome Project, where there are other partnership with like Professor Julian Osuji. Sometimes we collaborate to barcode plants and then prepare them for sequencing using high range or long range sequencer or next generation sequences. So one of the services that we provide gene expression service here. Basically, people come to us and then they ask us things about, you know, we are interested in finding out if a particular gene is differentially expressed between one condition versus the other. So we want to find out, we help them from the design to all the way to primer design, all the way to executing, and then of course dissemination of results. People also come to us and ask us for things like genotyping. We also provide genotyping services where basically someone is interested in finding out if a genetic marker, is present in a particular sample or not. And we can do this both in biodiversity or plants, animals, or humans, depending on whatever sample. We're basically able to genotype anything at all if we know the specific marker that you're interested in. And the kind of questions here that people ask with genotyping really are there any specific genetic markers associated with an increased risk of a disease or increased traits or some traits that we see in our plant species? And we can help you address those kind of questions. And our turnaround time for those are usually around 7 to 14 days. And the other thing that we do as well is we do the DNA sequencing. So basically, we have a sequencer in-house, and we've been offering this service for about 2 years now. And here, if someone is just interested in asking the question of if they're sequencing a genetic region or a gene in any organism or plant, things like that, we can basically sequence any target of their choice, and our turnaround time for that as well is about 7 to 14 days. So we also offer biomarker testing, and like I mentioned before, we are basically approved by the MedLab Council. We got our license. We got license from the NHREC as well. So we are basically an approved diagnostic laboratory as well as a research laboratory. So some of the things that we offer as well are hematology, immunology, blood testing, and chemistry testing services as well. But we are basically not a walk-in center. We kind of offer that to a lot of our collaborators, like the big hospitals and some other institutions or researchers that are interested in doing large volumes. So basically we help with those such kind of huge volume projects. And here we support those people when they are interested in finding out if specific biomarkers, for example, are associated with maybe different phenotypes of a disease, or basically with one disease or the other. And the other thing that we also proudly offer is, this is also one of our core services, paternity and relationship testing. And of course, the title is supposed to be expanded because that also includes forensics as well. So basically, this is when someone is interested in finding out if they are the biological parent of a child, or if an individual is their biological relative. And I can boast that we actually offer one of the fastest turnaround time in the country, which is basically around 2 to 7 days. In cases where it's very urgent, we can basically generate it in under 24 hours. And we are already exploring other partnerships to see if we can also start offering forensic services to critical departments of the Nigerian police force. The other thing that we do as well is that we also do species identification. And species identification, this means that basically if you give us any sample, we can tell you what species that is present in that sample, be it a human sample or a sample from biodiversity. So if you're interested in finding out if, for example, is there bacteria present in my sample or fungi, and what are these? And basically we can tell you whatever species that is present in that sample without prior knowledge of what is present in it. And if you're interested in identifying, or you pick a plant today and you bring it to MyAfroDNA and you ask us the question, what is this plant? We are also able to do the plant barcoding, and obviously we've been able to, with the support of course, Professor Suji and Dr. Victor as well, we've been able to kind of establish very, very efficient workflows for providing, plant barcoding for people, barcoding service for people around the Niger Delta region. And for example, this is one of our projects where basically we kind of isolate DNA, we quantified it, and then we were able to show that yes, without prior knowledge, I was blinded because I actually did this analysis. We were able to confirm that the plant samples that we picked, plucked and isolated, were Ixora and Trema species. For us, this is a legacy project because it's one of our first plant sequencing projects. So I usually like to echo it whenever I'm giving some of these kind of presentations. And again, also one of the things that we do as part of, building capacity, or as part of our commitment to building capacity in life science research in order to increase diversity in genomic workforce, is that we offer two things. One of them is cost-effective molecular biology solutions, and the other is heavily discounted workshops for life sciences, or sometimes they are free. For example, we started in 2020 with a heavily discounted, 2023 with a heavily discounted workshop. 2024, we also partnered with the African BioGenome Project. We provided free workshops to the African BP community and those participants that registered. In 2025, here we are again. We're presenting today. Tomorrow, we are hosting about 50 people, where 25 of them are going to have in-person free on-hands training on basic molecular biology techniques as well as bioinformatics. And we are definitely very, very excited that we're offering these services because it's part of our commitment to building capacity in genomic workforce. And again, there are different avenues for us to support African BioGenome Project initiative. Biobanking, we support with helping to store samples that could eventually or would eventually be sequenced when maybe there is a priority for them. We can collect them now, store them now, and maybe sequence them later in the future when sequencing is cheaper. We also provide things like training and support. For example, when AfricaBP fellows over last year were about to travel to the United States, they needed some sort of like internship, and I think we supported one person with providing them some of that intern that they needed to help them foster to the next phase of the international fellowship. And then we offer several molecular biology solutions as well, like I mentioned earlier. Things like plant barcoding, and this goes all the way from sample collection, nucleic acid isolation, quantification, quality check, downstream processes, analysis, and dissemination of results. And then, of course, we offer a lot of consultation services as well as collaboration services as well with the African BioGenome Project. I know that together I and Professor CG have been brainstorming on different ways for us to attract funding to support a lot of some initiatives that we have been thinking about. But these are like some of the things that we do in terms of like collaborating with the Africa BioGenome Project. And this has been going on for about 4 years now, so we are really not new in the business. So MyAfroDNA is supported by a host of several team members, and some of them I must have missed in case they are here today. I'm really, really sorry. I didn't put up this presentation early enough, but as you can see, we have supported here by some of the executives here, myself, Dr. Dede Siofuri, Dr. Ann, Dr. James Okafo. We have our facility manager, Wisdom Orgono, and a host of other well-licensed and very, very intelligent scientists that are supporting us to realize our vision and goals. So basically, this is our new facility. We kind of like, we commissioned this just recently last month on April 25th. And this is located at number 3 MyAfroDNA Close in GRA, Port Harcourt off Wogomati Street. You can email us if you wanted to, if you have any questions at info@myafrodna.com. And our website, if you wanted to find out more about us, is www.myafrodna.com. And please follow us on LinkedIn. You just need to type in our name. You're going to find us. Or on Facebook, just type in MyAfroDNA, you see us. Or on Instagram, if you like IG, you're going to see us. And if you have any issues, any concerns, any request, project ideas or anything, please reach out to us. And definitely, we are always keen about collaborating. And again, thank you so much, AfricaBP. I know that I have about 2 minutes, but I'm happy to take any questions.
Yeah, thank you, Justin. Please stop sharing. And that's a good presentation. If you do have any question or the participant online and on site, please online just put it in the chat box or raise your hand with the Zoom raise hand icon. Online, we're going to come back to you guys soon after. We have one question for you here, Justin, from Kofi. Kofi, are you here? Kofi, I'm
I can see the question.
All right, so I want him to speak if he can.
Okay.
Kofi Nora. So Kofi, could you please unmute now and ask your question? You can unmute now, Kofi. Kofi know her, so otherwise you can just ask the question from the chat box. Yeah, so he's asking, he said, thanks, do my AfroDNA perform shotgun sequencing for microorganisms gene function analysis?
All right, thanks, Kofi. That's actually a very good question. And for people that may not know, shotgun sequencing really is when you're basically doing like an untargeted next generation sequencing to find out what species that is present in your sample. So it doesn't target anything at all. It basically just sequences de novo. It uses a lot of like sequencing depth. We don't offer that service in-house. We offer the service with the partner lab. So basically, we are not going to do shotgun in-house, but we can help you sequence out, and then we can also help you analyze those the data as well that comes out of that. We can help you from design up or to data generation as well as analysis, but we don't do it in-house on the ground. But if you're interested in shotgun sequencing of whatever sample type, please reach out and I can definitely help you out.
Yeah, thank you, Justin. So I have one question I'm going to ask. So I think in the range of the activities, do you guys also do like any of the other genome technologies like Illumina, or you have interest in, going to the Illumina, PacBio, ONT? I mean, because one thing we want to do within the African BioGenome Project is see how we can leverage all this technology. As you perhaps saw from Dr. Ndodo's presentation, the AfricaBP is also positively inspiring several national projects, whether in Morocco, as we've seen now in Nigeria. We also have the Morocco and have South Africa and everywhere. So what's the perspective on that with regards to like the Illumina, PacBio, ONT, and the rest?
Yes, thanks actually for asking that. We actually have been comparing different vendors to find out the platform that would work best for us, both for short read sequencer. We have a Senga sequencer that is actually doing some of the job because it's cheap to provide like barcoding service and all that. But for long range and then NGS sequencing, one thing that we're leaning more towards ONT, and that's because about 2 years ago we're promised actually a Promethean from the CEO himself when I met him, but that conversation died down. But I think I'm trying to resurrect it again. But one thing I can assure you is that I know that within now the next 3 months, and we're definitely going to have a long read sequencer because we're planning to build reference genomes both for human, so some of our human genome projects that are already ongoing. And I know that with collaboration with Professor Osuji as well, there's strong interest in, building reference genome for some plant or biodiversity species. So I think within now the next 3 months, we are definitely going to have something in the house. You're muted, thank God.
Thank you, Justin.
Okay.
We have 2 more questions online.
Sure.
One is from Nora Ihe. Nora is asking, can undergraduate life science students benefit from your trainings? And I think I'm going to then slide to the other question because they're related. Favor M. Elvis is asking, do you guys accept IT students?
Okay, so 2 things. Yes, undergraduates can always benefit from our trainings. We are basically not kind of like biased when we select people for our free trainings, like the Africa BioGenome Project, workshop that we just basically offered on what people's interests are. And we chose about 50 people. And of course, we're going to be offering more and more of those things. Most times we actually don't, it's not really one of our target for revenue generation. So we are definitely going to be offering a lot of trainings even to undergrads and IT students. Yes, actually we've recently, although we don't have any more space for more ITs, we just recently onboarded about 4 ITs that are going to be part of my AfroDNA from, I think, minimum of 3 to 6 months thereabout. But they are basically starting this week, and their first, they just started recently, and then some of them as well are going to start by next week. But yes, there is room for onboarding IT or interns. Are there any other questions? Or
thank you so much, Justin. Control, do you have any question on site? Professor Osuji, do we have any question on site, please? We can't hear you on site, please. We can't hear on site, please.
Anyone has question?
Maybe they can type it. They can type the question.
We have a question here.
Please ask your question.
One Professor Tobias is the Federal University of Technology World. I just want to not really a question, but then share a concern. Last the immediate past graduates that passed through me, we have this genomic research and design, and wanted the 7 of them to do. Now, I tried to reach out to Victor here. I mean, I saw the time, one of the people at this local center, they outside there, they said he will get back to me. And I just confirmed that all those wire were just waiting to get back to me. I said, well, related to the organization. And never really got a response. I was forced at the last minute to give an alternative project anyhow, let all the graduates, and let me not be the problem. So the question or the concern, why is it takes you so long to respond to research needs, investigating or trying to find out what you can do and how much it will take so that the students will know that they can be able to apply themselves doing that thing and in order to graduate on record time. It was a big concern to me, and eventually I was forced to give last minute U-turn to pick something else just to make those people leave my hands and graduate. Thank you.
Thank you. I think from what I'm understanding, you're asking about, efficient responses whenever there's like a project request, which is actually a very good thing. I really don't, I definitely, whenever we receive any kind of like order request, we try to respond very, very promptly. I think very soon, I and Professor Osuji and Dr. Victor himself, I think we're going to come up with a very, very streamlined way of kind of responding to requests from around that regions, because most times we work as a collaboration. So if basically we were slow in responding and it was coming from our end or from the end of Dr. Victor, my apologies. We're going to do better next time.
Thank you.
Thank you.
Thank you so much, Justin. We really would like to thank you for coming. I know it's quite early where you are, and hopefully we'll get to see you again, and looking forward to the practicals throughout the week. Please do give Dr. Justin a hand of applause or on site or using the chat box, please.
Thank
All right.
Thank you so much. All right, bye.
We're gonna do one or two activities that we normally do, particularly for the sponsors. So we have two big sponsors of this event, which is Illumina and also Nkaba Biotech. So we're gonna just I'm sharing the promotional materials of Illumina in the chat box, so please feel free to kind of explore it. And we're just gonna take a few minutes break and also try to get the promotional video up, and then go to the next presentation, which should be an Illumina presentation by Priscilla Abechi. So Priscilla, I hope you're on the call and you would be presented next. So just be on standby, get your slide ready, or yeah, just one moment, please. don't have audio for this recording. I'm just going to try to see if I can download it. I'm trying to get the audio up. Hopefully it works. Anna Etta. So Anna Etta is waiting to present. So let me see. Okay. So I think I couldn't get the video up. We're just gonna go to the next presenter. That's Priscilla Abeche. Priscilla, are you on the call? I'm gonna make you a co-host now. So over to you, Priscilla. Could you please share your screen and then put on your video? Priscilla is with Illumina, the Illumina Genomics technology company. She's going to be talking about unlocking the power of the genome. She's the territory manager for West Africa. And over the next 15-20 minutes, we'll talk to us about Illumina. So I hope I can get the video up, the sound basically up afterwards. Over to you, Priscilla, please.
Okay, good afternoon, everyone. Please confirm if you can hear me and see my screen.
Yes, please carry on.
Okay. Good afternoon, everyone. Again, my name is Priscilla Abechi, and I'm the territory manager for Illumina covering West Africa. My apologies, I'm not physically in Port Harcourt like I was last year to present. So I hope I do a good job of translating the message from Illumina. And thank you once again to the African BP team, and thank God for giving us an opportunity to be part of this workshop. Just a brief introduction into Illumina. Illumina is a biomedical manufacturing company with our headquarters in USD San Diego. And one of our greatest mission is improving human health by unlocking the power of the genome. As a scientist, whenever I'm asked what is the importance of a genome, I usually throw this question back to the team, which is, if you have a problem, how do you solve the problem? What's your first step? I believe everyone is going to say understanding the problem. And that's what genetics and that's what the genome does for us. With the genome, we're able to understand different dimensions of humans, animals, and also our environment. In Illumina, we have different areas of specialty because we found different application areas that we can apply the study of genomics, agrigenomics alike, which is in the areas of oncology, reproductive health, genetic disease, microbiology, agriculture. And we've had the opportunity to work with different customers spanning different areas of research and also different groups, which is from the academic field, research centers, pharmaceutical companies like AstraZeneca, genome centers, biotechnology companies, hospitals that might be dealing with oncology or reproductive health, customer genetic companies, and also government agencies, where it's similar to NCDC. We also have, over the years, created and produced different spans of equipment, ranging from low throughput equipment, mid throughput, and also the high throughput equipment. So it doesn't matter what your application is or the volume of your sample is or the budget that you have to work with. Our range of equipment have been produced and created to be able to fit within whatever your research question is and whatever budget you're working with. Whether you have about 3,000 samples per month or just 20 samples per month, these equipments have been produced to be able to fit in and to answer your research questions. Now, two major technology revolutions that we have done in Illumina is the NGS and the microarray. And one might ask, what is the difference? NGS, which we tagged as next generation sequencing, is you're able to see everything in the genome. Like I said earlier, you're just talking about human genome. It could be in plants, it could be in animals, it could be in the environment, it could be in wastewater. With NGS, you're able to see what is it. In the cases of where we have outbreaks and we're not able to answer the question, what exactly is causing this disease outbreak, NGS can give you the visibility to see whatever it's in your sample, which is why genomics and the study of the genome is really crucial in our variants. We're looking at specific mutations, we're looking at specific SNPs that of target that we're working with. And this is probably more seen in infectious disease, or if we're looking at agri-genomics, which I'll be speaking into later in my slide, we're trying to maybe identify maybe specifically species of variants in the samples. One of the things Illumina has done with our technology is to be able to unravel the complexity of the genome, driving discovery, association.
Priscilla, some participants say your video is not on audio.
Okay, let me try to explain.
But it's okay if you don't want to put it on, but so we weren't sure whether you wanted to put it on or not. So
it was actually on, but I just turned it off now just in case if that's affected. Let me try this again. Can you confirm if you can see me now?
Yes, it's on, but we can't see you. That's what the participants were saying.
Oh, my apologies. Probably a network issue.
Yeah, it's fine. You can just yeah. All right, carry on, please.
All right, thank you. Okay, so like I was saying, one of the things we have done is to be able to unravel the complexity of the genome, which allows for driving discovery, association, and screening. We want to be able to explain what you are seeing in your sample or what you're seeing in a particular region. For sequencing, you're able to find new variants like we did during COVID-19 or during the Marburg outbreak. You're able to also be flexible with what you want to do. You'll be able to identify new things. You'll be able to identify the known and unknown. And then with arrays, like I mentioned earlier, it gives you what you know. For instance, if you're looking at drugs, if you're looking at oncology, and then we also have statistical power. So it's not just about sequencing, but you should be able to interpret what you're seeing, especially for the clinicians. And that's another thing that we have seen that sequencing and our technology has been able to provide. So it is a combination of not just genomics, as we know we have different omics now. We have pharmacogenomics, we have agri-genomics. So one of the things we pride ourselves in Illumina is to be able to produce equipment that can cut across the different omics of research. I want to speak a little bit about characterizing genetic diversity. Now, how well do you know agri-genomics in Illumina? We've had the opportunity to work across different groups of customers and clients, and we've been able to sequence 10 million samples, both in 2022 and 2023, and even more now. Now, what does this do? What are you able to achieve with genomic sequencing using our solution? We can talk about parentage testing, we can talk about GWAC studies, we can talk about genomic selection, especially for people that are studying maybe on rice, potatoes, yam. We're talking about trait testing, we're talking about species diversity profiling. If you want to know what species is currently within your region, we're also talking about carrier screening. We have a broad range of the agri-genomic genotyping array portfolio, which I'll be diving into a little bit. We have the cattle array, and most of the applications you can see from my screen include complex traits, include parentage verification, genetic diversity. We're also talking about breed purity and composition. We have this paper that was published with some of our collaborators, and here you can see they were able to do selective breeding right in France, and which helped the farmer answer a particular questions. How many dairy replacements do you need? How do I spend my artificial insemination budget? These are some questions that a lot of farmers had and were able to answer with this research. We also have the goat array kit, which also answers similar questions with the cattle array, but again, it depends on what your research question is, and we'll be happy to have further discussions with you just to fit your research question. This is one of our collaborations that we had with some of a customer in France, and we're able to come up with this. I hope my screen is still showing. Can you confirm if you can see my screen?
Yes, please, carry on.
Okay. And we're able to really break down in terms of sanitary information, in terms of functionality. These are also some of our other solutions with some of our customers. Now, one of the major goals that we've had, and which also part of our collaboration we had with the International Camel Consortium, was how to bring together innovation and growth through Illumina. And that was the reason why we created the Illumina Greater Growth Initiative, which Professor Dr. Rajana from IITA won 2 years ago. And with that, we're able to combine the use of one of our prominent sequencers, the Novasec, and also using our bioinformatics technology analysis tool, the Dragon, to be able to create a genetic diversity database, which was used to create the first camel beat chip, which has been used since 2023. We are very, very proud of this creation, and we have worked with other collaborators, including H3 Africa, to create chips also that are useful for the African continent. I don't know if, not sure if this can show, but I would leave the link in the chat box, just so that you can have a little bit more information on some of our innovations and some of the things that we're able to create with the camel beat chip. This is also another publication that we had in our collaborations, and this was focused on horses. So I've talked about animals, I've talked about maybe animals a bit, but like I said, genomics is not just restricted to humans or animals. It can also cut across plants, which you can see here from the multi-species wheat and barrel hierarchy array, which you can use for fingerprinting, can also use it for trait marking using the GWAC study. And this is just a sample of what the array looks like. And you can see, for instance, minimal amount of requirements, we have about 1,152 samples. And on the bead chip, you have about 1,000 bead chip types. So the chips that are being created, especially that we have customized for in agri-genomics, since this is my area of focus now, really can give you detailed information about the genomes that you're dealing with, cutting across your animals, cutting across your plants, you're dealing with chickens, you're dealing with camels, goats, as the case may be. And for us to be able to walk you through your project, this is just a breakdown of what we have put together to work with. Once we have an idea of what you want to work, which is your team, your requests, these are the animal or the plants that you're looking to, we have a team that has been put together that works with you to design your project, that also goes as far into manufacturing and also to the shipment of your bid. We are really proud of the Infinium array because it's really a versatile and a scalable tool that can be used and be applied into different testing. We have the commercial ones, and we also have the custom arrays that also cut across, like I mentioned, plant and animal samples. And we have had more than 10 million plant and animal samples that have been genotyped since, and even more now, we should probably be hitting over 20 million samples that have been genotyped since 2023. And really, we have one sample is being genotyped in every 3 seconds. That gives a testament of the speed at which the samples are being worked on. I think I'll be stopping here for now. Thank you so much for your time, and I look forward to your questions.
The International Institute of Tropical Agriculture.
Thank you so much, Priscilla. Let me see. Can you see me? All right, yeah. Thank you so much, Priscilla, for your talk. And we're going to welcome questions now. Do you have any question online for Priscilla or on site? On site participants, are there questions?
We have questions here, so also have microphone. All right, now you can go ahead with your question.
Yeah, go ahead, please.
There's your question, you can go ahead.
Sorry?
Can
I didn't catch what you're saying. Yeah, I didn't catch what you're saying.
I said there's no question, you can go ahead. Yeah.
Okay, all right, okay. So, Priscilla, from me is, for instance, one question is that we know Illumina is short trace. I mean, when are you guys bringing long race to the market? Any intention, especially for usage for non-human genomics?
We do have the long grades now, which is on the Novasec X Plus, and we do have plans to bring it also to the lower mid-fruit and low-fruit instrumentation. So on one of our latest innovation, the X Plus series does have the long grades now. Did you hear that? Sorry.
Yeah. So when do you expect? When do we expect it to, or when do we expect to start using it?
The long grades. I mean, we do have some countries that have declared and started using that for those that have the X pluses. We might not have right now in. I think we have one or two. We have a couple of X pluses now in Africa, and I look forward to them having some successful runs that we can publish pretty soon.
Okay, perfect.
Yeah.
All right, thank you so much, Priscilla. Thank you for coming also, because I understand there was a bit of a challenge or confusion on the timing and date and speaking invitations. All right, we'll move on to the next speaker, or rather before the next speaker, we'll just take a short break, maybe 5-10 minutes, and then return. So can we reconvene at 3 p.m. please? Then the next speaker will be Hannah Etta. So Anna Etta, could you please be on standby for your talk at 3 p.m. please? Thank you.
Agriculture. Yams was one of the most orphaned done. They belong to the family called Dioscoreaceae, and that I think there is a need for the world to recognize the value of yam and start investing on this.
Okay, all right. Thank you everyone for coming, for the, returning back from the break. We have 3 more presentations and then we'll wrap up. So the next presenters in the sequence will be Hannah Etta, who will speak about her work, followed by Alfred Osai. So I hope Alfred is still on the call. So let me just find Alfred. So please remain on the call. Alfred Onefeli will speak after Anna. Then after Alfred will be Genevieve, and after Genevieve will be the closing vote of thanks by the DVC R&D University of Port Harcourt. And I don't know if Professor Osuji has any presentation on his side, but would be able to capture this during the moderation activities. But I do know he probably has one. Professor Osuji, do you have any presentation on your side apart from this 4 presenters? Then we can begin and see how we manage the time. Okay, we'll start. The next presenter will be Hannah Etta. Hannah, could you please share your screen? Okay, Julian is speaking. Well, Julian, are you saying so? All right, go ahead, please.
Can you hear me?
Yeah, we can hear you. Please go ahead.
Okay, all right. So there's nobody here on side that's ready to present, but Victor will present a paper. That's the after number 1 that we skipped yesterday. We Genevieve might skip that one so that we'll contain this.
Okay.
And then, yes, and then I'll just present something else that I'll make good. So after that, we can have it.
All right, thank you so much, Professor Suji. And I think Professor Anne Mugai will be taking over the online moderation afterwards as well, but just after this session. Do we have Anna? Anna, could you please put on your video, share your slide, please? You did share it earlier on. Anna, you're a co-host now, so please share your slide. All right. I think you need to go all the way to the first slide, please. Anna, do you want to share your screen, please? Can you talk? I can't hear you. Or we can't hear you, rather. Are you talking, Anna? You can unmute yourself, please. I think you're on mute, so you need to unmute yourself.
Good evening. Can you hear me?
Yeah, I can hear you now. Please make your slideshow. At the top, you see slideshow, and then you start from beginning, please.
I don't know why I can't see the Zoom.
Sorry? You can't see the Zoom.
Yes.
But you're sharing your screen already.
I can't see my shared screen either.
Well, can you see your slide?
No.
Okay, can you stop sharing? Go to the bottom of Zoom. You will see the Zoom icon. Then you stop sharing, please. Okay, if you're not ready, then we can just try to see the next speaker.
Can you see my screen, please?
Yes, please. We can see your screen.
So can I go ahead?
Yes, go ahead, but make it slideshow, please.
Okay. So good evening, everybody. This is Professor Hannah Etta from University of Cross River State. I and my team did a work on the in silico characterization of spike protein gene associated with Lassa hemorrhagic fever. And I know I have just 10 minutes, please. Now, on my second slide there, we have the culprit, the Mastomys multimammate rat, whose pupa and pipi causes a Lassa fever, Lassa hemorrhagic fever that has become a topic of discussion in Nigeria in recent weeks. In Africa, the demographics are there. We have about 100,000 to 300,000 clinical cases per year. Just last 2 months here in Nigeria, we had these confirmed 118 deaths caused by these rats in about 91 local government areas. So this is something we need to be thinking about because it's no more funny. Now we found out that the spike glycoprotein gene found on the protein coat of the virus causes Lassa fever can serve as a drug target protein or epitope for attacking this toxin. It initiates the infection in the human host, and it mediates fusion of the viral and cellular membranes by acting as a class 1 viral fusion protein. We also saw in literature that it binds to the human SCES and the CLE signal receptors. It internalizes the virus into the endosomes of the host cell, inducing conformational changes in the S glycogen. For our investigation, we employed the services of several bioinformatics tools as presented there, the FASTA, BLAST, Search, investigated the molecular weights of the virus, the size, coding regions, the S gene, the start and end codons, total number of amino acids in the protein code, the aliphatic index, instability index, extinction attenuation coefficient of the virus. These are some of the things we investigated. The content, the half-life, secondary protein structure, the theoretical and selective point, total negative and positive charges of the amino acid residues, and the protein target site or the isolates. Now, some of the results we had are presented on this different tables. We have the presentation of the number of amino acids, the molecular weight, and the rest of them. That even the primary sequence of the virus, we were able to retrieve it from the NCBI database. Then we also found the secondary protein structure characteristics to see that it's dominated with the random coil. We saw the beta tones, the alpha helix, extended strands. And these are summaries of the findings. That the spike protein gene has 498 amino acids that make up the primary structure. It has a unique 3-dimensional shape. The formula was computed to be CHNOS. The extinction coefficient was 1.336 gram per liter, estimated half-life 30 hours. The instability index of 34.90 indicating that it's a very stable gene. And this was also corroborated by the high number of atoms that were computed or discovered. The aliphatic index of 82.05. We also saw that the SPG is highly positively charged, hence it will not survive and thrive in an acidic medium. The secondary structure is dominated by random coils at 48.32%, presenting it as a less stable structure than those with the alpha helices, which are more stable. Now, for conclusion and recommendation, this study presents a baseline information on the spike protein gene found on the protein coat of the Lassa fever virus. This information can be applied for variant analysis, can be used for pathogenicity prediction, and from this, we recommend that steps towards targeted gene therapy for Lassa hemorrhagic fever be initiated. Currently, clinical trials for a vaccine. This can also be another way of dealing with the LHF, like selecting delivery methods and introducing modified genes into the cells. So this is the summary of what we were able to come up with concerning our studies on the spike protein found on the Lassa fever protein code. Thank you.
Hello, can you hear me?
Hello? I can hear you.
Yeah, thank you for that wonderful presentation. I think the finding is currently not available, so we will just open the line and take questions and see if anybody has questions for you. So just stay back while we take questions from the participants. So anybody on site that has questions, please indicate so we can ask Dr. Hannah. Sorry, Professor Hannah, to address that. Anyone? Okay, what about online? Do we have
anyone online who has any question? You can raise your hand up, but I don't see any questions in the chat.
So if anyone has questions after now, you can just drop it in the chat box and Professor Hannah will be available to attend to those questions. Thank you very much, Professor Hannah, for the presentation. All right.
I don't see any questions in the chat, so we can move to the next presenter. Alfred, is he on site or online? Alfred, are you there? If not, we can move to Victor. Victor, you can load your presentation.
Just give me 2 minutes to get it ready.
Hannah, maybe you can stop sharing. Professor Hannah, thank you. You can stop sharing your slides, and then Victor, you can load your slide. Victor, can you hear me? Professor Julian, are you with Victor on site? You are now a co-host, so you can be able to load your slides. Victor, you're muted. Professor Julian, do you have Victor on site with you? I don't hear anything from Victor. Professor Julian Suji, is Victor on site with you?
Yes, I'm on site. Can you hear me?
Yes. Okay. So Victor, please start sharing your slides and proceed. We cannot see or hear from Victor. Professor Osuji, maybe you can assist to get Victor to start his presentation. Thank you very much. So make them slide show. Presentation mode. Great, you can start. Victor, you're muted. We cannot hear online. You're muted. Unmute the Zoom. Please unmute yourselves. Victor, we cannot hear from the online audience. Also remember to unmute yourself, Victor, please, from the Zoom. So we cannot see your presentation online and we cannot hear you. Thank you.
Okay. One. Yes. Yeah. This new.
So, Professor Julian, is somebody presenting? We who are online cannot see you, neither can we hear you.
Can you hear me? Yeah, and
Yes, I can hear you now. Is Victor presenting? We can't see anything.
yes, Victor is trying to resolve the challenge he has.
Okay.
Maybe just give me 1 or 2 minutes. If we are not able to do that, then okay. I think can you, yeah. So let's wait for him. In the next 1 or 2 minutes, we'll start his presentation.
Okay, can we have one presenter who is ready online? Go ahead.
Yes, Victor is almost there.
Okay. We can see he
Right.
started screen sharing.
Yeah.
Great. We can see your slides. Make them slideshow and then proceed. Excellent. You can proceed.
Yes.
Okay, can you hear me now?
We can hear you very well. We can hear you.
All right, so first of all, I want to just apologize for the challenge that we had in presenting this. So this is actually a presentation that highlights some of the challenges that we've been encountering over the years in research, especially in the area of genomics and biodiversity in Nigeria and in West Africa. So we're looking at how we can leverage the platform that is created by AfricaBP to optimize scarce resources for biodiversity, genomics, and bioinformatics research in West Africa. This is in acknowledgement of the fact that we have the constraints of resources when it concerns genomic research, especially because of the fact that we are from low-income earning continents, and most times when people want to do some of this work that involves sending them maybe abroad or having to buy reagents and all that are very expensive, because when you convert the local currency to dollar, you realize that there's a lot of cost involved. So that's a lot of challenge. And besides the cost implication, there is also deficits in terms of facilities, resources, and human capacity, you know. So this presentation actually highlights some of the ways that different agencies across West Africa can harmonize the little resources that they have to be able to make impact in the global space in biodiversity research. So we of course know that there is enormous resources in Africa in terms of biodiversity, and there is limited genetic characterization due to inadequate infrastructure, scarce funding, low human capacity, like I've mentioned earlier. So all these different limitations put stumbling block in research in the West African region. But one of the things that we have to understand is that even though there are agencies, some of the agencies may not have all the resources or all the capacity built in their facility, we have pockets of different human capacity will be the way to go. In fact, I was inspired the other day by a statement someone made. Said that when I was talking about some of the challenges that we have in research, said that the music industry has been able to excel in Nigeria despite limited funding, despite government intervention. So what did they do? They just didn't focus on some of those challenges, but they had to network within themselves and begin to look at the different ways that they can achieve their goal. And I think that we can leverage on that, because if all the different agencies in West Africa begin to collaborate, there is massive achievement we can make in regard of biodiversity research. So I'm going to just show certain agencies in West Africa that can, come together and look at how they can collaborate. Some of these agencies may have sequencing capacity, others may have bioinformatics tools like computational skills and capacities, while others have maybe funding or other kind of resources. I had the NCDC Dr. Ndodo today talking about the different opportunities and resources that are going to be available for research and capacity building, which is a very interesting thing, because if we begin to leverage on these different resources, there is likelihood that we can make achievements even with labor funding. So next slide, please. So I'll just briefly talk about AfricaBP as a continental initiative to sequence African biodiversity, and their objectives have always been to promote local research and data generation, build infrastructure, human capacity, foster data sharing, and collaboration. So this whole initiative, if we leverage on it, it can form a platform that some of the agencies can come together. Like we as a center and as the anchor node for the West Africa, we've been able to participate and train over 100 people within these 3 years, if I'm including the ones we're going to be training this year. So you realize that there's so much that AfricaBP can offer, and this year alone we have like 9 networks of practical locations that are engaging in training of human capacity in Calabar, in Oshun, in Ondo. We have one in Togo, that's in Lomé. There is another one in Ghana, that the Kwame University for Science and Technology. So all these training possibilities have been easy because of the platform that the Africa BioGenome Project provides. And there is so much more that we can achieve using. Besides the capacity building, which is where I think that most of the agencies are focusing now, we can begin to talk about, please next slide, we can begin to talk about how we can now begin to share resources. Because like when you try to do certain work, biodiversity space, you realize that there are limitations. Maybe you don't have a sequencer, maybe you have a sequencer, you don't have the bioinformatic tools, computational capacity. So instead of us waiting until when we're able to get all these things, we can just leverage on the platform for people who do not have these different resources to begin to network. So Africa can't just, or West Africa can't just fold their hands and be waiting for when one miracle happens before they can begin to put their map on put themselves on the map of the biodiversity, genomics, and bioinformatics and research landscape. So I feel that there is need to begin to develop a platform that just like utilize the platform that the AfricaBP provides. And this platform is for collaboration and data sharing, pooling of regional resources, support for policy alignment. In fact, the reason why I'm focusing this presentation on national agencies is because for us to make headway in terms of policy alignment, you need the national agencies. They are easily the ones that can talk to the government to begin to channel resources and funding towards the research, R&D, and also towards biodiversity research and genomics research. Next slide, please. So, for example, in Nigeria, we have the National Biotechnology Research Development Agency. That's a national agency. We have the Nigeria Center for Disease and Control. We had Dr. Ndodo today speaking. There is also the National Institute for Medical Research, Nigerian Institute for Oceanography and Marine Research, and many more other agencies, including all the different universities, federal, states, and privates, that we can leverage on to begin to partner, because some of the problems that we've had have been to be working independently. I went into one area of a kind of a business center in this campus, and I saw that everybody had a small chain, working. And I was just thinking, what if all these people come together and just build a power plant? They will reduce noise, they will reduce pollution, and it will be efficient. But everybody wants to do their thing on their own, so it's a problem, and it's something that we have to try to look at, because if we begin to pull our resources together, then there's so much we can achieve. Some of those challenges are just peculiar to the challenge that is peculiar to a particular agency might not be peculiar to another agency, but we can leverage on our individual strengths and overcome our individual challenges. So now, also, if you look at next slide, if you look at the country Ghana, next slide, please. So you have the Council for Scientific and Industrial Research, you have the Noguchi Memorial Institute for Medical Research, University of Ghana Genomic Labs, and even like other universities like the Department of Improvement, they have excellent bioinformatics department, and all these different agencies just work independently. I'm just trying to reinforce what I'm saying, that if these different agencies having different resources come together and begin to form a network, and they already have a platform that they can work on, which is the AfricaBP platform, then we can begin to do serious research, because honestly, these pockets of individual effort is not really going to advance our efforts. Next slide. So we have in Senegal, the Institute for Senegalese Research in Agriculture, and the Institute for Research in Senegal. Next slide. So just run through the different, so Côte d'Ivoire, you have the Institute for Pasture, the Côte d'Ivoire, and the Center for National Research and Agronomics. Next slide. Burkina Faso, the Center for National Research and Scientific Techniques. Next one, Center for Research and Formation in Infectious disease in Guinea, and we have in Togo Togolese Institute for Research in Agronomics. So next slide. All these different research can begin, research agencies and institutions can begin to come together to, next slide, please. So now, what are the strategic roles of this research? Number one would be to build and host genomic infrastructure, to develop and implement national policies, to coordinate regional efforts, to align research with conservation goals and train research in techniques. So if these strategic roles are being deployed collectively, there is the chances that we can make very strong headway. And with that collaborative model in sight, we'll be able to cross-border research and do network and share sequencing centers, joint data repository, and standardize our bioinformatics pipelines. So what I'm trying to say in essence is that all the different agencies have their strengths and weaknesses. By collaborating together and making use of the limited resources, we can begin to foster a more novel and decent research in research landscape. Because right now, for example, in Nigeria, whatever research that you have to do that requires genomics, somebody asked the question, I think it was charged 36 million, right? Now, I don't know, if you don't have research grant, there's no way you're going to do that kind of research. And for example, an average research that involves metagenomics is going to cost you, if you want to do a decent research, I'm not saying like you're going to collect one sample and check if the population of organism or 2 samples, the population of organism there. If you want to like sample 50 samples, 100 samples, you should be talking about minimum of 10,000 or upwards dollars. And that is really not affordable. That's not affordable, but there are sequencing centers, there are people with different kinds of capacities for pipeline development, for bioinformatics tools, that if this agency begin to work together, then we can make serious headway. Next slide, please. So some of the ways we can align policies and ethics to adopt shared legal frameworks. So some of these agencies can collaborate together, come under some of the ECOWAS agreement allows countries across West Africa to be able to make certain collaborations, then align with the Nagoya protocol. I've just put up the Nagoya protocol for you to look at. Then apply fair data principle. Of course, sometimes data sharing might be a problem, but if there is understanding between the different agencies across the different countries, then it will be easy for you to, for example, you want to do research in Ghana, you don't really have to travel to Ghana, you just need to contact an agency in Ghana and they're able to, release data for you because there is that understanding. And also develop ethical sample sharing mechanisms to make some of this data sharing and research easy. Next slide, please. So now, how can they really leverage on the AfricaBP? One of the challenges would be, where would this collaborative effort be domiciled? So the AfricaBP presents that platform for you, this collaborative model, because the AfricaBP is already up and running and it's done a lot of progress within the space of 5 years of its foundation. And so if we're able to do that, then early career scientists across the different countries can get training. So it might just be easy for you to apply for training if you're working and you have an affiliation with an agency in Nigeria. You can just get a training opportunity in Ghana, in Senegal, in Togo, or wherever across the African border to be able to gain skill. I personally was one of the beneficiaries of the capacity training of AfricaBP between September and sometime December. I was able to leverage on the daily career trade and platform that they created to travel to US to do research fellowship with Institute for Genomics Biology at the University of Urbana-Champaign in Illinois, US. So some of these different career training, and there's a lot with IITA, with INCAPA and the rest of them that AfricaBP has been providing. So instead of these pockets of training, these institutes can leverage on the existing capacity building models and platforms that the AfricaBP has provided to be able to, effectively train. Because it's one thing to train somebody, it's another thing to really train that person effectively. I mean, like some people can be half trained and you realize that whatever training that you got will not be able to utilize it or to be able to apply it. So a full capacity building initiative or effort would require a combination of all these different agencies. Then molecular and computational workshops like we are doing now. So the Kwame Nkrumah University of Science and Technology will be basically their hands-on training is basically on computational biology and bioinformatics training. I think they will be having one for online, so if you're able to get the link, you can join them. Then we have also integration into academic curriculum. So when these people are trained, they can get into academic to be able to influence the curriculum, because we realize that sometimes also some of the things that you learn in school, when you come out of school, you realize that you really can use it to do anything. So curriculum reforms and curriculum change will be necessary, and it will not be that easy without a concerted effort from the different agencies and pushing in terms of policies and implementations. Then exchange programs and AfricaBP Open Institute. The Open Institute, which is part of what most of us are enjoying today, being able to attend a workshop without paying, and maybe in the future, I'm hopeful that AfricaBP will be able to get to a point where they can, even begin to sponsor people to come to such workshops so that we can also cover traveling. But all this will be possible if these different agencies get involved and use this platform to make their impact, instead of just doing pockets of efforts that may not be holistic enough. So utilizing this opportunity and the platform that AfricaBP provides will be a good one. Next slide, please.
Just checking, Professor Julian, whether you're still there. The slide seems to have frozen.
Interesting to see a workshop in Nigeria that gather people and you don't have to pay for that work.
Who has made it very possible for the regional center to operate very freely and effectively within the international system of Africa and beyond is here. This means BBC has been seriously engaged since we started this program yesterday, but has been actively moderating things. You all know the challenges with light we've been having there. He is the brain behind when the light goes, he forces it back. This time the light he has been very strong behind the level of success we are able to record today. So this is what you should talk right there. All right, thank you. The online team, Professor Anne, are you there? Can you hear me?
Yes, we can hear you very well. Are there any other scheduled presentations?
Okay,
Yes.
that's fine. So let's see if we can, any questions, please? For
online, there are no questions.
Victor, you might go to the system there.
Thank you very much, Dr. Victor, for this presentation. It's a very wonderful presentation. The challenge we have in Nigeria is that the challenge of implementation. The question I want to ask, we talk about collaboration from other institutes. Who are the people that will initiate the collaboration? Like this AfricaBP. Is it because one is that most people are not aware, or some institutions may not be aware of this AfricaBP. So how are you going to make it known to other many high institutions in Nigeria? I think I want to actually know what is the step AfricaBP, what are their level of involvement in or step they are taking in order to collaborate with all the high institutions in Nigeria. That's number one. And the question I want to ask also is that, you know, one of the challenges we have in this molecular biology research is the reagents. All those agents that are coming in Africa, are they making any plan where we can have a kind of a facility that is producing all these reagents? Because if you have such facilities in Africa or Nigeria, I think we are going to have a kind of low-cost research. Because before, like my friend said, when you think about the whole thing, it's as a result of the reagents. The reagents, before you do the exchange from 1,600 something to US dollars, you know that it will be very high. So all those agents that is coming up for this collaboration, are they thinking out of the box to see how they can be producing all those reagents? Will be able to, I think it should be a part of the thing they should be thinking about. And the integration of the curriculum, of course, is still a part of what I'm saying. And I want to tell you, I believe that most of the institutions, in my institution, the faculty professor, and during the CC Mass, we incorporate this course as the 400 level, which we believe that in time to come, we'll see how we can collaborate to send our students for more practical training. Thank you very much.
All right, thank you very much. First of all, let me just get straight to the effort that AfricaBP is making and how they intend to reach out to different institutions in Nigeria and all that. Now, this is the fourth year of this regional workshop, and this year we had over 1,600 people registered for this workshop. That's actually a milestone. Like, if the message that we are preaching here now, all of you take it to your different institutions, that's how we continue to spread. We know that AfricaBP for now is just running on a very low budget and just people trying to do things and help the continent to move forward. So one of the truth is that that is part of the reason why we come together every year, so that we ignite this fire, and when you go home, you take the message back home. So it's not just going to be domiciled with AfricaBP as an institution, but it's going to also be like everyone trained through the program becomes an ambassador of the program. So you get a free capacity building. So the only way you can pay back is to spread the message. So it's like going back and spreading. And some of that effort is how we are going to be able to make progress in terms of
So that's how we can make progress in terms of how we reach out to different institutions. And I promise you that as we give absolutely, because if you look at what they are
government or any agency, imagine what so much funding that are doing nothing close to what AfricaBP is doing. So as the years go by, I'm sure that they are going to be making strides. And also regarding cost and all that. So why this collaboration is very key is that, for example, I gave you an example of the cost of. Now, if you want to do 5 samples, another person wants to do 5 samples, another person wants to do 5. I approached the Molecular Institute in University of Illinois, and there's something I realized that most times in terms of sequencing, the higher samples you sequence, the lower the cost. Your cost can become very low when your sample size becomes very high per sample. So your cost per sample reduces. So instead of you just doing your own research in your own space, if you come together, pull samples together, for example, you want to look at diversity of, let's say, eukaryotic organisms like fungi across different places. If somebody is looking at Port Harcourt, another person is looking at Owerri, another person is looking at Niger, and they pull their samples together, it becomes cheaper to sequence that. And you can individually go back and present and utilize your data. So there's so much benefit when we come together, even without that funding that we are focusing on. And the part of reaching out, of course, like I said, you are not like an ambassador to the university. You think to drive the message to continue to preach the gospel of AfricaBP and collaborative research. Thank you. Okay, of course, wants to say something. No, it's not.
It is not something that one institution can just do. The reagents and all of that are products of research and supported especially by corporate bodies. So these are things that will happen and the university system probably could come into that. But at the moment, you just follow the existing system. So, and please, do you have anything for those who are online? Do you have any questions?
No questions online, please.
Okay, no. I want your microphone on top of the mic. Right, you want to do that?
So, Prof, we can come to the end of the day. Is there another presentation? You're muted.
Can you hear me?
Yes, yes, we can hear you.
All right. Thanks. Yes. Yes.
We can see your slides. Only make them presentation mode, please.
All right. I'm just going to take things.
Good. Thank
you. So the presentation I'm making is on prospects of developing indigenous biogenome databases through an African BioGenome Project collaboration. Well, at the global scale, we know that genetic erosion is getting to unprecedented heights. And in this global map, you see places that are red. Those places are places with a high genetic erosion index. Their species are highly threatened. And then the intensity of color between red and blue shows the level of threat you can find in such places. And this is a map by the Global Alliance for Zero Extinction of Species. This global alliance is made up of about 93 institutions in 37 countries, which are put together to work against the extinction of species. And you see the places with red dots. These are the places with high extinction index. In Africa, we have the Guinea-Congolian vegetation, which is rich in biodiversity. The genetic bedrock for building sustainable and climate-resilient ecosystems, which supplies food, promotes good health, offers alternate and clean sources of bioenergy, buffers the impact of climate change, and supports livelihood. Loss of this biodiversity, especially indigenous species, has far-reaching and damaging effects on all life forms, our environment, and livelihood. This erosion of species is caused by this collection of factors, mostly by habitat destruction, alien invasive species, genetic pollution, overexploitation, climate change, and diseases. The way and pattern by which biodiversity is affected globally is enormous. Every 20 minutes, we have at least 3,500 human lives losses. One or more species is lost. 27,000 species lost in a year. Every 60 minutes, we have 240 acres of land destroyed, habitat destroyed. 70% of the world's known species
face risk. And 20% of world species could be gone in 30 years. And well, this is a collection of indices that data that actually support that there is a big threat. And it happens in all the countries. Every country in Africa has locations that have high conservation value. Where you have species that are highly threatened. This particular case here presented in this slide is that of Nigeria, showing Nigeria's forest and game reserves. Here I have about 20 of them, and each location has specific organisms or species that it holds, it accommodates. And some places have more bird life, some places have more animals, and some have a more endangered species of plants or animals. Some have different groups of organisms or different forms of conservation interest. The same thing happens in the whole of African countries. This particular map is also taken from southern Nigeria, especially the Niger Delta area. If you look at the first map on the top left, is a satellite map that shows the vegetation belt, how it is. And actually part of the old Guinea-Congolian forest that has very high level of biodiversity, second only to Amazon jungle of South America. And then the map on the top right now shows the ancient, in fact, the degradation of the ancient forests. You're now having it in small pockets that still represent the biodiversity of the species. And the factors that were out biodiversity have been diminishing the size of these forests. The lower map, this particular map, is actually showing pockets of this forest and then the geographical the location, the political map of the areas that is exist. At global level, a massive genome sequencing project started, that is under the AfricaBP project. The AfricaBP project is a group of people, specialists, who put themselves together in a big, very large consortium to confront this threatening species, and the way of doing it is through genome sequencing. And the AfricaBP project has different groups that make it up, the partners, like we have Africa BioGenome Project, which covers Africa. We have Canada BioGenome Project. We have AfricaBP Project Canada. We have European Fresh Genome Atlas. We have BioGenome Colombia, etc. These are groups of people having different BioGenome projects that want to further the objectives, achieve the objectives of the BioGenome project in their local facilities. Now, conservation and restoration of biodiversity through genomics is of paramount importance to minimize genetic erosion and safeguard genetic diversity of Africa's plants and animals. And for this reason, the Africa BioGenome Project was established in 2021 with a goal of sequencing genomes of about 100,000 species in 10 years, thereby generating approximately 203,000 gigabases of data, DNA sequence data. AfricaBP considers that the best approach is to support the sequencing and analysis of organisms in the continents, and one which is to empower African scientists to achieve this. This is the 10-year roadmap of AfricaBP, showing the progress being made from the point of commencement to the progress towards 10 years. And as you can see, this is, okay, from 2024, we entered the phase 1, that is, where the large-scale genome sequencing started. And you may have listened to some speakers, Ansia, Michael, Landy, a couple of them, that have presented works done in different parts of Africa, especially South Africa and East Africa and all that stuff. These are part of this phase of Africa BioGenome Project. We are working hard to see how we can achieve the target of sequencing this whole 100,000 species within the 10 years. And the effort is increasing, the steam is rising, and every effort is going. And we have interest in sequencing materials that are very relevant in agriculture for food security, and materials, species that have very high conservation value. And if you look at this table, this is the table, that's 2021-2022 list of endangered species by the IUCN. And this table has different groups of animals or classes of clades of animals and plants and other organisms being threatened per country in Africa. This is a continuation of the map. But if you look at that map, you will discover that about 10 countries, okay, let's say the top 10 countries that are most affected include Madagascar, which has 3,667 species threatened, endangered, followed by United Republic of Tanzania, Cameroon, South Africa. The 10th in this category is Nigeria, that has 427 threatened species. And when you look at this, you discover that a good percentage of these species is made up of Africa's neglected genomes. Around 12% of Africa's known endangered species are currently unsequenced. And out of about 21, last year it was 20, sequenced plants in Africa. In Africa, we have about 60,000 species of plants. Out of these, only 20 sequenced, and none was sequenced in Africa, except an attempt that was made last year. And you have about 385 species of animals sequenced. That is out of 123,000 species of animals. Out of this, only 11 was sequenced in Africa. So you see that Africa has a long way to go. Now, for us to achieve our targets in AfricaBP, there is need for collaboration. The value of the collaboration, the collaboration is very critical for conservation of indigenous biodiversity, promotion of genome sequencing within Nigeria and Africa as a whole, resourceful for breeding new or better cultivars, has positive impact on the fight against hunger and poverty, and provide facilities for materials for education and research, and promote industrial growth and development. Now, what impact will this have on need to promote utilization of new and existing cultivars of indigenous traditional crops and animals? The FAO indicated that about 100 varieties of plants were developed for food. But out of this number, only 150 of them are in use as at 2006. And out of this 150, it's only 4 that are popular. So what happens to our breeders and what they are using? It doesn't mean that some of the products are not good, but there are pipelines for making the products accepted by the people. A lot of people are afraid of genetically modified organisms A lot of people are afraid of all sorts of things. But there has to be a way of making people understand what is new and what is good about it, so that people will begin to appreciate these things. So out of the 100,000 new varieties of plants, only 4 is popular. So more has to be done to get the others to be popular too, so that there will be more food. But once people embrace them, then their value will increase. And the trend is even worse in present times. Some questions that beckon are because Africa, sorry, this is Africa. Know the new cultivars or varieties of crops being developed. A breeder in a university or a research institute will breed new species and register it and end there. So once it is not properly injected into the public, how will people embrace it? So that's a big problem. And then you have national agricultural research systems. How have they helped to break this trends? And then also have non-governmental organizations that are supposed to play roles in getting some of these things marketed to people to make them popular. Same thing applies to the products for animal breeding. The African Union's case for regionalized African genetic resources is targeted at helping this situation. The regional approach to organize conservation of plant and animal resources across countries through regional plant and animal gene banks, has some key provisions of, for instance, cryoconservation facilities, backup of storage for national gene banks, storage of materials, uniform methodology for identification and evaluation, promotion of uniform methodology, etc., and all this. So these are ways that could make new products accepted. Data on consultative group on international agricultural research gene banks is, in Africa, is what you see in this table. These are some of the international institutes or research institutes that are part of CGI, and these are the crops that they actually have in their holdings. Africa, some of these Africa is actually left out of global genomics efforts. And AfricaBP has come into the same.
Prof, if you can unmute yourself, the other group seems to have gone off. Unmute yourself, then we'll hear. Maybe you can mute the other one. The West Africa group, or
yeah.
Okay, we can hear you. Just continue. Thank you.
Yeah, it is not in their genomes. Proper management of the generated digital sequence information is of critical importance in species conservation. How do we close the gap? Well, we have to protect existing conservation areas, establish gene banks, acquire relevant infrastructure, embark on massive sequencing programs, develop digital sequence infrastructure, and commence nationwide capacity building
in every African country. In order to achieve this, African researchers need state-of-the-art genome sequencing technologies and HPC facilities. That's high power computing facilities. This is like a wide range of genome sequencing equipment. These are gathered from the collections and holdings of Illumina, Pacific Biosciences, and MGI. There are other ones. But when you see all of this, they are very expensive. And many countries in Africa are not able to afford some of these for their institutions. Therefore, we need private practitioners to come in, we need corporate bodies to come in and help finance African institutions and research groups to acquire some of these facilities and provide funds that will offer the running cost for the use of this equipment. The PacBio radio here is almost to the cost of $1 million US dollar for one. And the MGI, the DBN fund, DBN fund rate is about $650,000 last year. And then, you know, each one has its own price. So how many universities, for instance, in Nigeria can afford it? It's difficult. So if any progress has to be made in this country, either the government has a strict policy to support the groups who are doing these researches to get this digital sequence data, DNA sequence data, you know, for important organisms, and that will serve as generation of the resources, the resource base for tackling of poverty, food, and all of that. A matter of great concern is that estimated 70% of about 35 projects in Africa that focus on studying, conserving, or improving biological diversity in the past 17 years were led from outside the continent. It is of great concern. AfricaBP's promotion of local genome sequencing, data storage, and knowledge exchange programs through the Open Institute for Genomics and Bioinformatics Fellowships is ongoing and needs support. You can see here, these are some of the publications from AfricaBP, and some of these publications are outcomes of efforts made through the Open Institute for Genomics and Bioinformatics. AfricaBP's capacity building and knowledge exchange program is involved in training of people to strengthen the AfricaBP project pipelines and strengthen AfricaBP Open Institute, to save funds to support AfricaBP projects and partner institutions in Africa, and infrastructure development, and then further collaborations. The potential gains of collaboration with AfricaBP are just listed here. Knowledge exchange and technical competence, development of platform for adaptation of strategic policies and institutional frameworks, well-planned biodiversity conservation programs, establishment of genomics, bioinformatics database of indigenous biodiversity and digital sequencing information storage facilities, improve utility value of indigenous biogenomes of specific interests, capacity building, etc. Now, indigenous biogenome conservation roadmap of AfricaBP, includes this, and starting from sample collection and processing. It is not just because an organism is there, you just go and take it and sample it and do whatever you want with it. There is a procedure. You have to recognize and obey all conventions and legal provisions, policies surrounding those. For instance, you cannot just go and take an animal and say you're sequencing it and sequence and do whatever you like with it. You must
observe Nagoya protocols. There are certain policies that you must follow to get that done. And if it's plants, well, it also has its own peculiar policies that you have to follow. So from the collection and processing of samples, to sequencing, annotation, data analysis, etc., there's a pipeline that's involved. And all this is to ensure adherence to legal and ethical frameworks, curating species and metadata, providing collection and processing standards, coordinating national representatives, national ABS focal persons, that's access and benefit share focal persons, managing taxonomic working groups, sourcing species, etc., liaising with sample ambassadors and custodians. Now, AfricaBP's collaboration has a tripartite structure, which includes AfricaBP as a coordinating unit, and then institutional partners as well as corporate partners. The institutional partners provide the persons that will be beneficiaries of this collaboration, the scientists. And the corporate body partners provide support, the funds, the equipment, and some other facilities required for successful collaboration. AfricaBP provides the binding force to coordinate the process. Now, we have had certain elements of this capacity building. Here is the first by African Genome Center in Morocco, which trained about 10 people from one different country in Africa in genome sequencing. And this other is the case of training of experts that was handled at the University of Illinois in the US. This other one is the fellowship by IITA. This poster I see here, is apply here, is the advertisement for people to apply for that. That's the procedure AfricaBP uses. And they applied, they were selected, they went to IITA, they did the research work and learn in the process. And once they finish, they write up what they have done and the outcome of it, and follow it up until the data sequence is analyzed, properly sorted out, and then they write the publication, the paper that was published from that particular program. So AfricaBP has a very well-defined process that will end up with people just being empowered with the science and technology, as well as having the capacity to write into a very clear way for journal publication of what they have done. In conclusion, I wish to say that there is an urgent need to combat genetic erosion and promote biotechnology by activating active indigenous biodiversity conservation collaboration with AfricaBP. This collaboration is targeted at saving genetic resources from the growing threat of extinction, to facilitate acquisition of relevant technology-related infrastructure, like sequencing infrastructure, build capacity for active genome sequencing of indigenous species in Africa, and adoption of AfricaBP's biodiversity genomics model. In this proposed collaboration has great prospects for effective biogenome conservation of Africa's indigenous biodiversity. So we actually call on prospective companies, corporate bodies, and the institutions that have the capacity to raise the fund to identify people who have the potential to fit into these schemes, and then join AfricaBP in training Africans to have the capacity to sequence Africa's biodiversity. Thank you very much.
Thank you very much, Professor Usuji, for that very, very overarching presentation. Do we have any questions for Prof?
Anybody that has a question, please? Okay, it appears there's nobody here that has a question.
Okay. Okay, we have Lucky Nsengani from South Africa who has just joined. I wonder whether we can allow him to make a presentation.
Okay, that's fine. Seriously, can I help it?
Lucky, please go ahead, make your presentation. You can load your presentation now.
Okay, good afternoon, everyone.
Good afternoon, and thank you for joining.
I've been joining. I think I was supposed to talk 2 hours ago. I don't know what was happening. Let me quickly check. Okay, just give me a second.
I can see some hands raised. Jospin, please type your question in the chat. Don Bosco Jospin, you can type your question in the chat and we'll get to you.
Let me know if we can see my screen.
Yes, we can see your screen, and just make it presentation mode, please.
Thank you. Probably 10 minutes.
Can I go ahead?
Please do.
Okay.
In about 10, 12 minutes. Thank you.
Good evening. I hope it's evening on my side at least, and good day, everyone. I hope you enjoyed the talk, the workshop so far. I will just quickly rush through my presentation. It was designed to take 20 minutes, but I will try to compress it to 10 minutes. I will see. Just here to report on the livestock genomes references that some of the work that we've been doing so far in South Africa, specifically through UNISA Group, through the partnership with the AfricaBP. This project, part of the branch of the project, is done under the Nelson Mandela Genomes Initiative for Conservation, with the specific aim to understand the genetic basis of the Africa cultural and economically significant animal and plants. This is done through the effort of building the genomics capabilities within the continent that will serve the purpose of answering some of the questions that we had that include the food security, some of the challenges that we have, such as the biodiversity conservation, biotechnology as well, that can feed also in the medicinal purposes. This is relating mostly into the plants. Some of the work that we have done so far in terms of generating high quality reference genomes, we have managed to sequence at least 20 genomes so far. I was told that this week we can have more addition. They are finalizing some, the number will go up. Among this completed one, we have 7 that only have the PacBio Hi-Fi, and 13 of those have both the PacBio and the Hi-Fi Omni-C. This is just to take you through some of the method that we use. We generally collect fresh samples, can be the leaves or can be fresh blood from the animals that are put into dry ice, then transported to the lab for processing. We previously used to employ the SQL2, PacBio SQL2, and for Hi-Fi reads, and currently the Ingaba presentation did mention earlier on that we have partnered with them and we purchased the PacBio Review. So all the new genomes that are processed, they are done through the PacBio review. And for OmniC, we used to employ the NovaSeq 6000, but currently we also making use of the Onzo. These all equipment are available at Ingaba. In terms of some of the part of in terms of the sequencing I didn't include because I claimed it well good justice on that earlier on. He really touched bases on like well detailed on the processes involved in the sequencing. In terms of the genome assembly, after sequencing, we generally employ the genome scope to understand to do genome profiling, which is followed by assembly done through Hi-Fi system, then for scaffolding, sometimes with paging, then contamination, then followed by manual curation. This is just to give you the overview schematic of what we do in terms of the genome assembly. So just to report on some of the things that we have done, of the breed that we have done so far, we have sequenced the small stock in terms of the Nguni sheep, which are generally indigenous to Southern Africa region. They are well known to be well adapted to different agricultural regions, and they are the so-called the breed of choice when it comes to the smallholder or poor resource farming systems. And also we did the Nguni goat, which is also indigenous to the South African region. They are generally characterized by small body frame, multicolored and patterned glossy short hair coat. And they also have the exceptional tolerance to harsh environmental conditions. As well, we also did the indigenous pigs, the Coolbrook pig, which is an important domestic species, which is also comprised of a wide selection of commercial and indigenous breeds, regarded as one of the South African indigenous pig breeds, and it's well adapted to the region. This is just to show the characteristic of the profile of the genome that we did for Nguni, goat, and sheep. Just to see the genome size, mostly of them they are roughly averaging around 3 gigabytes. You can see the Coolbrook is about 2.6, and the Nguni goat is also about 2.8. The Nguni sheep as well, it's about 2.9 gigabytes. So they are averaging around, it's what we expected. And when you look at the other published genomes, so this is just the genome scope on average, as well as the genome scope, the completeness was above 95% completeness. And also this is to show the genome assembly stats for the Nguni sheep. How does it compare with the other published genomes out there? It's well comparable, and it looks like we did quite a good job. The quality is quite good, and the assembly stats is quite comparable with what it's all out there. This is the Nguni goat as well, and also looking at how does it compare with the others that are out there, and as well as the official genome reference of the Nguni goat. It's very much comparable, and it looks like we actually somehow we did much better compared to what is available there. So we are currently at the right track, and we're producing something of good quality. So also to look at the Coolbrook pig, the assembly stats, also we can say we are producing good quality high reference genomes that can also very much comparable to what is already out there. And also just to look at the cattle part, we have done the Nguni cattle, which is comprised of different ecotypes. The Nguni cattle, they're not complete here. We still have 2 ecotypes that we need to sequence. But we did the 3 that we finished now is the Pedi, Venda, and Shangan. They're all Nguni cattle. They are slightly different in terms of some of the phenotypic characteristics. Like there's an interesting study that was done, published recently this year, which compared the weight of the growth traits between the 3 ecotypes, where they reported that on average the Pedi sheep, the Pedi Nguni cattle, they have about a winning weight of above about 156 kg as compared to the 136 and 144 of Venda and Shangan. So all of these cattle, they are well known they have similar characteristics in terms of being adaptable to the environment and well tolerant to some of the problematic diseases that are endemic to the regions. We also included the Bonsmara cattle, the Thuli, as well as the Drakensberger. The Bonsmara cattle is a composite breed which is developed for commercial beef production. It was developed by Professor Bonsma at one of the research stations in Limpopo province here in South Africa back in the 90s, early 90s. That's where it got the name from, because it was developed by Professor Bosma, and it was done at Bosma, and it was done at Mara Research Station. That's where it comes, the name Bosmara there. It is well known. It's one of the most common breed in terms of the commercial beef production setup. They are well suited to a diverse environmental conditions and tolerant to heat and tick-borne diseases. And they are also known for high quality meat. Hence, they are well popular in the setup of commercial beef production. We also did the Thuli cattle, which is a dual-purpose breed originating from Zimbabwe, and it's well adapted to harsh environments. Well, the originating one, officially it says they originate from Zimbabwe, but there are other studies argues they differ, but officially we will state that it's the good thing, it's indigenous to the South African region, and it's also known for good maternal qualities, as well as the Drakensberger, which is a beef breed native to South Africa, well adapted to harsh conditions, perceived as dual-purpose breed and well tolerant to diseases. To report on the genome profile of the cattle that we did so far, the genome size, it's more of similar. We expect that they're running around 3 gigabyte, which is something that we see on average. It's around 3 gigabyte, which is something corresponding with the other reported cattle genome sizes out in the NCBI or in other publications. So this is for the Nguni ecotypes as well. They are also ranging around the similar line, and this is the BASCO assessment results, which is also we managed to accomplish at least above 95% completeness. So this is the genome stats, the assembly result for the cattle that we did so far. We are also seeing quite a good results, that it's well comparable out there. It's a good quality. I wouldn't dip much into this because of time. Also, this is the pretext map that we generated, and we also ran the annotation results. This is the annotation from the Nguni cattle, from the Nguni sheep, I meant so to say, and how it compares to the other 3 genomes that with the Rambolite, as well as the Who sheep and the Tibetan, and some of the repeat elements. We also did the repeat elements. I didn't report some of them here. Yeah, and also just to emphasize on the other future project, the one that we have so far, other genomes that we have the indigenous chicken, we have the big blind snake, we have the bush chi, we have bugle brush, the red cormorant, tilapia fish, we have the boer goat, savannah, as well as the Cape speckled. Some of the looking at the benefits, how does this come to play? We have seen the challenges that are associated with crossbreeding efforts, place that put the indigenous species at a vulnerable space, and then we run the risk of losing this good quality trait within the indigenous species. So crossbreeding also, we might have good intention when we're doing crossbreeding, but at the other hand, we are running the risk of losing the unique indigenous species. So we need to develop programs that will conserve these precious species. For this purpose, that is the reason why we aim to generate high quality reference genome, which is rather seen as the first step to realize these efforts. We hoping to emulate whatever the projects that are out there in order to address these issues. and also the potential for future research to unlock more benefits from African indigenous species genomics, and as well as how do we link the bioeconomy. We always advocate wherever we are to establish more collaboration, to work more together. I'm glad that most of the talks today were also emphasizing that we really need to find common grounds in order to collaborate continent-wise in order to realize these opportunities, and also to again call for the stakeholder support in terms of investing in support genomics research for a sustainable bioeconomy. So from the UNISA research target, from the UNISA research team, the target for this year, we are hoping by the end of the year, we will at least have 100 genomes completed. And also that should be finalized with both Omnisci and Hi-Fi. We are thinking that we should be on the right track. We are realizing that it's already May, but yeah, we are still optimistic that we will reach the target for 2025. Thank you. I had to rush through time because of time. I hope I did justice. Hello?
Professor Julian, will we have 5 minutes for one more presentation?
Right now, the line to be short now there in the next 5 minutes.
Okay.
Yes.
All right.
Another time. And the DVC also has another engagement. It's here to do the vote of thanks.
Okay, so I hand over the mic to you, Prof. Please go ahead.
Yes. All right, so please unmute me. Unmute me, host. Please unmute me. Can you please unmute me? And can you hear me from there? And can you hear me?
Yes, try unmuting yourself.
Okay. Yes. Okay. This one? No, this one. Good evening, everyone here, and those of you present and participating online, wherever you are in the world. I'm happy that I'm here in person to experience the difficulties that I've experienced over the past 2 days of the battery power, and I bring you the sincere apologies of the university management. So without much further ado, let me go through this prepared of science that we're using for this event. Distinguished guests, esteemed speakers, facilitators, participants, in person and online, ladies and gentlemen. On behalf of the Vice Chancellor, the entire management of the University of Port Harcourt, and the local organizing committee of the 2025 West African Regional Workshop on the African BioGenome Project, it is my honor and privilege to deliver these vote of thanks at the closing of this transformative event. We express our profound gratitude to the African BioGenome Project Consortium for the confidence reposed in the University of Port Harcourt to host this third edition of the Regional Open Institute Workshop. We especially thank the steering committee led by Professor Anne Mugai and our own distinguished Dr. Julian Osuji for the vision and leadership demonstrated in steering this continental initiative.
To our distinguished keynote speakers, resource persons, panelists from across Africa and beyond, we deeply appreciate your invaluable insights and the depth of knowledge you brought to this workshop. Your contributions have undoubtedly elevated the discourse on biodiversity, genomics, One Health, and the livelihood sustainability in West Africa. Special thanks go to the sponsors and partners, including Nkaba Biotechnical Industries, My Afro DNA, Claretian University of Nigeria, Illumina, AP Leventis, Ornithological Research Institute, and the many collaborating academic and research institutions for your unwavering support in making this workshop a resounding success. To our dedicated facilitators who delivered intensive hands-on training in molecular biology, genome sequencing, and bioinformatics, we sincerely commend your passion and commitment to capacity building. Your efforts have not only impacted practical skills, but also inspired a new generation of genomic scientists on the continent. We equally recognize and thank all participants, both on-site and virtual, who enthusiastically engage in the scientific sessions, exhibitions, poster presentations, and practicals. Your active participation is a testimony to the growing interest and capacity in genomics and biodiversity research in Africa. We urge you all to remain worthy ambassadors of the AfricaBP vision in your various institutions and countries. To the members of the local organizing committee, technical team, volunteers, and support staff, thank you for your dedication, planning, and seamless coordination throughout the past 2 weeks, I'll say, and for the remainder of this workshop. Your behind-the-scenes work ensure that every aspect of this program runs smoothly. Finally, we express our heartfelt appreciation to the Vice Chancellor, Professor Onari Ibrahim Chowdhury, for his strategic leadership and continuous support in championing research excellence at the University of Port Harcourt. We are proud of the part of this historical initiative. We are proud to be part of this historical initiative that is at the forefront of biodiversity conservation and genomic innovation. As we draw the curtains on this impactful event, we wish everyone safe travels and continued success in your academic and professional pursuits. May the seeds sown during this workshop blossom into collaborations, discoveries, and innovations that will shape the future of Africa's genomic landscape. I thank you all, and God bless you.
Hello, thanks so much, wonderful DDC research and development. Professor, do you have any commenting announcements? Anything to say?
Just to thank you all, to thank all the participants who attended today's workshop. We look forward to interacting with you in the various practical fora. So I encourage you all to look into your emails and see where you're supposed to be. And we look forward to seeing you tweet and put on LinkedIn about all the good things that you have learned. Thank you very much. Congratulations to the West Africa Local Organizing Committee led by Professor Julian. We look forward to seeing the story about the practical workshops as we continue to follow your stories on X and LinkedIn. Thank you very much and good wishes to all.
Thank you very much. And we have 9 locations across West Africa that hands-on practical trainings will be taking place. The University of Port Harcourt here, it will be at the Regional Center for Biotechnology and Bioresources Research. Some people have already been selected for that, and at the end of this session, we will probably look at those who are here. If there are people who have not come, then we'll look at those who are here that we might used to swap for this position. And please, you call on everybody. Dr. Komi Kokura, are you there? Dr. Komi Kokura, are you there? Well, you may have to get given the permission to unmute. So please activate the lab in University of Lome. We are going to have another one in Kwame Nkrumah University, Ghana. We have another one by AP Leventis laboratories. We have Kaba is going to have. So those who have been selected to attend the hands-on practical trainings in different locations, the 9 different locations in West Africa already know. But then there are 2. If any person is not able to attend, then they are free to nominate or allow those who are available to make up the numbers according to their strength, according to their current capacity. We thank everybody. This workshop is the symposium part that has just ended with this session. The hands-on practical continues from tomorrow, 8 to 5 every day till Friday, the 9th. And that is the total behind the workshop complete. I thank the Vice Chancellor of the Board, the DVCRD, and everybody who's here. Thank you. We'll see you again next year. Thank you very much. We got the person on the program. And please, we are want to straight ahead, but we go to the video part as you go to the video and the figure part. Thank you very much.